At Janssen, we are called to rise each morning and achieve today what last night seemed unimaginable. We are called to blaze paths where others fear to go, to unravel and repair the very code of life, to treat, intercept, prevent, and cure. We are called to open our doors to collaboration and our arms to the needs of each patient, so that what works in our labs also works in their lives. We are called to advance how medicines are made and made accessible around the world. We are Janssen, the pharmaceutical companies of Johnson & Johnson, and we are heeding the call. Bravely and boldly, fighting sickness with science, improving access with ingenuity, and healing hopelessness with heart, until the world's most daunting diseases are found only in the pages of history books. At Janssen, we're creating a future where disease is a thing of the past.
Purposeful technology inspires us. Science drives us. But our chief motivation for all the new thinking, all the breakthroughs, all the solutions, it's the people. The patients. Our customers. The ones who are looking to us now more than ever. They're the reason we strive to reimagine health for humanity beyond what's next. As a combined force of amazing talents surging forward with our promise, our innovative and agile spirit is fueled by an unquenchable desire to improve lives. Together, we are working to create smart, more personalized, and less invasive solutions for patients' exact needs. We're unleashing our broad expertise and bringing together our people and partners, informing with our global perspective and local market know-how. infusing science and cutting-edge medical technology with our own humanity and ingenuity, giving people the power to help them live their best lives possible. Connecting data analytics, human insights, and innovation empowers us to deliver bold, fresh solutions and experiences, and envision a world where the health journey is more personal and less daunting for patients. Digital-first solutions simplify what was once complex. Compassionate care, early diagnosis, and long-term health may eliminate surgical intervention. An equitable health system works to keep people well for generations to come. And a world where our healthcare partners are working efficiently and more effectively than ever before. Thanks to forward-reaching, seamless, interconnected, and accessible medical technology. We're working together to save, sustain, and improve lives, to ignite all that's possible in every body.
From the beginning, science has been at the front and center of everything we do, taking us to places we never thought possible. This is the adventure of what science can do. Science can change the way we see the world, change how we live our lives, make us pioneers. Science can impel us to take risks, share and collaborate. Harness data, technology and AI to accelerate change. Bring people together to achieve the impossible. Fast forward the future. Science can create novel therapies and vaccines, help people with chronic diseases live better, healthier lives. Redefine cancer care. Pioneer treatments for rare diseases. Prevent, modify, and one day, even cure. Make patients partners in their own treatment. Science can inspire us to keep doing incredible things. Give more and more of us access to healthcare. Transform the lives of billions of people. And unite us all around the single aim of improving lives and life chances. Science can do all of this ethically and sustainably. Leading the way to a low-carbon world. Making healthcare systems more sustainable and resilient. Being bold and ambitious to make people, societies, and the planet healthier. This is the limitless adventure of what science can do. This is AstraZeneca.
We're going to have a bigger impact. We're taking a broader view of the patient and everybody who's supporting that patient, the entire healthcare ecosystem.
The patient is changing, the way we interact with that patient is changing, healthcare is changing, and we all really need to be a part of that solution and really bring these changes to the forefront.
This moves us to a whole new level of patient care.
To know that my everyday action impacts every second a patient outcome is priceless to me.
I like knowing that what I do positively impacts people's lives.
All over the world, customers and their patients rely on BD to help improve people's health. Every day, every person at BD has a chance to make a difference. A chance to bring to life what we stand for: At BD, we are advancing the world of health.
Έχουμε κάνει σπουδαία πράγματα στο παρελθόν. Σήμερα κάνουμε σπουδαία πράγματα για το μέλλον. Για 130 χρόνια η εταιρεία μας έχει σαν οδηγό την πεποίθηση ότι τα σπουδαία φάρμακα αλλάζουν τον κόσμο. Στο επίκεντρο όλων όσων κάνουμε έχουμε πάντα την πρόληψη και δεν σταματάμε να προσφέρουμε ανακαλύπτοντας νέες θεραπείες που πραγματικά κάνουν τη διαφορά στη ζωή εκατομμυρίων ανθρώπων σε όλο τον κόσμο. Επενδύουμε στην έρευνα και ανάπτυξη νέων θεραπευτικών λύσεων στη χώρα μας σε συνεργασία με τους Έλληνες επιστήμονες, έχοντας πάντα στο επίκεντρο τις ανάγκες των ασθενών. Είμαστε περήφανοι για το παρελθόν μας και πολύ ενθουσιώδεις για το μέλλον μας. Στόχος μας είναι να δημιουργήσουμε ένα υγιέστερο, φωτεινότερο μέλλον για τους ανθρώπους σε όλο τον κόσμο. MSD. Inventing for Life.
Every crisis provides the opportunity for a breakthrough. In 1849, we made our first breakthrough, an inventive and groundbreaking way to treat parasites. We discovered how to get life-saving supplies to the Union Army. We broke through the barriers of mass production, making penicillin and other antibiotics accessible on a massive scale.
The life-preserving drugs known as antibiotics met the challenges of war.
And contributing to one of the biggest life-saving measures of the 20th century.
We're entering a new era of medicine in which the natural lifespan may be greatly expanded.
We fought polio with an oral vaccine, so millions of children could be children again. We innovated a needle that would be one of the key tools in eradicating smallpox.
The disease has been wiped off the face of the earth.
We took on some of the greatest causes of pain, illness, and early death and fought them with treatments that improved the quality of our hearts, bodies, and even helped the way we love. We harnessed cutting-edge science to create breakthrough therapies that help people with cancer live longer. And now, we have broken through the biggest health crisis of our time. Over 170 years of breakthroughs, and we're just getting started.
Χρόνια ΣΦΕ. 40 χρόνια συνεισφοράς και προσφοράς στον άνθρωπο ασθενή. Εδώ και 40 χρόνια προσφέρουμε σε όλους μια καλύτερη ποιότητα ζωής. Προτεραιότητα του ΣΦΕ και των εταιριών μελών του αποτελεί η βιωσιμότητα του συστήματος υγείας και η απρόσκοπτη πρόσβαση των ασθενών στις κατάλληλες θεραπείες για μια υγιή και παραγωγική κοινωνία. Επενδύουμε στην έρευνα, την καινοτομία και την παραγωγή, ώστε ο κάθε ασθενής να μπορεί να λαμβάνει τη θεραπεία που έχει ανάγκη την κατάλληλη στιγμή. Προσφέρουμε στην κοινωνία και στηρίζουμε τις ευάλωτες κοινωνικές ομάδες, έχοντας πάντα ως προτεραιότητα και την περιβαλλοντική βιωσιμότητα. Συνεισφέρουμε στην ανάπτυξη της εθνικής οικονομίας και στη δημιουργία νέων θέσεων εργασίας. ...1982-2022. 40 χρόνια συνεισφέρουμε και προσφέρουμε στον άνθρωπο και τον τόπο μας. ΣΦΕ. Σύνδεσμος Φαρμακευτικών Επιχειρήσεων Ελλάδος.
Good morning, everyone. Dear ministers, dear ambassador of the USA, dear representatives of organizations and bodies, dear friends of the the Hellenic American Chamber, we're very happy to welcome you here in the annual conference HealthWorld about the healthcare system in the fourth industrial revolution. This conference takes place under the auspices of the Ministry of Health, EFPIA, SFE, Pharma Innovation Forum, SAVE, and Metekiro. Thank you for your support. HealthWorld, via a 20-year course, has managed, as we all know, to have been established as one of the most significant health policy summits and conventions in Greece and in Europe. It's a platform for dialogue, exchange of ideas and good practices, and proposals in between all the stakeholders in the health sector that contribute to policy making. Ladies and gentlemen, as per the title of our conference this year, the aim of this meeting is to speak about the future of health in a changing world where the new technologies influence the work of all of us and the function of our professions. Recently, we've gone through a crisis that still is here. We hope not in the dimensions that it had in the beginning, but nevertheless, it showed the weaknesses of our health system, which, based on the experiences that we have and utilizing all the capacities of the innovative sciences and the digital technologies today, can be changed by us into a modern, more sustainable health system that will respond in the best way to the long needs of prevention and caring for the health of all citizens, at the same time responding to all challenges that might arise. In order to discuss about the health policies that are necessary and in order to exchange ideas and thoughts, the best platform is the HealthWorld Conference. We have invited distinguished guests from all the stakeholders so as to speak openly and transparently on all the issues and reach conclusions and proposals in a consensual way as it is necessary for our sector. So it is the opportunity this year to speak about practices, to utilize all the capitals that we have at hand and all the human capital that Greece has in domestically and in other countries, and to see how the technologies can help us to also touch upon the issues of demographics and data management in order to see how we can improve our system in the long run. I would like to thank our distinguished speakers from all the medical entrepreneurial communities and the associations that are going to share with us their experience. I would like to thank Mr. Akis Apostolidis, President, and the members of the Pharmaceutical Committee, Mr. Pagapkopoulos, and the members of the Equipment Committee of our chamber for their creativity and support. Thank you also the organization team, the professors Mr. Souliotis, Kyriopoulos, and Athanasakis, for their scientific support in the deployment of the agenda, in the creation of the agenda. And let me here make a mention to Mr. Yannis Kyriopoulos that has left us, a true friend for years. He was the scientific pillar of HealthWorld, and we missed him. The Chamber thanks the sponsors of the conference for their contribution, the Platinum Janssen Johnson Johnson medical devices, Golden sponsors AstraZeneca, ED BART, Mr. Maisquet, Medtronic, MSD, and Pfizer. Silver sponsors Albert Cabot, Caesar, Berking, EY, General Electric, Genesis Pharma, Gilead, GlaxoSmithKline, Mil Pharmaceuticals, Philips, Sanofi, and UCB. The media partner, the Athens News Agency, and the communication sponsors, HealthWeb, Iatronet, Medical News, News for Health. We thank you all for your support. Also, I would like to thank my colleague and project management of this conference, Mr. Tsalitzoglou, Mrs. Mamali, and all the people who have organized this conference. Ladies and gentlemen, we have a hybrid form in our conference today. We have online participation of certain speakers, and we are streamlined online. So I would like to ask all of you to keep the times as much as possible. And let me lastly thank all of you who came here today and all of you who watch us online for honoring us with your presence in one more event of our chamber. Let me give the floor to Mr. Nikolaos Bakatsellos, President of the Hellenic American Chamber. Distinguished Mr. Ambassador, dear Mr. Ministers, dear guests, ladies and gentlemen, dear friends, I would like to welcome you in the 21st Annual Conference organized by the Pharmaceutical Products Committee and the Diagnostics and Equipment Committee of the Hellenic American Chamber. After the work of these two committees, the HealthWorld Conference has managed to be established as one of the major annual events of our chamber and an establishment for the health sector in our country. This is not accidental because for more than 20 years now, HealthWorld has attracted leading personalities of the political and scientific communities and the academic communities as well as entrepreneurs in the health sector in Greece and internationally. HealthWorld pinpoints the challenges that health sector faces in Greece, and as a major dialogue platform facilitates the submission of ideas and the promotion of solutions aiming at the amelioration of the quality of life of patients and the improvement of the health sector. Essentially, it is an innovative activity of the Chamber, a very influential one that contributes to the upgrade of the quality of the national health system. Bringing together regulatory authorities and the organizations and companies that work in the health sector in Greece and abroad, we create a sustainable roadmap and we propose policies for a sector which is important for the lives of all of us. Ladies and gentlemen, after the Russian invasion in Ukraine, the discussion about the pandemic is not our top priority anymore. The health crisis seems very small in front of the geopolitical and energy crisis that we see. However, we have a big bet in the health sector because the pandemic has left its mark in all aspects of our daily life. Apart from the deaths that we counted, the financial, economic, and social impacts have to be in our long-term discussions. What we learned from the pandemic, we learned that the health system has to be anthropocentric and very well shielded and prepared for the unexpected at every moment. The pandemic also reminded us some important things, for example, that trust to science, trust to medical professions has to be supported via technological research, education of the citizens, and political priorities. A national health system and a strong health care has to be at the spear for our promotion of the high quality personnel work and the high quality of protocols that our medical professionals utilize in a collectively responsible manner for a better health for all. Ladies and gentlemen, HealthWorld 2022, focusing on the impact of the fourth industrial revolution on the health sector, approaches globally the recent changes in the health area after the crisis of 2 years. The need to promote new communication schemes in between professionals and medical professionals and clients and patients is at the focus of our next systems in the health sector. In the 2 years of our conference, we're going to have the opportunity to listen to important lectures, have the important discussions regarding the reforms of the health sector and the revolutionary developments in the technology of our sector. We need to create further motivations in order to attract more investments and encourage entrepreneurial initiatives that will contribute to a sustainable medical ecosystem by promoting the new developmental model of the country, the growth model of the country. Ladies and gentlemen, in conclusion, I would like to wish that we all get the maximum from these 2 days of our conference, thanking everyone who has contributed to this organization. I hope that this conference is going to be a good platform for dialogue between all the stakeholders in the health sector to the benefit of our society and our citizens. Thank you very much for being here. Mr. Apostolidis, you have the floor, President of the Committee of Pharmaceutical Products. Dear Minister, dear Mr. Ambassador, dear guests, ladies and gentlemen, on behalf of the Pharmaceutical Committee of the Hellenic American Chamber, it is my honor to welcome you all today here in one more HealthWorld conference. This is a conference that for more than 2 decades follows closely the developments in the health area and attract all the significant actors, agents of this system, politicians, academics, the industry, regulatory organizations, and all bodies to exchange ideas and take the best decisions regarding policy making to the benefit of the patients. Allow me to stress that we have differentiation in our conference this year because nobody could be here if we didn't have the pharmaceutical innovation that managed to give us the opportunity to come to normal rhythms in our lives after the pandemic. Ladies and gentlemen, the data from pharmaceutical innovation in dealing with the pandemic are very important. The first COVID-19 vaccine was approved and used in less than 12 months from the initiation, the commencement of the pandemic. In the world, we have 7 approved vaccines. 3 billion people on the world have received at least one jab against the COVID-19. According to research, the vaccines have saved approximately 20 million of lives in 1 year. Remembering the Spanish flu, we had more than 5 million deaths in 1920s. Via the licensing schemes, we have 381 corporations globally to produce vaccines. We have approved treatments for COVID-19 at the European and the international level. So, ladies and gentlemen, the pandemic has set the agenda for health for the people and has made it an important discussion for the public agenda. Today, all the European countries update and reform and support their health policies in order to meet all the challenges, daily challenges, and the increased needs of their patients. They shield their health systems for future challenges, and they recognize the significance to have a steady framework for medicines and medical innovation. Unfortunately, the funds for medical care and drugs in Greece are not very high, while they are costly for the end user, and they are not seen as a leverage for growth and development of the society. However, this would be important for the benefit of the patients. However, the pharmaceutical expenditure is undermined by weak policy making. So rebates are the main tool that the pharmaceutical companies have in order to respond to this challenge. This deviation is further strengthened due to the measures that the government has recently taken regarding clawback and rebate, and introducing the outpatient expenses, which increase the rebate amounts, especially in the chronic illnesses or serious illnesses. The pharmaceutical industry, on the other hand, continuously promotes proposals for the improvement and the betterment of the pharmaceutical environment, so that the companies can thrive in Greece instead of striving. The clawback amounts of today has to be structured in a way that can support funding for the coverage of the true needs of the clients, of the patients, by the pharmaceutical companies. Our organization has suggested several proposals as for the innovative drugs that some pharmaceutical companies have for rare illnesses. The proposals are a single uniform system to balance obligatory compulsory rebates for all medicines, justice for all categories of drugs, a ceiling, a cap for rebates, and recognition of innovation in the negotiations that take place. Control of overconsumption by taking specific measures. Yet we haven't seen any. We expect the minister to comment on this. 2 million are asked from within the Ministry of Health to be reallocated in other appropriations in order to see how to tackle the cost of increased funding. Increased funding for 2023 based on the GDP indicators, and finally, no more retrospective character of these measures, because we are called to rebate amounts from previous years. The health sector has to undergo reform by uptaking several measures, by embracing digitalization, healthy competition, and the capacity to give the patients the capacity to access innovative treatments. This is to the benefit of all all patients and the society. It is important to have further funding for the health sector outside from the public purse by developing proposals. So we do not ask the states to provide these monies for the further development of clinical trials that will bring about new resources and new methods. So in the fourth industrial revolution, which is the title of our conference, we will have the opportunity to speak today and tomorrow on all these matters. So I wish that we will have a very good conference. Thank you for being here. Now the President, Mr. Theodoros Zakopoulos, of the Medical Equipment and Diagnostics of the Committee of the Chamber to take the floor.
Minister, Your Excellency the Ambassador, ladies and gentlemen, I should also like to welcome you to the 21st HealthWorld, entitled The Healthcare System in the Fourth Industrial Revolution in Greece. A big question which needs to be answered during these 2 days is just how ready is the Greek health system to receive and accept this industrial revolution? A strong and powerful economy requires and needs a strong, reliable and effective healthcare system. It needs flexible structures, appropriate skilled healthcare professionals whom we actually have within our system, and it will most definitely need new technology, innovative technology, which will give solutions for the citizens' health by saving up on resources. Unfortunately, we're at a time in which all healthcare systems the world over are at a very difficult position. Budgets are unable to meet the challenges of the times. So our own healthcare system that is being underfinanced over the past 10 years is certain to be bound for difficult times, hard time, choppy waters in 2023. Our position as medical technology and medical technology companies is that we will need to find those sweet spots that will allow us to save resources within the healthcare system which we are operating in for all these years. It's impossible to ask for money that will never come. So in my introductory remarks, I will focus on 3 things that need to be done, need to be performed, for us to have a more flexible and reliable system at hand. First of all, the time has come for Greek hospitals to own the digital transformation they deserve. Utilization of digital tools throughout the structures of the healthcare system, starting from the primary healthcare, which we've been discussing about for all these years, with reliable diagnostic methods, and moving on to clinical and interventional effectiveness is something that we actually need to do right now. Terms such as telemedicine, teleradiology, robotic surgery, self-diagnosis, virtual training, are things that in other countries are already reality. They're already happening. We need to introduce them into our system and thus save resources through the upgrade of this technology. For this to happen, the second point we need to focus on is the collaboration of public and private sector agencies. It is luckily, unfortunately, something that this government has started working on, but it is impossible for these technologies to be available in the private sector and for us to be incapable of having a collaboration which would allow us to bring this technology in the hospitals, the public hospitals of the country. Third point, equally important, is to introduce into the Greeks' culture prevention for all diseases that are tormenting citizens the years over. Such an initiative has already been undertaken over the past 2 years. It's called Anassa Zois, Breath for Life. It is a collaboration between the Pulmonology Society, the Greek Health Ministry and various other stakeholders that focuses on the prevention of lung cancer. It started in 2021. In 2022, a charter was drafted that is signed by various stakeholders in order to enlarge prevention for lung cancer and make it accessible to all citizens. In 2023, we are planning on organizing various screening centers to allow tests for lung cancer. It is something that will expand to cover other diseases and other forms of cancer. We firmly believe that prevention is indeed the way to save resources within the healthcare system, to shield the health of our fellow citizens and enhance the national healthcare system without creating problems that would be irreparable. We as medical device companies who are investing in the field of health over the past 20 years will keep on helping this government as well, but also all stakeholders and agencies within the national healthcare system to allow citizens and patients to rise to the level we deserve here in Greece. I should like to thank you very much for your attention, and I would like to invite Nikos to take the floor. Κυρίες και κύριοι, αποτελεί χαρά και τιμή να προσκαλέσω τον πρέσβη των Ηνωμένων Πολιτειών της Αμερικής, κύριο George Τσούνις, για να απευθύνει ένα σύντομο χαιρετισμό. Κύριε πρέσβη. Thank you, Nikos. Good morning. It is indeed a great pleasure and an honor for me to be here with you because the work you're doing over these 2 days is indeed very important. Και σας εύχομαι το καλύτερο. Θεωρώ ότι δεν υπάρχει τίποτε πιο σημαντικό και από το σύστημα υγείας μιας χώρας. Ο γυράσκον πληθυσμός του πλανήτη, ειδικά στην Ευρώπη και στην Ελλάδα, είναι πολύ σημαντικά θέματα. Οι προκλήσεις γίνονται βαθύτερες. Στο μέλλον εσείς, η βιομηχανία, είναι που θα δώσει τις λύσεις και πραγματικά είμαι σίγουρος ότι θα μπορέσετε να εγερθείτε στο ύψος των περιστάσεων όπως έχετε ήδη κάνει στο παρελθόν. Οι αρχαίοι Έλληνες είναι αυτοί που είπαν ότι είσαι αυτό που έχεις κάνει ανέκαθεν. Δεν είναι οι συνήθειές σου, είναι το ήθος σου. Επομένως, πραγματικά χαιρετίζω μια βιομηχανία η οποία έχει εργαστεί αόκνος προκειμένου να θεραπεύσει ασθένειες και να βελτιώσει τη ζωή για ολόκληρη την ανθρωπότητα. Σας ευχαριστώ. Θα ήθελα να εκφράσω το πόσο χαρούμενος είμαι, το πόσο χαίρομαι που συμμετέχω σε αυτό το συνέδριο. Θέλω να ευχαριστήσω τον Ηλία και τον Νίκο που διοργάνωσαν αυτό το συνέδριο και που πραγματικά έχουν προσκαλέσει ομιλητές σε πολύ σημαντικά θέματα. Η πανδημία είναι αυτή η οποία προώθησε την εξέλιξη πολλών τεχνολογιών και αυτό δεν γίνεται σε κενό. Χρειάζεται ανθρώπους οι οποίοι θα είναι υπέρμαχοι αυτού. Η ελληνική κυβέρνηση είναι από τις πρώτες χώρες που υιοθέτησε το ψηφιακό συμβόλαιο. Το εμβόλιο, με συγχωρείτε. It's incredible. In the States, I used to have a piece of paper and I came to Greece and it was digital. Εδώ λοιπόν πραγματικά είναι τα πάντα ψηφιακά, σε αντίθεση με το πώς ήταν στις ΗΠΑ και πραγματικά με δουλεύουν γι' αυτό στο Υπουργείο Εξωτερικών. Αστειεύομαι. Είδαμε, εάν κάνουμε ένα βήμα πίσω από τα προβλήματα υγείας για ένα λεπτό και δούμε τον τουρισμό, θα πω ότι πριν από λίγο καιρό στην Αμερική άναβε στο CNBC, το CNN γύριζε στο κανάλι και κορόιδευαν την Ελλάδα. Η Ελλάδα απειλείται με εκδίωξη από την Ευρωπαϊκή Ένωση. Την τελευταία φορά που κοίταξα όμως, η αύξηση του ΑΕΠ στην Ελλάδα σημείωνε αύξηση της τάξης του 8,3%. Το μέσος όρος ήταν 7,8% και νομίζω ότι το τελευταίο τρίμηνο της Ελλάδος θα σπάσει όλα τα ρεκόρ και νομίζω ότι θα έχετε δεύτερη υψηλότερη αύξηση του ΑΕΠ στην Ευρώπη για δεύτερη χρονιά. Και πραγματικά αυτό θα σας επιτρέψει ίσως να βρείτε έναν τρόπο να αντιμετωπίσετε το πρόβλημα της ενέργειας το οποίο ταλανίζει ολόκληρη την Ευρωπαϊκή Ένωση. Αυτή τη στιγμή η χώρα μετατρέπεται σε μια μεγάλη δύναμη, οικονομική δύναμη του 21ου αιώνα. Είναι ένας σημαντικός και αξιόπιστος εταίρος των ΗΠΑ με στόχο την επίλυση των προβλημάτων της περιοχής. Πραγματικά είμαι ευγνώμων για την υποστήριξη που λαμβάνω από όλους τους Έλληνες και από την ελληνική κυβέρνηση. Και πιστεύω ότι οι διμερείς σχέσεις εξακολουθούν να βελτιώνονται ακόμα περισσότερο. Ο κόσμος λέει ότι αυτό που λένε είναι ότι είναι οι καλύτερες σχέσεις από ποτέ. Well, I can assure you the best days are up ahead. Από τις προκλήσεις έχουμε ευκαιρίες. Πρέπει να συνεχίσουμε να μπορούμε να προσαρμοζόμαστε στις συνθήκες που δημιούργησαν οι κρίσεις, οι αλλεπάλληλες κρίσεις. Η COVID είναι κάτι το οποίο μας έκανε να συνειδητοποιήσουμε ότι είναι απαραίτητο να αλλάξουμε και να προσαρμοστούμε προκειμένου να έχουμε ένα καινοτόμο σύστημα υγείας. Η βιομηχανία εξακολουθεί να βγαίνει μπροστά και να βοηθά τις κυβερνήσεις να ξεπεράσουν όλες τις προκλήσεις τις οποίες αντιμετωπίζουν οι κυβερνήσεις. Οι ερευνητές έτρεξαν με πολύ γρήγορους ρυθμούς την ανάπτυξη νέων θεραπείων. Η Pfizer, με επικεφαλής έναν κύριο που ξέρετε όλοι από την Θεσσαλονίκη, μέσα σε 9 μήνες βρήκε καινούριο εμβόλιο σώζοντας κυριολεκτικά δεκάδες εκατομμυρίων ζώων. Με πολύ απλά λόγια, προκειμένου αυτή η καινοτομία να ανθίσει, χρειάζεται ένα υποστηρικτικό περιβάλλον στο κομμάτι των ρυθμιστικών αρχών. Χρειάζεται οικονομικές σχέσεις οι οποίες θα επιτρέψουν στις εταιρείες να αναπτυχθούν. Όλοι οι πολίτες, όλοι οι άνθρωποι, όχι μόνο στην Ελλάδα, όλοι οι πολίτες, όλοι οι ασθενείς αξίζουν, αν θέλετε, πρόσβαση σε ένα πολύ καλό σύστημα υγείας. Και είναι ένα δύσκολο πράγμα. Και είναι ένα δύσκολο πράγμα να μπορέσουν όλες οι κυβερνήσεις να προσφέρουν ένα τέτοιο σύστημα υγείας και μάλιστα σε προσιτές τιμές. Είναι μία από τις μεγαλύτερες προκλήσεις που έχει να αντιμετωπίσει όχι μόνο η δική σας κυβέρνηση, αλλά όλες. Και εδώ είναι που παίζει τεράστιο ρόλο η βιομηχανία. Γιατί η καινοτομία που είναι απαραίτητη δεν πρόκειται να επισυμβεί χωρίς σημαντική βοήθεια, χωρίς σημαντική συμμετοχή από τον ιδιωτικό τομέα. Θα ήθελα να μιλήσω για την εκπροσώπηση, να μιλήσω για τη συμμετοχή μάλλον του ιδιωτικού τομέα και είχα την ευκαιρία να μιλήσω με πολλούς εξ αυτών. Είχα την ευκαιρία να πάρω πρωινό με εκπροσώπους των φαρμακοβιομηχανιών εδώ στην Ελλάδα και πραγματικά εντυπωσιάστηκα από το βάθος και το εύρος των γνώσεών σας, τη δέσμευσή σας στους στόχους της Ελλάδος, τη δέσμευσή σας στους στόχους της βιομηχανίας σας. Έμαθα πολλά, είμαι ευγνώμων γι' αυτό. Και πραγματικά ελπίζω αυτή να είναι η πρώτη από πολλές συναντήσεις που θα έχουμε στο μέλλον, διότι αυτό θα καταστήσει την πρεσβεία περισσότερο ενημερωμένη ως προς το πώς μπορούμε να βοηθήσουμε την βιομηχανία εδώ στην Ελλάδα. Το έργο το οποίο επιτελείται βοηθά τους Έλληνες ασθενείς. Τελεία. Θεραπείες που σώζουν ζωές από ασθένειες όπως το Πάρκινσον, το Αλτσχάιμερ, γονιδιακές εξετάσεις, ανάπτυξη θεραπείων για την αντιμετώπιση του κορονοϊού. Αντιλαμβάνομαι ότι το σύστημα υγείας αντιμετωπίζει πολλές προκλήσεις και δεν υπάρχουν εύκολες και γρήγορες λύσεις. Αλλά οι καλύτερες λύσεις είναι αυτές οι οποίες είναι αποτέλεσμα της στενής συνεργασίας μεταξύ κυβερνήσεων και βιομηχανίας προκειμένου να σώσουν ζωές. Θα πρέπει να αξιοποιήσουμε αυτή τη συνεργασία για να ενισχύσουμε την έρευνα και την ανάπτυξη προκειμένου να μπορέσουμε να βρούμε τις θεραπείες θαύματα του μέλλοντος, την ίαση οπωσδήποτε θεραπείων. Χάρηκα πάρα πολύ που είδα παλιούς φίλους, που έκανα καινούριους φίλους και θα ήθελα να πω ότι θα πρέπει να δούμε περισσότερες κλινικές μελέτες, περισσότερη εξειδικευμένη έρευνα στην Ελλάδα και τη δημιουργία νέων θέσεων εργασίας που θα επιτρέψει στους ταλαντούχους Έλληνες να κάνουν σημαντική έρευνα. Χαιρετίζω όλους όσοι βρίσκονται εδώ και οι οποίοι θα περάσουν τις επόμενες 1-2 μέρες σκεπτόμενοι και δρώντας δημιουργικά ως προς το πώς μπορούμε να αντιμετωπίσουμε αυτά τα θέματα με δημιουργικό τρόπο. Θέλω να ευχαριστήσω έναν έκαστο εξ ημών για τη συμμετοχή σας σε αυτό το συνέδριο και για την πραγματικά εκπροσώπηση αυτού του σημαντικού κλάδου. Ευχαριστώ πολύ. Ευχαριστούμε πάρα πολύ, κύριε Πρέσβη. Well, HealthWorld, without the presence of the Minister of Health, is unimaginable, and I would like to thank the Minister, Mr. Thanos Prevlis, for embracing this institution from the very beginning, and I should like to invite him to take the floor for a brief greeting. Minister? Thank you so very much, Mr. President, Your Excellency the Ambassador, Mr. Chairman of the committees. We had this very interesting breakfast. And, Mr. President, I really missed the breakfast at home because it was rather more intense, the breakfast we had today, so mine are more peaceful. Right, so before greeting and saluting this discussion and the conference, we need to acknowledge the challenges before us. With the end, so-called, of the pandemic and the completion of the pandemic and the bets and the issues we have in the future. So this is very important for Greece for the following reasons. Because the pandemic found us after a 10-year financial crisis where all sectors in health had problems in underfinancing and in understaffing even. And so we managed a pandemic with a national healthcare system that had just exited these conditions and with an industry that bore the problems of this past decade. And right when we believed that this would be the year where we would really have the focus of our finances and to correct these problems we have in health, we found ourselves in the energy crisis. So it does not mean that this government needs to secure the funds to actually make it happen, because everything depends on the energy crisis and it's not easy. And all this happens within an environment in which we have problems with regulatory issues and things are stuck. They haven't moved forward. Without underestimating what has actually happened over these past 10 years, in the part of health, we had and still have clawback, which is a central problem that needs to be faced by the pharmaceutical industry. We didn't have any structural measures because we always had the safety and the security that whenever we had a closed budget, no matter how much we go over it, we'll get the money back. So it's not as scary to take the regulatory and structural measures we need, until such time as the problem became gigantic and needs to be dealt with. Now, I will start on two levels. One part has to do with drugs and the second has to do with materials and health in general. In the reform part, and we have here Mrs. Diamantopoulou, who is one of the politicians who has linked her name with reforms very closely, and she knows very well when we're trying to do a reform, when everyone says let's do it, people will be hurt at the end of the day. And when people are hurt, we're trying to see whether the reform will actually happen or not. And this, for me, is the pivotal point where we need to focus on. We're experiencing this in primary healthcare. It's something which you know very well, even if you do not come necessarily from the primary healthcare system necessarily. But in other countries, we have a doctor who is a point of reference for people, and it's linked with health economics as well. So in essence and in principle, everyone will agree, but once we try to establish this institution, people in situations are hurt because doctors, in essence, prefer the regime as it is now, the status quo, where there is no organized primary health care and you can easily resolve something by going to your doctor's private practice to resolve your problems, and they feel like some of their interests may be hurt, because they will need to enter into a contract with AOP where regulation will happen, or financially they will need to deal with things in different ways. So this institution needs to be supported, and this is what we do, and we already have 4 million registrations with 36,000 doctors, and I believe that by the end of the year we'll have sufficiency of doctors for more people to join the platform. The same goes with pharmaceutical policy. 2,088 million for out-of-hospital retail, 528 million for in-hospital expenses. What happens to those with those budgets? Well, these budgets, if we look at them sincerely, have 3 levels. Are they low? Yes, they're low. They are low budgets. Is there overconsumption than required? Yes, there is more consumption than required. Do we have the structural measures to know how much actual consumption is? No, we do not. So how are we trying to deal with this? One thing which is very pleasant is that when the digital tools that we will be acquiring very soon in health, and yes, we're close in doing that, this is a reality. At the moment, the fact that we have approximately 250 million available for the medical file, the digital medical file and the digital upgrade of hospitals is a very important thing that, yes, we will see happen very, very soon. We believe that the awards will be completed by the first 6 months of 2023, so by the end of 2023 we'll be talking about their implementation. And as we said last year, these benefits will be reaped in 2024. At the same time, however, actions need to be taken that are conducive to all three directions. So regarding underfunding, things have already happened. There was something that happened when the vaccines were out of the budget. We have the beneficial clawback, in which part of the clawback may be reinvested by the companies or actually receive it through investments they perform. And yes, it is a question. The budget for 2023 in drugs will follow the increase of the country's GDP. So in the draft budget for health-related issues, we will have an increase that will be calculated on the basis of the projected GDP. At the same time, we have a target that has to do with the reduction of clawback. And if it's not achieved, at the same time, we have the 50 million clause of the country. And we believe that we will avoid that and we will actually make it happen. We broke down the budgets, and something that I mentioned in last year's table. I believe in this. It is a policy that I want to take it up on me, because if we have closed budget per category, we force the expensive categories to enter into negotiations, which they didn't, and give the discounts that we can get. And in my opinion, although at the first stage this may be shocking, you may find this shocking as companies that are innovative, you need to, compare this with distortions we had in 2010. And with more rational solutions to know what the budget is, if this budget needs to be enhanced, to enhance it, and we've already said that there will be enhancement of 60 million through the transfer of funds, and from the effect, some of the benefits and the profits they have will allow us to reach a number that is very close to the number that you had mentioned as a necessity. At the same time, you should know that we are enhancing the budgets, increasing the budgets, and then we move on to the negotiations. Let's go to consumption. Now, fewer things have been done there, and it was reasonable because, in the midst of the pandemic, our priorities were different. Now, we have removed from the AOP the 10 most expensive categories. By the end of the year, we want, to be exact, by the end of November, to have treatment protocols, and the AOP has already sent prescription indicators for a series of other categories to Ithaca in order for them to be introduced. So we're trying to touch on consumption, which is the big problem of the country. Because our big problem is not that much pricing, which drops to very low levels as a result of rebates and clawbacks. It's overconsumption. So that's our goal, that's our target. We have the categories, we have absolutely no problem to mention them. It's a demand of the industry that you represent, that we need to have clear protocols for innovative drugs to be received by those who really need it, so as to avoid overconsumption in innovation. Innovation is referring to expensive drugs. So we're moving in this direction, and it will actually yield results. Another series of requests. The President saw that in the morning discussion we had, I took out of my pocket the piece of paper I had last year and said, what we'll do this year. And many of these things were not pleasant. But all the things we said happened almost in their entirety. So another thing is that, yes, we do have low treatment value drugs, which, got a big part of the budget. And I'm talking about vitamin D, from 45 million closed, went to 10, magnesium, dropped to 8 million, And similarly, a category of drugs that completes the ministerial decision that will leave the positive list and will go into the negative list because we don't think that they have the treatment value that needs to be reimbursed. And here, I apologize for taking up too much of your time. I would like to mention 3 points because I accept criticism and I understand criticism. You represent companies and you are under pressure from your companies from abroad. But this is a health minister who took 3 measures that were not easy for any politician. First of all is that the uninsured enter the public structures. Going to the people and say that you can go to the public structures. Why? Because I need to open the drug expenditure and to be criticized because by saying that you're doing this for the pharmaceutical industry to gain money was unfair. And it is unfair. It was a logical thing to do because there were, well, undeclared expenses that were not open for the Greek citizens. So it was a very difficult policy that in depth of time will have a benefit of 120 to 130 million per year. Now we'll probably have 30 or 40 million benefit in the first semester. It's been on since July the 1st. And the second very difficult policy is that although the previous government had decided that in drugs under negotiation there will be a reduction of the participation of the patient by 50%, we said that this burdened the pharmaceutical expenditure of AOP cannot hold, and we returned the participation to the levels we had. Now we have an equalization of the retail price with the insurance fund price, and we know that there will be a small burden in very few categories, and I'm saying this to showcase that on behalf of the state, of the government, we didn't try to hide behind the problem. Believe me, the easiest thing 6 or 7 months before the elections is to leave things as they are, to let sleeping dogs lie. You will have the same rebate you had last year. But this shows that we really want to get into the problem, we understand the problem, and if we have wrong approaches that the splits was not corresponding to the reality, we didn't have any inhibition to correct it after the discussion we had with you. So we need to look into the problem. And in this problem, the states, the pharmaceutical industry, and those who consume these services will have to shoulder the burden. And within this framework, I want to be optimistic. I will repeat what my dear friend, His Excellency, the Ambassador of the United States, to say, that the field that we have in the country and the development that will come is ahead of us, and it will be a rather difficult year. And in this difficult year, we will set rules that are linked to the burden created by clawback, by controlling consumption, and by supporting the budgets, which is the immediately next step. And it's certain that if we didn't have the energy crisis, things that have already announced, like supporting the uninsured, or supporting the budget in other targeted parts, or removing drugs that were used for the pandemic, they would have been implemented, for sure. But we're here to speak frankly and honestly. From the moment that we had different conditions, we had to prioritize differently and very, very fast. These things, in discussion with the Ministry of Finance, we will correct them as soon as possible. In terms of medical materials, we have already announced a series of central tenders. We believe in these central tenders, and in drugs we had several central tenders, public tenders. And now is the time, Mr. President, to implement the same thing with quality criteria. We set quality as a key priority because we want Greek patients to receive the best possible material and the best possible drug at the best possible price. And that was an objection we had as to how the minister sees you like investors or as costly parties. The Ministry for Health is interested in receiving the best product and the best price, for the best price. It's not the job of the Minister of Health or the Ministry of Health to do the investment work. It's the work of other ministries. We want to ensure that Greek patients will receive the best drugs at the best possible price by respecting the Greek taxpayers' money. It's the Greek taxpayer who pays for these drugs and for these materials. So it is with these thoughts, and knowing full well, Mr. President, that this discussion is being conducted under a heavy climate, primarily for the companies that do have innovative drugs that happen de facto to be the expensive ones and enter a closed budget that is more strictly controlled and with bigger burdens. I believe that these first measures, this first package of measures of the first year that I'm the head of the Ministry of Health, was like a firefighting attempt. So we're trying to enter into the structural measures, and we believe that with the support of the budget and the structural reforms and everything, we will have this framework that will allow you to be in a condition to say that we finally can see things and that we are not just watching a clawback grow ginormous. Thank you very much for your attention.
Thank you, the Health Minister, for what he has shared with us. Both the committees and the Chamber, I can assure you, Mr. Minister, that I have been beside the Ministry with their good practices, the know-how that they possess in order to contribute to your policy-making methods. Thank you for being here, and let's now start with the main part of our agenda. We are very honored to have with us Ms. Anna Diamantopoulou, high-level group of the European Commission for Social Protection and the Welfare State. Also president of Diktio, the Network for Reforms in Greece and Europe. She's going to speak about the European perspective on the reforms in health. Mr. President of the Chamber, dear guests, thank you for the invitation in this conference, which is a well-established institution for the health sector. Ladies and gentlemen, I'm going to speak as the president of the committee that deals with the reform of the health status, and also under the hat of the network, as the president of the network, Diktio, which deals with the digital transformation of the state in all aspects. When we speak about social state, we speak about all the sectors like education, health, social policy, integration of minorities, etc. Health is one of the major discussions in Europe and in Greece as well. Everything changes in the economy nowadays. The economy cannot function in the way that it used to. New needs are here. People have new needs due to the wars, due to the energy crisis, due to the difficulties that people face in their daily life. Let me say that my team works under 4 major mega trends that influence the social state, and their impacts have to be dealt with via different policies. Digital change, climate change, the demographics throughout Europe, and number 4, the changes in the labor market. This is also something to deal with throughout the industrial sectors and the pharmaceutical industry. The mixed new professions and the new skills necessary. We are going to consume these to conclude our work in 2023, and we're going to publish it. The catalyst for all the systems is the digital transformation. And of course, the health sector is one of the most important systems of a social state, where digital transformation means that we have more and better services for the citizens on a personalized way with at a lower cost. Let me share with you first what goes on in Europe as regards to digital health. We know that health is under the portfolio of governments, but for several years now, the health services of the European Commission, in cooperation with its member states, provide suggestions. And of course, we have a lot of European programs that provide funding. From the previous decade, we started preparing ourselves for digital health in Europe, mainly focusing on the matter of on stock taking data in the hospitals, utilizing this data for research and managing the scheme. The most recent program at the European level is EU for Health. It is a program that has been established by means of a regulation. It has as its first priority everything that regards digital systems, the support of health data, digital tools, and digital transformation practices. The European Regional Program of the World Health Organization in last September, set as its first priority the digital transformation of the health sector. Essentially, the utilization of the tools of the fourth industrial revolution to the benefit of health. Of course, you understand that my references are very brief. We have to understand that the fourth revolution is a priority for the health sector, which accelerates day after day, and we can't stay behind. The innovation that you mentioned and the challenges that we face in this area can be seen in many European countries. Europe has many innovations and many innovators. The Innovation awards given every year in the industries are given mainly to health initiatives. The new scientists that receive the awards present new methods or services for health issues. What is important is that these startups or the small companies or ideas do not expand on European territory, but they go to countries where the systems are more flexible. So there they can transform the startup into a big business that produces products. The last thing to say on the European Union work is that there are many differences, of course, in between the states, but cooperation and collaboration helps all member states. Europe can provide can showcase the better health systems on the planet, which cooperate with major academic and research institutes. Finland, for example, has film data which licenses metadata for research on health issues. This is of course, from drug research, but yet it hasn't been regulated at a European level. GDPR is a global regulatory framework for data. Europe was the leader in safe cross-border verification of personal health data via the COVID experience. Given the fact that 700 million of COVID certificates, were produced during the pandemic. Also, the Resilience Fund and the Recovery Fund has two major priorities for all countries: climate change and digital change. All the programs in all countries have to fall into these two categories, and that's where the money will be channeled. So at the European level, we do have the examples, we have the suggestions and recommendations, and we have the cooperation in between the countries, and now we have the funding. As regards our agenda and the national health system and its challenges, let me say that an initial starting point is that digital transformation or Broadly, the fourth industrial revolution in the health sector is considered by experts as a very beneficial move because it combines many technologies, robotics, algorithms, artificial intelligence, genetics, molecular biology, nanotechnology, 3D printing for all parts of the body, bones, capillaries, etc. And it covers the whole spectrum of people's lives, well-being, because you know that we can have mobile apps to improve our well-being, our daily life, diagnosis, treatment, and rehabilitation. So the digital aids are horizontal for digital transformation. I have chosen today, as in my recent lectures, talks, to focus on some examples. It is important to show examples because that's why we understand how much pilot actions can help us. The ANASA, the Breathe initiative that was presented this morning, is one of such initiatives which can be generalized when we understand how important it is to decrease cost, to facilitate medical professionals, and to understand how big is the benefit for patients. As Mr. Liakopoulos said, I'm going to speak about an example in Hungary. In Hungary, they use an application where they can scan their skin, photograph it, and send it to the hospital. After 4 days, they get a response, and in 1 year, they had 22,000 cases. Most were very simple ones. So the person doesn't need to visit the hospital or even the doctor, while on the other hand, many important cancers have been diagnosed or at the initial or the more developed stages. So the people managed to take measures. Also, cough. Via mobile applications, one can understand whether the cough means that there is a bronchitis or maybe cancer as well or nothing. So we can understand from coughing the situation of the patient's health. So we hope at the primary or the secondary level of healthcare, we shall see this kind of technological applications that can decipher the cough's signals, or even the voices signals that can showcase the commencement of Alzheimer's disease. Let me also mention another example from the UK, United Kingdom, where a person can utilize a stick and in order to examine their urine samples, and via a mobile application they can understand which are their indicators. 2,000 British citizens used this application. After that, we saw an increase of 72% of those patients that in the past did not go to visit their doctors or take a checkup frequently. 10% showed a high percent of protein in urine, so this could lead to some kidney problems in the future. So this is another example showing low cost with an efficient application and a better life. At the same time, we see the everyday life in the hospitals or in the laboratories, because the laboratories are going to function, to operate in a different manner after the digital transformation. Let me give you another example from Estonia, which has a very developed digital system. Since 2008, all Estonian citizens have disclosed their medical data, and there are medical folders. The doctors upload all data, and the medical files include all types of information for every patient, their allergies, their doctor visits, their prescriptions, everything. Estonia is focusing now on the matter of dealing with data safety. Of course, data have to be utilized anonymously, of course, for research. But security issues are always important. In 1997, Estonia's systems were hacked by Russian invaders, so they have built very strong firewalls. I shared these examples with you because I wanted to show you that these major changes that are anteport us have to be welcomed by our systems. We have to understand the significance of these changes and generalize them by absorbing them. We are at a unique point in the history of medicine. We can see a shift of investments and a shift of the model of providing care to patients. Instead of the patient going to the hospital, the patient can stay at home. We can utilize technology, we can employ AI in order to understand the medical profile of the personal problems, issues of every citizen, and provide medical diagnosis and care. And I'm going to mention one last thing regarding Greece, the Greek system. Digital health is a matter of health policy and not an IT policy. IT is here to support health. So health reform is what is most important here. The challenge is for us, in order to have, as a country, to make the leapfrog and maybe make the Puma leap in order to cover the weaknesses and enter the new era. The challenges are first to absorb all these new initiatives and include them in our regulatory system. We need a timeline. We need a budgeting scheme. And I remind you here that the Recovery Fund supports these kinds of initiatives exactly as the minister mentioned. In my visit in Korea recently, I worked with the Fourth Industrial Revolution Committee that they have. In 2017, they had presented the targets for 2021. They had 2 pilot hospitals in 2017 where they monitored all the information, and their aim was that in 2022, all the hospitals in the country could be connected via this platform. They managed to do that earlier than their target time. Another challenge is to increase digital skills of the medical personnel, people in the hospitals and the private practices. This is indeed difficult due to the fact that we don't have enough personnel, and the people are very tired due to the high loads of work. This is going to be a serious challenge. And the last one is the design of initiative employment actions. Having an application doesn't mean that you can implement it on the next day. This must be simple. It must be efficient. It must be able to enter the existing system, and it must be able to answer to specific needs of the people. Data management is another important challenge. Interoperability of the system is a major problem in Greece because organizations, ministries, hospitals, bodies have to be connected with each other because they have to utilize the same information systems. Accountability is going to change. Ethical issues are going to rise even more seriously. And of course, the labor market is going to be affected. We're going to have to see crisis in some areas and new opportunities in other areas. Of course, no change can bring about benefits if it's not embraced by all the stakeholders. In health, all of us are stakeholders in Greece. So the citizens have to be able to utilize all the services that we're going to provide. And here the Recovery Fund provides funding for digital literacy of the people. However, in order to be frank and realistic, I can say that we cannot have a digital oasis of health, even if we had the ideal hospitals and the ideal policies, because we have many serious digital gaps in the society. Despite the applications that we see, our country is ranking 26th in the 28 European countries in digital indicators. Ladies and gentlemen, the question is, can we make this leap based on our today's situation, or should we accelerate? The answer is that we have seen examples of countries that have had much more serious problems, as Estonia, for example, which in 1999 has 800% of inflation, and it was under the Russian mafia. But they managed to be first in the world because they adopted a culture and they had the leadership to forward the society towards a specific future. Thank you very much.
Thank you very much, Mrs. Diamantopoulou, for this very interesting presentation. I believe that you, Mrs. Diamantopoulou, set the framework according to the title of our conference. I took as a take-home message 26 and 28, which shows how much more we have to go. Αποτελεί μεγάλη χαρά να καλωσορίσω την κυρία Μολ, είναι η Γενική Διευθύντρια της EFPA. Ελπίζω να είναι συνδεδεμένη. Κυρία Μολ, καλημέρα σας. Χαίρομαστε πάρα πολύ που σας έχουμε μαζί μας. Αυτά που θα συζητήσουμε σήμερα και αύριο πραγματικά ενδιαφέρουν. Επομένως, έχετε το λόγο. Ευχαριστώ. Καλημέρα. Ακούμε παρεμβολές, δεν αντιλαμβάνομαι για ποιο λόγο. Ζητώ συγγνώμη από την καμπίνα διερμηνίας, δυστυχώς δεν έχουμε πλέον ήχο. Ο ήχος μόλις επανήλθε. Τέταρτη βιομηχανική επανάσταση λοιπόν. Η κατάσταση στην οποία βρίσκεται η Ευρώπη είναι πραγματικά πολύ κρίσιμη. Μας δίνει όμως την ευκαιρία του πώς μπορούμε να βελτιώσουμε τα συστήματα υγείας μας για τους ασθενείς μας. Ως EFPIA, αυτό που θα ήθελα να σας δώσω είναι ο τρόπος με τον οποίο μπορούμε να χτίσουμε καλύτερα συστήματα υγείας, γιατί η πανδημία της COVID μας έδωσε τη δυνατότητα πώς μπορούμε να γίνουμε καλύτεροι ψηφιακά και πώς μπορούμε να είμαστε πιο αποτελεσματικοί για τους ασθενείς, αλλά και σε όλα τα επίπεδα του συστήματος υγείας, δαμάζοντας, αν θέλετε, την ψηφιακή επανάσταση. Λοιπόν, θα ήθελα να περάσουμε στην επόμενη διαφάνεια, αν έχετε την καλοσύνη. Για μας, λοιπόν, στην EFPIA είναι τα στοιχεία που μας επιτρέπουν να αξιοποιήσουμε τις δυνατότητες της τέταρτης επανάστασης στην υγειονομική περίθαλψη. Αυτά είναι κρίσιμα, είναι κεφαλαιώδους σημασίας. Με αυτόν τον τρόπο θα μπορέσουμε να διαχειριστούμε καλύτερα τα συστήματα υγείας μας. Για να γίνει αυτό, θα πρέπει να εξασφαλίσουμε ότι οι επαγγελματίες υγείας κάνουν καλύτερα ενημερωμένες επιλογές στο αντικείμενό τους μέσω της χρήσεως των νέων τεχνολογιών. Υπάρχει δυνατότητα αξιοποιήσεως των δεδομένων που συλλέγονται μέσω των ψηφιακών υπηρεσιών, προκειμένου να εξατομικεύονται οι θεραπείες και να αξιοποιούνται οι δυνατότητες του συστήματος, πραγματικά αξιοποιώντας και δαμάζοντας τις δυνατότητες της τεχνολογίας. Και τέλος, τα συστήματα υγείας μπορούν να παρακολουθήσουν τις εξελίξεις. Αυτό το είδαμε κατά τη διάρκεια της COVID, πως η τρέχουσα υφιστάμενη οικονομική κατάσταση είναι πολύ πολύπλοκη, επομένως πρέπει να μάθουμε πώς θα μπορέσουμε να αξιοποιήσουμε καλύτερα τα στοιχεία και τα επιτεύγματα που έχουμε στην διάθεσή μας. Από ψηφιακής απόψεως λοιπόν μπορούμε να χρησιμοποιήσουμε όλες τις εξελίξεις για να προχωρήσουμε, να επιτύχουμε τους στόχους μας. Θα ήθελα να μοιραστώ μαζί σας πώς τα δεδομένα σε όλο τον κύκλο ζωής των φαρμάκων για την προώθηση της καινοτομίας και τη στήριξη της υγειονομικής περίθαλψης μπορούν να χρησιμοποιηθούν. Για εμάς ως καινοτόμοι που εκπροσωπούμε τις καινοτόμες φαρμακοβιομηχανίες, τα δεδομένα είναι πολύ σημαντικά, από την έρευνα και την δημιουργία ενός καινούριου φαρμάκου μέχρι τη διάθεσή τους στους ασθενείς. Αξιολόγουμε τις αξίες που υφίστανται και η ψηφιακή μεταρρύθμιση μπορεί να βελτιστοποιήσει την ανάπτυξη της φαρμακευτικής βιομηχανίας και των καινούριων φαρμάκων. Και αυτό γίνεται ενισχύοντας τη γνώση που έχουμε για τις ασθένειες και την εξέλιξή τους, αλλά βοηθά επίσης και στην ταυτοποίηση και την αναγνώριση των ασθενών, οι οποίοι μπορούν να ωφεληθούν τα μέγιστα από από ένα καινούριο φάρμακο. Γίνεται λοιπόν μια εξατομικευμένη προσέγγιση. Η εξέλιξη και η ανάπτυξη του προατομικού φακέλου ασθενούς, είδαμε πόσο χρήσιμο ήταν αυτό, ειδικά για τη συμμετοχή ασθενών σε κλινικές μελέτες, επίσης και για την προσέλευσή τους στα νοσοκομεία. Η υποστήριξη της απευθείας συμμετοχής των ασθενών στην ανάπτυξη των φαρμάκων με την παρακολούθηση εκ μέρους των ασθενών της αποτελεσματικότητας των φαρμάκων. Αυτό βελτιστοποιεί την ανάπτυξη των καινούριων φαρμάκων και φαντάζομαι ότι αυτό είναι ζητούμενο και για εσάς. Οπωσδήποτε μπορείτε να βρείτε αυτά τα στοιχεία στον ιστότοπό μας. Το τελικό απότοκο είναι η βελτίωση των προσφερόμενων υπηρεσιών υγείας και της ποιότητας των υπηρεσιών υγείας. Ποιο είναι το καλύτερο αποτέλεσμα για τους ασθενείς. Αυτό είναι λοιπόν το οποίο θα δώσει ένα σταθερό, εύρωστο και υγιές σύστημα υγείας. Η ψηφιακή μεταρρύθμιση λοιπόν είναι το κλειδί που θα μας δώσει τη δυνατότητα για όλα αυτά και θα επιτρέψει σε ένα σύστημα υγείας να παραμείνει καινοτόμο, αξιοποιώντας τα καινούργια φάρμακα και δίνοντας πρόσβαση σε αυτά στους ασθενείς. Είναι βασικό στοιχείο αυτής της τέταρτης βιομηχανικής επαναστάσεως στον τομέα της υγείας. Αν περάσουμε στην επόμενη διαφάνεια θα δούμε πως η EFPIA συμμετέχει στην υποστήριξη αυτής της τέταρτης βιομηχανικής επαναστάσεως. Το κάνουμε αυτό συνεργαζόμενοι με όλους τους παίκτες, με όλους τους συμμετέχοντες, αν θέλετε, με όλα τα ενδιαφερόμενα μέρη, προκειμένου να έχουμε ως τελικό αποτέλεσμα τη βελτίωση της υγείας του πληθυσμού. Αν θέλει κάποιος να είναι αποτελεσματικός, ένα έκαστο των στοιχείων αυτών θα πρέπει να έχει πρόσβαση σε ψηφιακές ευκολίες. Τούτου λεχθέντος θα πρέπει να συνεργαστούμε με τους διαμορφωτές πολιτικών, με τους παρόχους υπηρεσιών υγείας, προκειμένου να διασφαλίσουμε ότι όλοι θα έχουν διαθέσιμες τις τεχνολογίες, τις τεχνολογικές λύσεις, αλλά και την ασφάλεια των δεδομένων που θα μας επιτρέψει να αλλάξουμε την νοοτροπία μας και να μπορέσουμε να αξιοποιήσουμε όλη αυτή την πληθώρα ψηφιακών εργαλείων. Αυτό που είδαμε ήδη από την αρχή της COVID είναι ότι δεν είχαμε τη δυνατότητα να ποσοτικοποιήσουμε το πλήθος των θανάτων, διότι δεν ήταν εφικτό να επικοινωνούν οι χώρες μεταξύ τους. Αυτό ήταν το χείριστο σενάριο που μπορούσαμε να υποθέσουμε. Αν πάμε στο βέλτιστο σενάριο, αυτό είναι η πλήρης αξιοποίηση της τέταρτης βιομηχανικής επαναστάσεως που θα επιτρέψει σε όλους αυτούς τους δρόντες, σε όλα αυτά τα ενδιαφερόμενα μέρη να αξιοποιήσουν τις ίδιες τεχνολογίες με τον ίδιο τρόπο και να υπάρχει διαλειτουργικότητα. Ξεκινάμε από το ευρωπαϊκό επίπεδο και περνάμε στο παγκόσμιο. Ποιες είναι οι προκλήσεις προκειμένου να μπορέσουμε να υιοθετήσουμε όλες αυτές, να αξιοποιήσουμε αυτό το δυναμικό? Δεν θα εκπλαγείτε βλέποντας την επόμενη διαφάνεια. Έχουμε τον κατακερματισμό. Σε αυτόν τον χώρο η διαλειτουργικότητα είναι ζητούμενο, είναι κάτι το οποίο ανέφερα και νωρίτερα. Όταν δεν είμαστε σε θέση να συγκρίνουμε τα δεδομένα και να συλλέξουμε τα δεδομένα επειδή δεν υπάρχει διαλειτουργικότητα, δεν μπορούμε να αξιολογήσουμε και να υπολογίσουμε φερειπίν το πλήθος θανάτων που σχετίζονται με την COVID. Αυτό καθιστά πολύ δυσχερές το να έχει το βέλτιστο δυνατό αποτέλεσμα για τον ασθενή. Τώρα, κάτω από αυτά τα δύο, το έλλειμμα κινήτρων και οι πολύπλοκες ρυθμιστικές διαδικασίες πραγματικά σταματούν και δημιουργούν εμπόδια στην αξιολόγηση, στην αξιοποίηση αυτού του δυναμικού. Όπως είπα και πάλι, η διαλειτουργικότητα δημιουργεί πρόβλημα όχι μόνο μεταξύ χωρών, αλλά και μέσα στην ίδια χώρα. Κάποια συστήματα δεν μπορούν να επικοινωνήσουν μεταξύ τους. Δηλαδή, πηγαίνοντας από νοσοκομείο σε νοσοκομείο, άλλες φορές έχουν το φάκελο ασθενούς μου διαθέσιμο, άλλες φορές δεν έχουν. Η ποιότητα των στοιχείων και η διαλειτουργικότητα, όπως είπα, βρίσκεται σε έλλειμμα. Υπάρχει επίσης έλλειμμα της κατάλληλης υποδομής και της πληροφόρησης, αν θέλετε, και της εκπαιδεύσεως των αρμοδίων σε ευρωπαϊκό επίπεδο, αλλά συνήθως οι αρχές οι οποίες ελέγχουν αυτά τα δεδομένα δεν έχουν λάβει τα απαραίτητα κίνητρα για να κάνουν το διαμοιρασμό αυτών των στοιχείων. Τα στοιχεία αυτά, όταν δεν υπάρχουν σε υψηλή ποιότητα, δημιουργούν προσκόμματα και είναι ανασταλτικοί παράγοντες στην ανάπτυξη ενός εύρωστου συστήματος υγείας. Αντιλαμβάνεστε, ο GDPR ενίοτε δημιουργεί προβλήματα και εκεί. Αυτό επιτάσσει, η υιοθέτηση του GDPR επιτάσσει ένα διαφορετικό σύστημα ρυθμιστικών αρχών, το οποίο δυσχεραίνει την ανταλλαγή πληροφοριών. Αντιλαμβάνεστε, όταν έχει υιοθετηθεί σε διαφορετικό επίπεδο το GDPR από τη μία χώρα στην άλλη, δημιουργείται πρόβλημα στην επικοινωνία. Αυτό συμβαίνει επίσης και με την ευρωπαϊκή νομοθεσία. Θα πρέπει να διασφαλίζουμε ότι η ερμηνεία της ευρωπαϊκής νομοθεσίας, όταν αυτή εναρμονίζεται με την εθνική, εναρμονίζεται στην εθνική, την χάνει της δέουσας ερμηνείας. Η ψηφιακή διακυβέρνηση των δεδομένων. Είναι πάρα πολύ σημαντικό να είναι ασθενοκεντρική αυτή η διακυβέρνηση. Θα πρέπει να είναι τόσο ανοιχτή όσο μας επιτρέπει η τεχνολογία, αλλά και κλειστή κατά το δοκούν και κατά το απαιτούμενο, προκειμένου να διασφαλιστεί η ασφάλεια των δεδομένων αυτών και των προσωπικών δεδομένων. Οι πολίτες θα πρέπει να έχουν πρόσβαση και έλεγχο των στοιχείων τους, θα πρέπει να υπάρξει υποστήριξη της δευτερεύουσας χρήσης, να υπάρχει κοινωνικό όφελος, επομένως ο διαμοιρασμός των δεδομένων θα κανονικοποιηθεί με κάποιο τρόπο. Η ευρωπαϊκή νομοθεσία για τον GDPR ήδη προβλέπει το πλαίσιο διακυβέρνησης και υπάρχει πρόβλημα στους μηχανισμούς υλοποίησης, θα έλεγα. Επομένως, είναι απολύτως σημαντικό οι πολίτες να έχουν πρόσβαση στα δεδομένα τους και να διατηρούν τον έλεγχό τους. Θα πρέπει να είναι σε θέση να επιλέγουν το σκοπό και τον λόγο για τον οποίο θα χρησιμοποιηθούν τα δεδομένα, και οι αποδέκτες αυτών των στοιχείων θα πρέπει να έχουν εξουσιοδοτηθεί να τα λαμβάνουν, να τα επεξεργάζονται, και αυτές οι διαδικασίες θα πρέπει να την χάνουν αναθεωρήσεως ανατακτά χρονικά διαστήματα. Ίσως να ξέχασα ένα σημαντικό κομμάτι σε αυτήν την διαφάνεια, που είναι η εμπιστοσύνη. Η εμπιστοσύνη στο ότι αυτή η βιομηχανική επανάσταση επισυμβαίνει με τον τρόπο που πρέπει. Τα άλλα δύο στοιχεία τα οποία δεν ανέφερα και βλέπετε στη διαφάνεια είναι ότι το δίκτυο αυτό θα πρέπει να υποστηρίζει τη χρήση των δεδομένων αυτών για έρευνα και ανάπτυξη. Είναι οι λεγόμενες δευτερεύουσες χρήσεις. Αυτό είναι πέραν της χρήσεως των στοιχείων για τον ασθενή. Η εναρμόνιση των νομοθεσιών είναι πάρα πολύ σημαντική και θεωρούμε ότι η διακυβέρνηση αυτή θα πρέπει να είναι ανάλογη του κινδύνου που αποφεύγεται με τη χρήση τους. Όλα αυτά είναι σχετικά, βεβαίως, είναι όμως καινοτόμα, είναι καινούρια, είναι επαναστατικά αφεαυτού τους. Θα πρέπει όμως να διασφαλίσουμε ότι οι γραμμές οι οποίες βρίσκονται και διακυβερνούν όλη αυτή τη διαδικασία θα πρέπει να δώσουν τη δυνατότητα ότι σε αυτά τα δεδομένα να είναι τόσο ανοιχτά όσο χρειάζεται και τόσο κλειστά όσο απαιτούν οι συνθήκες. Θα ήθελα να πω δύο λόγια για την τεχνητή νοημοσύνη στην επόμενη διαφάνεια, αλλά δεν βλέπω τη διαφάνεια. Όχι, αυτοί είναι οι εταίροι με τους οποίους συνεργαζόμαστε για την προώθηση της αλλαγής. Μπορεί να αναγνωρίζετε ορισμένους εξ αυτών. Κάποιοι άλλοι στήθηκαν επί τούτου. Είναι οι συνεργασίες δημοσίου και ιδιωτικού τομέα ΣΔΙΤ με την Ευρωπαϊκή Επιτροπή. Είναι το Data Saves Lives. Και εδώ θα ολοκληρώσω την παρουσίασή μου λίγο πιο γρήγορα, γιατί έχω μία διαφάνεια ακόμα. Την οποία χάσαμε ήταν για την τεχνητή νοημοσύνη. Ας περάσουμε στην επόμενη λοιπόν, για να μιλήσουμε για την ευρωπαϊκή προοπτική. Βλέπετε τι έγραψε η Στέλλα Κυριακίδη, Ευρωπαϊκή Επίτροπος για την Υγεία και την Ασφάλεια των Τροφίμων, ότι είναι σαφές ότι τα ψηφιακά εργαλεία μπορούν να βελτιώσουν σημαντικά την ικανότητα και την αποτελεσματικότητα των συστημάτων υγείας. Και εδώ τα συστήματα υγείας και τα Υπουργεία Υγείας δουλεύουν χέρι-χέρι με την Ευρωπαϊκή Επιτροπή. Ας περάσουμε στην επόμενη διαφάνεια, η οποία είναι απλώς οι στόχοι, αν θέλετε, τους οποίους θα πρέπει να επιτύχουμε. Είναι η σύγκληση της ενιαίας αγοράς δεδομένων της Ευρωπαϊκής Ενώσεως, το οποίο θα πρέπει να συμπέσει με την αναθεώρηση της φαρμακευτικής στρατηγικής για την Ευρώπη. Η Ευρώπη διαμορφώνει το όραμά της για τα μελλοντικά δεδομένα υγείας και το ψηφιακό οικοσύστημα, και τώρα ήρθε η ώρα να συμβάλλει στη δημιουργία αυτών των μακροπρόθεσμων ωφελών. Υπάρχουν κάποια βήματα τα οποία θα πρέπει να κάνουμε. Νομίζω τα πιο σημαντικά πράγματα είναι να διασφαλίσουμε ότι θα επικαιροποιήσουμε τους κανόνες μας για την ασφάλεια στον κυβερνοχώρο, θα δημιουργηθούν οι συνεργασίες οι οποίες θα επιτρέψουν τον διαμοιρασμό αυτών των δεδομένων, να υπάρξει σύμπραξη για την αύξηση της εμπιστοσύνης στην ανταλλαγή δεδομένων και τη χρήση των ψηφιακών τεχνολογιών, επενδύσει στην ψηφιακή υποδομή για να εξασφαλιστεί η επεκτασιμότητα και η χρηστικότητά της, και οπωσδήποτε να προσπαθήσουμε να καταρρύψουμε τυχόν εμπόδια. Σας ευχαριστώ πάρα πολύ για την πρόσκληση που μου δώσατε τη δυνατότητα να απευθυνθώ σε αυτό το εκλεκτό κοινό. Εύχομαι καλή επιτυχία σε αυτό το διήμερο συνέδριο και σας ευχαριστώ για μία ακόμα φορά πάρα πολύ.
Ευχαριστώ πάρα πολύ. Διαφωτιστική παρουσίαση αυτή για όσους διαχειρίζονται τα δεδομένα και για τα σχήματα μέσα στα οποία μπορεί να γίνει αυτή η διαχείριση, η πρόσβαση στα δεδομένα, και βεβαίως θέλουμε να συνεχίζουμε να παρέχουμε στους ανθρώπους μας καινοτόμες λύσεις και να είμαστε σε συμμόρφωση με την ευρωπαϊκή καινοτομία. Τώρα θα έχουμε το πρώτο στρογγυλό τραπέζι της ημέρας. I'm going to invite for our first panel Mr. Panagiotis Liargovas as the moderator of the panel from the University of Peloponnese. Good morning, everyone. Thank you for the invitation to be a moderator for this first important panel titled Innovation as the Catalyst for Economic Growth and Better Results in the Health Sector. I'm going to ask the speakers here. Mr. Christos Dimas first, Ministry of Development, on innovation and research issues. Mr. Remos Gucher, Vice President General Manager of the Central Eastern Europe, Greece, Turkey, Israel, and India. Bristol Meyer Squibb. Mr. Christian Rodseth. He's going to join us from his office virtually. Managing Director of Janssen Greece, Poland and Romania, Mr. Yorgos Tousimis, member of the Pharmaceutics Committee of the Hellenic American Chamber and the General Director of Amgen Greece and Cyprus, and Mr. Oliver Bisata. He's going to share a video message with us. Director General, Industrial Policies and External Affairs, MedTech Europe. So this is going to be a very interesting panel. And let me start right away with Mr. Dimas. I know that he has to be in the parliament very soon because he has a voting session to attend. So you have 6 minutes. Κυρίες και κύριοι, θέλω να σας ευχαριστήσω, να ευχαριστήσω τους οργανωτές που με κάλεσαν στην συνδιάσκεψη αυτή για να μιλήσω για τις πρωτοβουλίες της ελληνικής κυβέρνησης, τα ζητήματα της έρευνας και της ανάπτυξης και της καινοτομίας στις επιστήμες υγείας. Έχω μια παρουσίαση την οποία έχω προετοιμάσει. Αυτό που θέλω να πω για να αρχίσω είναι ότι η Ελλάδα έχει μια στρατηγική προτεραιότητα να επενδύει στην καινοτομία και κυρίως στις βιοεπιστήμες. Επιτρέψτε μου να πω ότι η δομή της ελληνικής κυβέρνησης διαχωρίζει τους οργανισμούς που είναι κάτω από την κυβερνητική εποπτεία, δηλαδή τα πανεπιστήμια, και τους ερευνητικούς οργανισμούς που είναι υπό το Υπουργείο Ανάπτυξης. Είναι πολύ σημαντικές πρωτοβουλίες που έχει αναλάβει η ελληνική πλευρά όσον αφορά τα ζητήματα καινοτομίας. Θα σας δώσω εδώ κάποιες λέξεις κλειδιά για να θέσω το πλαίσιο της παρουσίασης. Έχουμε το Ελληνικό Ινστιτούτο Παστέρ, το οποίο έχει ως αποστολή του να ασχολείται με αυτοάνοσα νοσήματα, με χρόνιες παθήσεις, με νευροεπιστημονικές νευρικές παθήσεις, με πολλαπλές σκληρύνσεις και νευρογενετικές εκφυλιστικές παθήσεις, αναλύοντας DNA, το Alzheimer, το Foundation of το Ίδρυμα Έρευνας, το οποίο έχει έδρα την Κρήτη και έχει κέντρα για το Alzheimer, για την ιατρική ακρίβεια, για τις εκφυλιστικές ασθένειες, οι οποίες συνδέουν την ακαδημαϊκή κοινότητα σε όλη την χώρα. Επίσης έχει μια εμβληματική καινοτομία όσον αφορά τον κορονοϊό και είναι από τα πιο σημαντικά ερευνητικά κέντρα. Το Ερευνητικό Κέντρο Αθηνά, στην Αθήνα, το οποίο έχει το Εθνικό Δίκτυο Ιατρικής Ακριβίας στην ογκολογία, στο COVID, στους αλγορίθμους. Συγγνώμη, λέει ο μιλητής, δεν μπορώ να δω πολύ καλά με τα γυαλιά μου, πρέπει να τα αλλάξω. Την βελτιστοποίηση της ανάπτυξης φαρμάκων και επίσης την χρήση τεχνητής νοημοσύνης σε πολλά θέματα. Επίσης έχουμε το Ίδρυμα Βιοερευνητικών Μελετών που έχει ένα κέντρο γενετικής έρευνας και εστιάζει σε ιατρικά θέματα με τεχνητή νοημοσύνη και άλλες σύγχρονες τεχνολογίες. Επίσης θα γνωρίζετε το Δημόκριτο, που είναι το μεγαλύτερο ερευνητικό κέντρο στην Ελλάδα και έχει σημαντικές πρωτοβουλίες για την θεραπεία του καρκίνου, ιδίως την θεραπεία του καρκίνου του πνεύμονα και άλλα θέματα. Επίσης έχουμε είναι και ένα hub ψηφιακού μετασχηματισμού, ιδίως όσον αφορά την παραγωγή και την διαχείριση φαρμακευτικών συσκευασμάτων. 130 εκατομμύρια για σημαντικά ζητήματα στον τομέα των βιοεπιστημών. Έχει ανακοινωθεί τον Ιανουάριο ότι ξεκινά ο τρίτος κύκλος έρευνας για καινοτόμες δράσεις που θα δώσει μεγαλύτερη οικονομική στήριξη στα ερευνητικά κέντρα, στα πανεπιστήμια και θα επενδύσει στην έρευνα και ανάπτυξη ώστε να υπάρξουν συνέργειες και προϊόντα τα οποία είναι σημαντικά και χρήσιμα για την κοινωνία. Δημιουργούμε επίσης κλάστερς καινοτομίας. Έχουμε 4 αυτή τη στιγμή στην Ελλάδα ως αποτέλεσμα των χρηματοδοτικών μας εργαλείων και επίσης επενδύουμε πολύ ώστε να έχουμε κέντρα δεξιοτήτων με κέντρα έρευνας και ανάπτυξης και στις μεγάλες εταιρείες οι οποίες μπορούν να επενδύσουν σχετικά, αλλά και στις μικρομεσαίες επιχειρήσεις οι οποίες έχουν ανάγκη να έχουν πρόσβαση σε έρευνα αλλά δεν έχουν τα χρήματα να κάνουν τη δική τους επένδυση. Επιπλέον πρέπει να πω ότι προωθούμε τις startups, τις νεοφυείς επιχειρήσεις. Η ελληνική κυβέρνηση δεν ήξερε μέχρι πρότινος πόσες startups υπάρχουν στην Ελλάδα, σε ποιο τομέα δραστηριοποιούνται κλπ. Έχουμε δημιουργήσει ένα χάρτη που αποτυπώνει όλο αυτό το τοπίο και μπορούμε πλέον να σχεδιάζουμε πολιτικές προσαρμοσμένες ειδικά στις ανάγκες του οικοσυστήματος αυτού. Τις βλέπετε εδώ, τις κατηγορίες των startups και το μεγαλύτερο ποσοστό αυτών είναι στις επιστήμες ζωής και φαίνεται ότι οι επενδύσεις εκεί αυξάνονται. Πρόσφατα έχουμε δημιουργήσει πολύ συγκεκριμένες πολιτικές για τις επενδύσεις από εξωτερικούς οργανισμούς για το πώς μπορεί να γίνεται χρηματοδότηση της διάστασης αυτής και πολλές πλέον εταιρείες επενδύουν στον τομέα της καινοτομίας της υγείας. Εδώ βλέπετε το προφίλ των εταιριών στον τομέα της υγείας. Οι περισσότερες νεοφυείς επιχειρήσεις έχουν αυτοχρηματοδότηση ή κάποιες επιδοτήσεις και οι angels. Οι περισσότερες startups προτιμούν να προάγουν τεχνολογικές λύσεις στον τομέα της υγείας. Στην πρώτη κατηγορία βλέπουμε το λογισμικό και επίσης έχουμε και προϊόντα τεχνητής νοημοσύνης και ακολουθούν οι λοιπές κατηγορίες. Βασικός μας στόχος ήταν να προχωρήσουμε, να προωθήσουμε την έρευνα και ανάπτυξη στη χώρα. Πριν 1,5 χρόνο αλλάξαμε το φορολογικό πλαίσιο και το αυξήσαμε σε 200% ώστε να κάνουμε την Ελλάδα ανταγωνιστική στην Ευρώπη, την πιο ανταγωνιστική μάλιστα σε αυτό το πεδίο για την ανάπτυξη, για τις επενδύσεις στον τομέα αυτών και για να προσελκυθούν νέα ξένες επενδύσεις στη χώρα. Για να γίνει αυτό παρέχουμε το πλαίσιο και όλα τα εργαλεία στους ενδιαφερόμενους, γιατί αυτό είναι πολύ σημαντικό ώστε να υπάρξουν spin-offs από ακαδημαϊκά ιδρύματα. Κάνουμε επίσης κάποιες εκπαιδεύσεις στο ακαδημαϊκό προσωπικό για να μπορέσουν οι άνθρωποι που έχουν ταλέντα μέσα από ακαδημαϊκά ιδρύματα να μπορέσουν να ξεκινήσουν μια spin-off και να αρχίσουν μια επιχειρηματική δραστηριότητα. Επιπλέον, επενδύουμε στην έρευνα και ανάπτυξη και ελπίζουμε να προσελκύσουμε πολλές από τις φαρμακευτικές βιομηχανίες. Άρα λοιπόν, ένας μεγάλος μας στόχος είναι να δημιουργήσουμε στην Πειραιώς, στις εγκαταστάσεις της Χροπή, έναν οργανισμό ο οποίος ασχολείται με τον ψηφιακό μετασχηματισμό του τομέα υγείας, με εργαστήρια, με startups, με ακαδημαϊκές συνεισφορές, ώστε να μπορέσουμε να δημιουργήσουμε όλες αυτές τις συνέργειες οι οποίες είναι τόσο σημαντικές για να έχουμε καινοτόμα προϊόντα και υπηρεσίες. Αυτό είναι ένα έργο το οποίο είναι εξελίξη και στους επόμενους 2-3 μήνες θα είμαστε σε θέση να ανακοινώσουμε πώς προχωρά. Ένας παρόμοιος χώρος δημιουργείται και στην Θεσσαλονίκη. Το business plan είναι ήδη εν προόδο. Προσπαθούμε να προσελκύσουμε εταιρείες που είναι μέσα στον τεχνολογικό χώρο και να δημιουργήσουμε ένα οικοσύστημα, ένα κλάστερ γύρω από αυτές. Αυτά είχα να σας παρουσιάσω. Σας ευχαριστώ πάρα πολύ. Δυστυχώς πήρα λίγο περισσότερα από 6 λεπτά. Συγγνώμη κύριε Λιαγκόβα. Και δυστυχώς και πρέπει να φύγω γιατί πάω στο κοινοβούλιο. Ευχαριστώ πολύ για την παρουσίασή σας. Όσον αφορά την καινοτομία και την έρευνα, η Ελλάδα έχει ανέβει αρκετές θέσεις τα τελευταία χρόνια στους δείκτες επιδόσεων και γι' αυτό γι' αυτό οφείλουμε τα ευχαριστώ μας στον κύριο Δήμα. Τώρα, ο λόγος στον κύριο Ρέμο Γκούχερ. Ευχαριστώ πολύ. Είναι μεγάλη μου χαρά που βρίσκομαι σήμερα εδώ και μπορώ να μιλήσω για τις ευκαιρίες και τις προκλήσεις που υπάρχουν στο περιβάλλον της υγείας, εστιάζοντας βεβαίως στον ρόλο της Ελλάδας. Η εταιρεία μου στην εταιρεία μου δουλεύω για την Κεντρική και Ανατολική Ευρώπη, μεταξύ των οποίων η Ελλάδα, η Τουρκία και άλλες χώρες. Θα προσπαθήσω να μην είμαι κουραστικός, αλλά να θίξω τα βασικά ζητήματα που αφορούν το θέμα μου. Βρισκόμαστε πλέον σε ένα τοπίο όπου οι μεγάλες βιοφαρμακευτικές εταιρείες παίζουν σημαντικό ρόλο. Η Bristol Myers Squibb είναι μια παγκόσμια ηγέτης στον φαρμακευτικό χώρο με μεγάλες χρηματοδοτήσεις σε έρευνα και ανάπτυξη. Έχουμε περισσότερο από 11 δις δολάρια ετήσιες επενδύσεις σε έρευνα και ανάπτυξη, δηλαδή 25% των ετήσιων εσόδων προέρχονται από τον τομέα αυτόν. Είμαστε στις top εταιρείες στον τομέα. Καλύπτουμε περισσότερες από 50 χώρες και περισσότερες από 40 τομείς ασθενειών. Όσον αφορά την καινοτομία στις φαρμακευτικές βιομηχανίες, πρέπει να πούμε ότι έχει άμεσο αντίκτυπο στην υγεία και την ευημερία των κοινωνιών. Αυτό που βλέπουμε είναι τα ποσοστά της θνησιμότητας που μειώνεται στις καρδιακιακές παθήσεις και στους καρκίνους, ως παράδειγμα εδώ, τα τελευταία 10-20 χρόνια. Είναι πολύ σημαντικά νούμερα και αυξάνονται τα τελευταία χρόνια. Αν δει λοιπόν κανείς την αύξηση του προσδόκιμου ζωής στο ευρωπαϊκό μέσο όρο και στην Ελλάδα, βλέπουμε ότι οι μέσοι όροι βελτιώνονται και καταλαβαίνουμε τη συνεισφορά της φαρμακοβιομηχανίας στην αλλαγή των δικτών αυτών. Τα τελευταία 15-20 χρόνια οι φαρμακευτικές εταιρείες και η ιατρική καινοτομία έχει συνεισφέρει κατά 73% στο προσδόκιμο ζωής και στην καλύτερη υγεία της κοινωνίας. Όπως είδαμε και από την προηγούμενη παρουσίαση του κυρίου Δήμα, υπάρχει μεγάλο ποσοστό καινοτομίας γύρω μας στις επιχειρήσεις και στην Ελλάδα. 100 εκατομμύρια δολάρια ετήσιας επένδυσης. Αυτό δείχνει ότι υπάρχει μια δυναμικότητα περαιτέρω ανάπτυξης τα επόμενα χρόνια στα 500 εκατομμύρια. Αν θέλουμε να δούμε από πιο κοντά το τοπίο στην Ευρώπη της επιτυχίας των καινοτομιών στον ιατρικό τομέα, στον τομέα της υγείας, βλέπουμε ότι για πρώτη φορά δίνονται στην αγορά κάποιες καινοτόμες λύσεις στον τομέα των φαρμάκων. Υπάρχουν πολλές νέες ετικέτες και βλέπουμε την Ελλάδα που έχει πολύ καλή θέση στο τετάρτη μόριο των επιτυχημένων χωρών. και το φάσμα της προσβασιμότητας αυξάνεται γρήγορα. Βλέπουμε τις χώρες που είναι πιο χαμηλά και αριστερά στο σχήμα βλέπουμε τις χώρες οι οποίες αντιμετωπίζουν τα περισσότερα προβλήματα στην ανάπτυξη αυτού του τομέα. Άρα λοιπόν, όσον αφορά τις πολιτικές υγείας, η Ελλάδα είναι σε πολύ καλή θέση όσον αφορά την πρόσβαση σε καινοτόμα και νέα τεχνολογία. Αν δούμε από πιο κοντά τις φαρμακευτικές δαπάνες, θα διαπιστώσουμε, όπως βλέπουμε σε αυτό το διάγραμμα που δείχνει το νοσοκομειακό τομέα, ότι η χρηματοδότηση προς τα νοσοκομεία δεν έχει αλλάξει τα τελευταία 10 χρόνια. Λόγω των περιορισμών στον προϋπολογισμό από το 2015 βλέπουμε ότι υπάρχει ένα 20% περιθώριο. Άρα λοιπόν αυτή τη στιγμή υπάρχει 20% χαμηλότερη χρηματοδότηση αυτή τη στιγμή στα νοσοκομεία από ό,τι υπήρχε πριν από 10 χρόνια. Από την άλλη πλευρά βλέπουμε ότι η συνεισφορά της βιομηχανίας για να κλείσει αυτό το κενό ανάμεσα στις ιατρικές ανάγκες και την ιατρική κατανάλωση στον τομέα των νοσοκομείων και τον προϋπολογισμό. Εδώ συνεχίζει να μεγαλώνει αυτό το έλλειμμα, αυτό το κενό κάθε χρόνο. Πάνω από 50% των φαρμακευτικών δαπανών στο περιβάλλον των νοσοκομείων χρηματοδοτούνται από την ίδια τη φαρμακοβιομηχανία. Αυτό σημαίνει με άλλα λόγια ότι κάθε δεύτερο πακέτο δίνεται δωρεάν προς τους καταναλωτές. 1 στα 2 δωρεάν. Αυτό είναι σημαντικό επίσης. Κάτι που είναι σημαντικό να κρατούμε στο νου μας είναι ότι οι φαρμακευτικές εταιρείες σε όλα τα ευρωπαϊκά κράτη-μέλη ανταγωνίζονται μεταξύ τους. Άρα λοιπόν αυτό διασφαλίζει ένα συγκεκριμένο πλαφόν στις τιμές, χαμηλές τιμές, και αυτό γινόταν ήδη και πριν την εισαγωγή του εργαλείου των clawbacks και των rebates. Αυτή είναι μια μεγάλη πρόκληση για τις φαρμακοβιομηχανίες. Αν δούμε τις πρόσφατες εξελίξεις και πώς έχει εξελιχθεί η νομοθεσία περί υγείας στην Ελλάδα, θα δούμε ότι υπάρχει περισσότερος κατακαιρματισμός του προϋπολογισμού, καθώς και επιπλέον clawbacks, τα οποία έχουν υλοποιηθεί ή προγραμματίζονται για τα νοσοκομεία, και υποχρεωτικά rebates. Βλέπουμε στα δεξιά του σχήματος τι σημαίνει για τους οργανισμούς που είναι καθαρά αμιγώς ερευνητικοί όπως ο δικός μας, τι σημαίνει αυτό. Είδαμε ότι υπήρξε 46% αύξηση των υποχρεωτικών πληρωμών τα τελευταία 6 χρόνια, και αν δούμε συγκεκριμένα το έτος 2022, η αύξηση είναι περίπου 46%. Και αυτό είναι μεγάλο πρόβλημα. Ας ρίξουμε τώρα μια ματιά στο μέλλον. Κάτι είναι πολύ σημαντικό και το ακούσαμε και από τις προηγούμενες παρουσιάσεις, είναι να υπάρχει προβλεψιμότητα, να υπάρχει ένα περιβάλλον το οποίο δημιουργεί τις δυνατότητες για επενδύσεις. Η χρηματοδότηση του συστήματος υγείας βεβαίως πάει χέρι-χέρι με τις κρίσεις που έχει περάσει ο τομέας της υγείας σε όλες τις χώρες. Ωστόσο, είναι πολύ σημαντικό να επιταχύνουμε για να φτάσουμε στο επίπεδο που θέλαμε να είμαστε. Και όσον αφορά το περιβάλλον της έρευνας, πρέπει να πω ότι υπάρχουν πολλές επενδύσεις στην καινοτομία και η περαιτέρω επένδυση σε αυτόν τον τομέα θα ήταν μια πολύ καλή ευκαιρία για περαιτέρω ανάπτυξη καινοτόμων λύσεων. Ευχαριστώ πάρα πολύ.
Ευχαριστούμε πάρα πολύ, κύριε Γκούχερ. Θεωρώ ότι πραγματικά η γύρια ήταν ένα πάρα πολύ σημαντικό θέμα, το οποίο έχει να κάνει με το κόστος με τη φαρμακευτική δαπάνη στην Ελλάδα και την συμμετοχή του ιδιωτικού και του δημόσιου τομέα. Νομίζω ότι αυτό θα έχει ως αποτέλεσμα πολλές ερωτήσεις στη συνέχεια. Ο επόμενος ομιλητής μας θα είναι μαζί μας εικονικά, ψηφιακά αν θέλετε. Είναι ο Γενικός Διευθυντής της Janssen Ελλάδος. Καλημέρα. Ευχαριστώ πάρα πολύ. Ζητώ συγγνώμη που δεν μπορώ να βρίσκομαι εκεί με φυσική παρουσία. Βρίσκομαι αυτή τη στιγμή στο Βέλγιο. Αλλά σας ευχαριστώ πάρα πολύ για την πρόσκληση. Θα ήθελα να με επιβεβαιώσετε ότι βλέπετε την παρουσίασή μου. Πολύ ωραία. Θα ήθελα να πω λοιπόν δύο πράγματα για την εταιρεία μας και να μιλήσουμε λιγάκι για τις προκλήσεις που έχουμε στο ελληνικό σύστημα υγείας. Να μιλήσουμε λιγάκι για το πώς βλέπουμε και κάποιες από τις λύσεις που μπορούν να βρεθούν για αυτά τα προβλήματα. Πολύ σύντομα θα ήθελα να υπενθυμίσω ότι είμαστε μια μεγάλη οργάνωση. Ως οργάνωση παρέχουμε πραγματικά καινοτόμες λύσεις, οι οποίες προσφέρουν αξία στους ασθενείς, πρόσβαση σε καινοτομία και μπορείτε να δείτε στην επόμενη διαφάνεια τι αυτό σημαίνει με αριθμούς. Στην επόμενη διαφάνεια θα δείτε ότι στην περιοχή EMEA, Ευρώπης, Μέσης Ανατολής και Αφρικής δηλαδή, πραγματικά επενδύουμε στην περιοχή μας. Έχουμε παρουσία σε 30 χώρες, με έντονη και σημαντική επένδυση στην Ελλάδα και στην Κύπρο. Έχουμε 7 εγκαταστάσεις έρευνας και αναπτύξεως με ετήσιες απαντήσεις σε έρευνα και ανάπτυξη της τάξης του 1,5 δισεκατομμυρίων ευρώ. Ο στόχος μας είναι η υγεία της κοινωνίας. Γι' αυτό και προσπαθούμε να καινοτομήσουμε. Στην επόμενη διαφάνεια θα δείτε ότι θέλαμε να εστιάσουμε στη φαρμακευτική καινοτομία, η οποία οδηγεί και ενισχύει την οικονομική ανάπτυξη. Βελτιώνει και παρατείνει την ποιότητα ζωής των ασθενών, κάτι το οποίο είπε και ο προηγούμενος ομιλητής. Αλλά ένα από τα μηνύματα που θέλω να κατανοήσετε είναι ότι μια υγιής κοινωνία είναι μια παραγωγική κοινωνία. Και αυτό προσπαθούμε να το υποστηρίξουμε μέσω της φαρμακοβιομηχανίας και της ιατρικής επιστήμης. Βλέπετε την εικόνα. Αυτό είναι το σημαντικό. Αν είμαστε επιτυχείς, θα έχουμε τη δυνατότητα να δώσουμε την ευκαιρία στους ασθενείς μας να έχουν ζωή με νόημα, ζωή με υγεία, ζωή με ποιότητα. Στην επόμενη διαφάνεια θεωρώ ότι εδώ θίγουμε την ευκαιρία για εμάς για επενδύσεις και είναι η υγειονομική περίθαλψη. Οι δημόσιες δαπάνες για την υγειονομική περίθαλψη στην Ελλάδα αντιπροσωπεύουν σχεδόν 6% του ΑΕΠ έναντι 8,8% κατά μέσο όρο στην Ευρωπαϊκή Ένωση. Και αυτό δημιουργεί ζήτημα. Είμαι πολύ πρόσφατος στην Ελλάδα, αλλά συνειδητοποίησα ότι πρέπει να προσπαθούμε να ακολουθήσουμε τους μέσους όρους της Ευρωπαϊκής Ενώσεως και ήδη αναφέρθηκε αυτό το οποίο βλέπετε στην επόμενη διαφάνεια, είναι ότι οι ασθενείς θα έχουν, ότι ο δημόσιος φαρμακευτικός προϋπολογισμός παραμένει αμετάβλητος από το 2014, ενώ ταυτοχρόνως έχουν αυξηθεί οι ανάγκες των ασθενών σε πρόσβαση σε φάρμακα. Και είναι κάτι το οποίο δεν μπορούμε να αφήσουμε να εξακολουθήσει. Και βλέπουμε ότι ο κατακεφαλήν δημόσιος φαρμακευτικός προϋπολογισμός είναι 24% κάτω από τον μέσο όρο της Ευρωπαϊκής Ενώσεως. Θα πρέπει να υπάρξει κάποια μακροπρόθεσμη στρατηγική για τον εξορθολογισμό της συνταγογράφησης και των δαπανών, προκειμένου να κινητροδοτηθεί η καινοτομία. Ο ρόλος της φαρμακοβιομηχανίας, όπως αντιλαμβάνεστε, είναι κέριος και θα πρέπει να υπάρξουν αυτά τα κίνητρα. Το επόμενο σημείο που έχω στην διαφάνειά μου είναι ότι 7 στα 10 προϊόντα πληρώνονται από τις φαρμακευτικές εταιρείες. Επομένως, εάν ρωτάτε αν εμείς έχουμε επενδύσει στον Έλληνα ασθενή, το αποτέλεσμα είναι φυσικά και ναι, αλλά δυστυχώς οι τρέχοντες προϋπολογισμοί είναι αβάστοι, είναι δυσβάσταχτοι, δεν μπορούμε να τους υποστηρίξουμε. Δεν είναι βιώσιμοι. Τι κάνουμε εμείς για να μπορέσουμε να προωθήσουμε την καινοτομία? Πραγματικά τα πάντα. Για να έχουμε μια κοινωνία η οποία ευημερεί, θα πρέπει να έχουμε μια φαρμακοβιομηχανία η οποία βοηθά στην αύξηση της βελτίωση της ποιότητας της ζωής. Στην επόμενη διαφάνεια, αυτό που σας έχω αναλύσει είναι ότι αυτό που πρέπει να κάνουμε, αν μπορείτε να περάσετε στην επόμενη διαφάνεια παρακαλώ, πολύ ωραία, ευχαριστώ, είναι ότι πρέπει να επενδύσουμε στην υγεία των ασθενών. Τι σημαίνει αυτό? Σημαίνει ότι θα πρέπει να αυξηθεί η δημόσια συνεισφορά στη φαρμακευτική δαπάνη, Είναι πολύ σημαντικό αυτό το θέμα και είναι ευκαιρία για εμάς να έχουμε μεγαλύτερη επίπτωση στην παραγωγικότητα των Ελλήνων ασθενών. Κάτι το οποίο αναφέρθηκε νωρίτερα είναι ότι θα πρέπει να επιταχύνουμε τον ψηφιακό μετασχηματισμό της υγείας στη χώρα. Μόλις τώρα βγαίνουμε από την πανδημία της COVID και θεωρώ ότι τώρα είναι η ευκαιρία να επιταχύνουμε τον ψηφιακό μετασχηματισμό. Θα πρέπει οπωσδήποτε να υπάρξει εφαρμογή διαρθρωτικών μεταρρυθμίσεων για τη δημιουργία αποδοτικότητας στη φροντίδα των ασθενών. Αυτό σημαίνει ότι χρησιμοποιώντας περισσότερους πόρους θα είμαστε πιο επιτυχείς στην παροχή υπηρεσιών υγείας για τους ασθενούς. Αυτό ως αποτέλεσμα θα έχει την προσέλκυση διεθνών επενδύσεων στην υγεία και στην Ελλάδα εν γέννη. Κλείνω με την επόμενη διαφάνεια λέγοντας ότι στην Johnson & Johnson και την Janssen, το φαρμακευτικό κομμάτι της J&J, δεσμευόμαστε για τη συνεργασία. Προέρχομαι από την Νότιο Αφρική και υπάρχει ένα γνωμικό που λέει αν θες να πας κάπου γρήγορα πήγαινε μόνος σου, αν θες να φτάσεις μακριά χρειάζεσαι και συντροφιά. Αυτό δείχνει ότι αυτή τη στιγμή είναι μια πολύ έντονη στιγμή για την καινοτομία και εδώ είναι η ευκαιρία να βαδίσουμε μαζί, συντροφιά, ο ένας με τον άλλον. Στην Janssen δεσμευόμαστε για τη συνεργασία. Στην τελική μου διαφάνεια θα ήθελα να πω ότι θα συνεργαστούμε με οποιονδήποτε είναι διατεθειμένος να δημιουργήσει μαζί μας ένα μέλλον όπου οι ασθένειες θα ανήκουν στο παρελθόν. Σας ευχαριστώ πάρα πολύ που με επιτρέψατε να μοιραστώ μαζί σας τις σκέψεις μου και δίνω πάλι το λόγο στον συντονιστή. Ευχαριστούμε πάρα πολύ κύριε Ρότσεθ. Παρατήρησα ότι χρησιμοποίησατε πολύ τις λέξεις επένδυση και βιωσιμότητα. Είμαι βέβαιος ότι θα υπάρχουν πολλές ερωτήσεις πάνω σε αυτό. Ας περάσουμε στον επόμενο ομιλητή, τον Γιώργιο Τουσίμη, who is country director for Amgen Hellas in Cyprus. Mr. Tusimis, you have the floor. Good morning, and I would like to kick off the discussion by saying that, well, we're just having this discussion amongst ourselves. We're in a room, in a hall, where everyone is working for the industry. And there is not a single person, not a single representative of the state anymore. They are the policymakers, the health policymakers in the room to have a serious discussion at long last. Now, my presentation follows everyone else's. Και ζητώ συγγνώμη που την κάνω στην ελληνική, αλλά βρισκόμαστε στην Ελλάδα και θα προτιμήσω τη μητρική μου γλώσσα. So the discussion we're invited to have is how we can support innovation and how we can attract investments to Greece. And it takes place at a very crucial point in time because now we have a huge public debate for the change of the pharmacy policy framework in a way that targets innovation in our country. Quite simply that. The governments of our country of the past 10 years, historically speaking, have missed a huge opportunity. We suffered a financial crisis which we could have taken advantage of to improve the healthcare system and to remove distortions that had accumulated over time. We did not take the necessary measures. We were not bold enough to look the problem in the eyes and to handle and manage expenditure, not as an expenditure, but as the prescription of drugs that are addressed to patients. So this is a fact, and I believe that everyone accepts this. Even the Ministry for Health accepted it in his introductory remarks and mentioned it in detail. At the same time, we did not make any increase or even readjustment or redefinition of the level of health. It was mentioned that we are today at 2012's levels, when the needs for more health the world over increase exponentially, and we as Greece are far lower than the European Union average. Finally, Greek governments, the Greek states, got comfortable around what we call the clawback. It was rather dryly accepted, and excuse me for this expression, by the Ministry for Health, because clawback in and of itself does not incentivize any government to take measures, because at the end of the day, who's going to pay? It's innovative pharmaceutical industry. What is equally clear, however, and was mentioned quite strongly by both previous speakers, is that innovation has value. It does not have cost. It is here to help the lives of people, and it has proven time and again that it increases and improves life expectancy with many innovative treatments. And I don't think that there is anyone in this room to question the importance of treatments for HIV, for instance, or for breast cancer, or for any other diseases that have helped the population not only of this country but the world over to advance, to move forward. But let's talk about investments. Innovation and all the simple things required for any, say, high school child, high school pupil who needs to go forward. We have three ingredients in the success recipe for innovation. First of all, we need to have incentives. To do this in an environment that is on the one hand sustainable, and it was mentioned time and again, sustainability, it was mentioned already, and on the other hand, predictable, so that one may be able to see ahead the future that lies in store. And we all know very well in this hall that pharmaceutical research and technology takes time to go from its initial concept to reach down to the patient who will benefit from it. So how are we doing here in Greece? How are we doing? I will dare say that in terms of incentives, and it's a pity that Mr. Dimas is no longer here, the government took some very important steps, and the government is still trying to do things in this direction. But over time, emphasis in clinical trials, what we as innovative pharmaceutical industry can do in the country, is dwindling and does not lead to have mobilization in bringing these studies and trials to Greece. In terms of sustainability and predictability, I believe that a huge debate has already taken place already. Unfortunately, serious illness treatments, by definition, in our country are called FIC, high-cost drugs. So we're talking about drugs that do not have value, they have cost, and this is a mindset that needs to change. We here in this hall who are working in innovative pharmaceutical industry have made a grave error. We have not positioned the value of innovation out there properly, and we're called upon to do this, even at the 11th hour. And we are now dealing with a restructuring of the budget, a logic of fragmentation and breakdown that leads to greater rebates to innovative treatments, which are those who increase life expectancy. And it's a paradox, it's a conundrum that we need to deal with altogether. It's the supermarket example. I mean, imagine a consumer who goes into a Tesco, and I apologize for using the Greek Tesco, and by April they can buy whatever they want and to pay for it. But after April they keep on buying whatever they want, whatever they need, up to and including December, and Tesco are those who pay for their purchases. Now, imagine, would such a company remain in the country if this happened in perpetuity? I believe the answer is rather obvious. But we are here, we're socially responsible companies, and we really don't want to let our patients go without our treatments. At the same time, when the changes in the framework of our operation are constant, incessant, and they are, come as a surprise. I have the feeling that the minister is always happy when he's announcing something that is retroactive. It's like tag. I mean, tag, you're it. I caught you and you're going to pay. So we made a lot of mistakes and we need to move forward. So innovative pharmaceutical industry is asking for specific things. What we need is to stop this budget fragmentation. We can't have the budget split. Freeze the implementation of the budget split, which create inequalities between patients, and we can't have retroactive measures without absolutely any discussion regarding the data that has led to those decisions. At the same time, we're fervently asking for an increase in the funding for our drugs in general. Products for health. We do understand that it is a difficult time conjuncture and that there is an energy crisis out there. Be that as it may, it's impossible for 10 years our country's pharmaceutical budget to remain constant. And I'm fairly happy that the Ministry for Health said that there will be a small readjustment, upward readjustment next year as a function of the country's GDP. At the same time, we're asking for specific structural measures. once and for all, for the company to roll up their sleeves, the government to roll up their sleeves and to activate the Pharma Expenditure Monitoring Committee with data, with substance, not for us to be in a hall to discuss amongst ourselves, because we do have data in the country. Greece is very rich in data presence that they can utilize if the country wants to, and I'm afraid the country does not want to. Given that we do have the data, we need to prioritize volume control reforms. It was already mentioned by the minister that what will happen is that they will make an evaluation of therapeutic and treatment protocols in the 10 most costly categories in the country in the next months. But this government is in power for the past 3 years. I believe they could have done more things in the previous 3 years, and this holds water for all governments, even the previous one. And finally, to have the government monitor execution in a transparent and more strict way, because, well, the devil is in the detail, as is well known, and we need to be sure and certain that the measures we implement lead to the best possible results. At the end of the day, what we need to think about is the patient, the oncology patient who need the treatment. We bring them the one they have at their disposal today, but also the one that they could have had at their disposal tomorrow in this country through the efforts made by the pharmaceutical industry. Thank you very much for your attention. Thank you very much, Mr. Tusimis. I believe that he raised a flag, a banner, a huge flag, if I may, for the sustainability and the viability of the industry that is in Greece and serves this huge sector. And he combined this with incentives. Indeed, the incentivization of our country, not only in pharmaceuticals, it needs to be present now. Let's move on to the last speaker, definitely not least speaker. It is a video message. It's Mr. Oliver Bisaccia, Director General Industrial Policies and External Affairs, MedTech Europe. Καλησπέρα σας, ευχαριστώ πάρα πολύ για να μιλήσω για την λειτουργία, εν πάση περιπτώσει την σημασία της καινοτομίας. Θα μιλήσω λοιπόν για αυτήν την βιομηχανία η οποία προσπαθεί να αυξήσει τα αποτελέσματα των ασθενών, να δώσει καλύτερα εργαλεία για τους επαγγελματίες υγείας. Και ο κύριος βασικός τρόπος με τον οποίο κάνουμε αυτό το πράγμα είναι μέσω της σταθερής και συνεχούς τεχνολογικής καινοτομίας. Όταν μιλάμε για την καινοτομία, κάποιος αρχίζει λογικά να ανησυχεί για το κόστος. Η πρόσκλησή μου σε εσάς σήμερα είναι να δείτε την ιατρική τεχνολογία και την καινοτομία όχι ως κόστος, αλλά ως επένδυση. Και η επένδυση έχει να κάνει με την διάθεση πόρων σήμερα, ώστε να μπορέσουμε να απολαύσουμε καλύτερα αποτελέσματα και καλύτερη αξία αύριο. Οι επενδύσεις είτε εδώ και η φαρμακοβιομηχανία και η υγεία είτε στην Ελλάδα είτε γενικώς χρειάζεται λύσεις. Γνωρίζουμε πως οι πληθυσμοί γυράσκουν στην Ευρώπη και σε όλο τον κόσμο και γνωρίζουμε πως οι μεταδοτικές και μη μεταδοτικές ασθένειες αυξάνονται. Γνωρίζουμε ότι η πανδημία της COVID-19 πραγματικά στοίχησε πάρα πολύ στην δυνατότητα των νοσοκομιακών ιατρών και του προσωπικού να ανταπεξέλθουν στις υποχρεώσεις τους και στο καθήκον τους. Το να ανεβάσουμε την περίθαλψη στο επίπεδο που πρέπει, οπωσδήποτε θα έχει κάποια κόστη. Αυτό όμως που απαιτεί ο τομέας της υγείας είναι επενδύσεις. Επενδύσεις οι οποίες μπορούν να δημιουργήσουν αποταμιεύσεις και να γλιτώσουμε χρήματα από αλλού. Είτε στο σύστημα υγείας, είτε αλλού στην εν γέννη οικονομία μιας εκάστης χώρας. Επενδύσεις στην ιατρική τεχνολογία, προκειμένου να αντιμετωπίσουμε τις προκλήσεις του σήμερα, αλλά και του αύριο. Ας δούμε, φερειπίν, όχι μόνο την τιμή των διαγνωστικών εξετάσεων ή των ιατροτεχνολογικών εργαλείων. Ας δούμε την αξία του να βοηθήσουμε τους συνανθρώπους μας να αποφύγουν την νόσο. Η πρόωρη και η έγκαιρη μάλλον, ο έγκαιρος εντοπισμός μιας ασθενείας, η πρόληψη δηλαδή, είναι ανεκτήμητης αξίας. και εάν εξακολουθούν να υπάρχουν περιπτώσεις όπου δεν μπορεί να αποφευχθεί η εισαγωγή σε νοσοκομείο, ας δούμε το τεράστιο όφελος από το σύντομο βραχυχρόνιο εξιτήριο από το νοσοκομείο. Η καινοτομία της ιατρικής τεχνολογίας προσφέρει αυτή την αξία. Είτε πρόκειται για επένδυση στην καινοτομία, στην εξαποστάσεως προσφορά υπηρεσιών υγείας, είτε σε εξαποστάσεως εγχειρήσεις, είτε στη διαχείριση φαρμάκων, καινοτομία στην καλύτερη διάγνωση για τον έγκαιρο εντοπισμό ασθενειών. Αυτή είναι η αξία της επενδύσεως στην υγεία. Μια πρόσφατη μελέτη που είδα στην Ολλανδία ότι αν αξιοποιηθεί η καινοτομία σωστά σε μια χώρα, έχει τη δυνατότητα να αποδεσμεύσει 100.000 επαγγελματίες υγείας. Και οι 100.000 αυτές είναι το προβλεπόμενο έλλειμμα σε παρόχους υγείας στην Ολλανδία για το 2030. Παρόμοιες προβλέψεις έχουν γίνει και σε άλλες ευρωπαϊκές χώρες συμπεριλαμβανομένης και της Ελλάδος. Εάν όμως θέλουμε να αξιοποιήσουμε τα ωφέλη της καινοτομίας στον τομέα της υγείας, χρειάζονται κάποια πράγματα. Το πρώτο είναι ότι θα πρέπει να είμαστε ειλικρινείς, αναγνωρίζοντας ότι οι αλλαγές στα συστήματα υγείας μας πρέπει να γίνουν πολύ γρήγορα. Θα πρέπει να δούμε με ειλικρίνεια την τρέχουσα κατάσταση των συστημάτων υγείας και το δημογραφικό πρόβλημα και να συνειδητοποιήσουμε πόσο επίγουσα είναι η ανάγκη για αλλαγή. Θα πρέπει να παίξουμε επίσης το ρόλο μας ως η βιομηχανία ιατροτεχνολογικού εξοπλισμού και η φαρμακοβιομηχανία, προκειμένου να υλοποιήσουμε αυτές τις αλλαγές που απαιτούνται για να αναγνωριστεί η αξία της προσφοράς μας ως αυτή που είναι. Θα πρέπει να δούμε τι γίνεται με την τιμολόγηση των φαρμακευτικών προϊόντων και να υπογραμμίσουμε την αξία που φέρνουμε στον τομέα της υγείας. Τέλος, χρειάζεται αυτές οι αλλαγές να γίνουν οριζόντιες σε όλο το σύστημα. Στη δουλειά μου πάντοτε ακούω για αυτές τις θαραλέες κινήσεις που προωθούν την καινοτομία και ούτω καθεξής, αλλά αυτές εστιάζουν σε μία εκάστη μεμονωμένη χώρα ή σε νοσοκομεία μέσα σε κάθε χώρα. Εδώ χρειαζόμαστε ισότιμη πρόσβαση στην υγεία σε όλους τους ασθενείς. Εδώ θα πρέπει να αλλάξει η νοοτροπία ολόκληρων συστημάτων υγείας και τότε θα δούμε τα ωφέλη που μπορούν να προσφέρουν. Αυτή είναι η έκκλησή μας στην ευρύτερη κοινότητα που έχει να κάνει με την υγεία σε όλη την Ευρώπη. Να δράξουμε αυτή την ευκαιρία και η πρόσκλησή μου σε όλους εσάς είναι να βοηθήσουμε την Ελλάδα να δημιουργήσει τάσεις. Να είναι μια χώρα η οποία θα μπορέσει να δρέψει τους καρπούς της καινοτομίας στον τομέα της υγείας μέσα στα επόμενα χρόνια. Κυρίες και κύριοι, σας ευχαριστώ πάρα πολύ για την προσοχή σας και σας εύχομαι καλή συνέχεια στις εργασίες του πολύ ενδιαφέροντος συνεδρίου σας.
Φτάσαμε στο πιο ενδιαφέρον σημείο του πάνελ αυτού. Έχουμε λίγα λεπτά για ερωτήσεις. Έχουμε ήδη κάποιες ερωτήσεις. Θα ξεκινήσω με τον κύριο Μπούχερ. Κύριε Γκούχερ, είπατε ποια είναι τα βήματα που πρέπει κανείς να υιοθετήσει για να δημιουργήσει ένα περιβάλλον που θα προσελκύει επενδύσεις. Δεδομένου ότι όλοι συμφωνούν με τις μεταρρυθμίσεις που πρέπει να γίνουν και με την επιτάχυνσή τους, ποια θα είναι τα βήματα που θεωρείτε θα είναι πιο γρήγορα για να φτάσουμε στο σημείο αυτό που προτείνατε? Ευχαριστώ για την ερώτηση. Έχοντας ακούσει τις παρουσιάσεις αυτού του πρωινού, θέλω να πω ότι τα πάντα είναι θέμα νοοτροπίας. Πρέπει να λάβουμε υπόψη ότι μια καινοτομία δεν δημιουργείται ακριβώς για ένα συγκεκριμένο τοπικό ιατρικό πρόβλημα, αλλά για να προαγάγει περαιτέρω ολόκληρο το ιατρικό οικοσύστημα. Πρέπει να συζητούμε ποιος είναι ο κύκλος των καινοτομιών που πρέπει να θέλουμε να προαγάγουμε. Και αν υπάρχει ένας κύκλος βημάτων που γυρνά, κάνει τον κύκλο του αργά αλλά σταθερά. Και αν μπορεί να γενικευτεί κάποια πρακτική η οποία υπάρχει ήδη στην βιομηχανία. Αν γίνει αυτό, θα πρέπει να δούμε αν κάποια χρήματα μπορεί να απελευθερωθούν και να δοθούν προς την κατεύθυνση άλλων καινοτομιών. Πρέπει να πούμε ότι στην Ελλάδα, σε σχέση με τα υπόλοιπα κράτη-μέλη, έχουμε τις υψηλότερες τιμές και τις υψηλότερες δαπάνες για φαρμακευτικές έρευνες. Άρα πρέπει να αλλάξει η νοοτροπία για να καταλάβουμε ποια είναι η αξία της καινοτομίας και τι μπορεί να φέρει, η προστιθέμενη αξία της. Να δούμε και να θυμηθούμε ποιο είναι το θέμα του συνεδρίου μας σήμερα εδώ, τι μας φέρνει μαζί. Θέλουμε επίσης να ξέρουμε τι είδους καινοτομία είναι που έχουμε κάθε φορά, μια σταδιακή καινοτομία ή μια θεμελιώδης καινοτομία. Μερικές φορές έχουμε κάποιες αλλαγές οι οποίες επιφέρουν δομικούς μετασχηματισμούς. Άλλες φορές έχουμε πιο αργή εξέλιξη. Μια ερώτηση για τον κύριο Ρότσετ. Μας ακούτε, κύριε Ρότσετ? A question for Mr. Tusimis. Which is the role of technology and the real-world data in the sustainability of the health system? We mentioned earlier in the various presentations that data are critical to understand the causes and the reasons for which our system can be functional or not. We have Mrs. Gaga from the Ministry of Health with us. We know that very well that you are doing a lot of work in the hospital sector so that we understand their function. The same thing we can do in the sector of medicine with the data that are available today. In Greece, we are lucky to have a large database via the e-prescription platform. However, we do not utilize them as much as we could. We could, for example, take decisions on policy making on health or find the areas where further interventions are needed in order to improve the patients' lives. So we have an opportunity here. The example from other countries, European countries, is a strong one. Let's see what happens in Scandinavian countries where the data from real life of patients are utilized strongly. We just need the political will. The technology is here. Thank you. Κύριε Ρότσετ, είστε μαζί μας? Αν όχι, πάμε σε άλλη ερώτηση. Έχουμε μαζί μας τον ομιλητή. Μια ερώτηση για σας, κύριε Ρότσετ. Ποια είναι τα θέματα που θεωρείτε ότι θα μας προχωρήσουν πιο γρήγορα να φτάσουμε σε μια βιώσιμο περιβάλλον? Είναι πολύ σημαντικό να υπάρχουν συνέργειες μεταξύ των αρχών, των φορέων που χαράσουν πολιτική, των εκπροσώπων της βιομηχανίας και να δούμε πώς μπορούμε να καταγράψουμε τις προκλήσεις και να δώσουμε κάποιες λύσεις. ιδίως για τους Έλληνες ασθενείς, αυτό είναι απαραίτητο για να προχωρήσουμε. Είναι μια ευκαιρία για μας να σταματήσουμε να ζητούμε υπευθύνους, αλλά να πούμε ότι θα συνεργαστούμε να λύσουμε τα προβλήματα. Το άλλο θέμα είναι η επιτάχυνση του ψηφιακού μετασχηματισμού. Υπάρχουν αρκετές προκλήσεις πάντα σε θέματα τεχνολογίας και γι' αυτό μπορούμε να συνεργαστούμε, γιατί οι προκλήσεις δεν είναι εντοπισμένες σε συγκεκριμένες χώρες, αλλά είναι ίδιες σε όλες. Έτσι μπορούμε να συνεργαστούμε σε ευρωπαϊκό επίπεδο για καλύτερη ποιότητα υπηρεσιών. Ευχαριστούμε. Μια που είστε εδώ ακόμα, έχω και μια δεύτερη ερώτηση για σας. Με βάση την εμπειρία σας, μια που είστε πολυεθνική εταιρεία, ποια θα ήταν τα βασικά στοιχεία για τα οποία κάποιος επενδυτής θα επέλεγε να έρθει στην Ελλάδα? 3 πράγματα. Προβλεψιμότητα. Πρέπει να μπορούμε να ξέρουμε τι θα μας φέρει το μέλλον για να προγραμματίσουμε την επιχειρηματική μας δράση. Το δεύτερο είναι το σταθερό ρυθμιστικό περιβάλλον, μια νομοθεσία η οποία θα μας δείχνει πώς θα λειτουργούμε. Και το τρίτο, η αντίληψη της αξίας της καινοτομίας. Δεν αρκεί να υπάρχει μια καινοτομία, έχει σημασία πώς επιδρά στο ΑΕΠ, και αυτό το θίξαμε νωρίτερα. Υπάρχει μια ευκαιρία σήμερα συνεργασίας, ώστε να δούμε τι ποσοστό του ΑΕΠ δίνουμε, μάλλον τι ποσοστό του ΑΕΠ αντιστοιχεί στην ευκαιρία που δίνουμε στους Έλληνες ασθενείς να βελτιώσουν μέσω της τεχνολογίας τον τρόπο ζωής τους. Αν έχουμε λοιπόν προβλεψιμότητα, σταθερότητα νόμου και ευκαιρία τεχνολογικής επίγνωσης, έχουμε ευκαιρίες για περισσότερες επενδύσεις. Ερώτηση για τον κύριο Κούχερ. Πώς μια αγορά γίνεται ελκυστική σε πολυεθνικές εταιρείες για να έρθουν να επενδύσουν σε έργα τοπικά? Ευχαριστώ για την ερώτηση. Ήδη έχουμε δώσει τις περισσότερες απαντήσεις σε αυτή την ερώτηση. Η βιωσιμότητα την οποία μόλις αναφέρθηκε, αλλά θέλω να προσθέσω και κάτι στα όσα ελέγχθησαν. Είδαμε στην παρουσίαση του κυρίου Δήμα μια διαφάνεια που έδειχνε πώς γίνεται επένδυση σε διάφορους τομείς της βιομηχανίας, στις startups, και είδαμε ότι οι επιστήμες ζωής έχουν το μεγαλύτερο κομμάτι στην πίτα. Εκεί πρέπει να εστιάσουμε και να δούμε ποιες είναι οι προκλήσεις, αλλά και ποιες είναι οι βεβαιώσεις που μπορούμε να δώσουμε, ώστε του χρόνου και στην επόμενη πενταετία δεν θα είμαστε ξανά πάλι εδώ και θα λέμε τα ίδια πράγματα, αλλά θα έχουμε προχωρήσει. Δηλαδή, πώς θα προχωρήσει η αλλαγή? Γι' αυτό χρειαζόμαστε μια στρατηγική για τις επιστήμες ζωής. Βλέπουμε ότι υπάρχει κλινική έρευνα, βλέπουμε ότι υπάρχει εμπορευματοποίηση, βλέπουμε στο ευρωπαϊκό επίπεδο να υπάρχει προστασία για τις πατέντες. Πρέπει όλα αυτά να τα βάλουμε μαζί και να φτιάξουμε τον ελληνικό κύκλο ζωής των δραστηριοτήτων στον τομέα υγείας, διότι περισσότεροι παίκτες θα μπουν στο παιχνίδι στο μέλλον αυτό, έτσι θέλουμε τουλάχιστον. Η συνεργασία και η διευκόλυνσή της είναι ακριβώς αυτό που θα βελτιώσει και θα επιταχύνει την καινοτομία. Mr. Tusimis, a similar question. And please comment on the investments. How a multinational biotechnology company can offer to the health system of a country? I think that they can offer a lot. We are a biotechnology company. We hear the PM mentioning technology and saying that this is the field of the future. We have experience from all over the world in cooperating with governments, in managing data for the better efficiency of drug administration, and we are here to contribute. We're not just a factor that creates cost to burden the health system budget. Not only Amgen, my company, but all the companies in our sector wish to improve people's lives. We have the know-how, and we are here so that the Greek government can utilize us. Thank you. I don't have any further question, and we don't have any further time. So we are 3 minutes ahead, so we can thank you here. Σας ευχαριστούμε εδώ. Νομίζω ότι το κράτος σας έχει ακούσει, η κυβέρνηση έχει ακούσει τις προτάσεις σας και θα μπορέσει να σχεδιάσει το μέλλον της φαρμακευτικής βιομηχανίας στην Ελλάδα. Ευχαριστώ.
Right, we move on with the next roundtable. The moderator is one of the organizers of this conference. He is Kyriakos Souliotis. He is a dear professor. Professor, I would like to now call you to the floor. Good afternoon. We should like to continue with the works of this conference with a roundtable that I believe was highly anticipated and very eagerly expected, not just for its composition, but also due to the title. The title is Political Consensus, Commitment and Collective Action for Health System Improvement. Lots of promises here, lots of stakes contained in the same sentence. It's a huge bet. We heard a lot of great things. And it confirmed everything we did here that, health is a rapidly developing and growing field, and stagnancy in implementing reforms and making decisions can be a very painful thing indeed. Something that is confirmed every time we talk about health is that the key feature, the main characteristic, is total uncertainty and, surprise of all those who make decisions by extreme conditions. For instance, the fiscal crisis and the memoranda that hurt violently the sector of health. Another one is the recent pandemic. No one expected that modern societies and modern health systems would be found against themselves such a colossal pressure that they could not cope with, even the most strong among them. So within this framework and this data, we're talking about the possibility to achieve political consensus, which is necessary because the reforms are very crucial and critical in the field of health, and there are multiple pressure groups and interest groups that are hurt at the same time. So it takes either political alliances and consensuses or some offsets for the groups that are felt are being hurt in order to achieve the necessary consensus to implement these policies. One will say that this does not suffice and that other things are needed, such as the achievement of reforms at the proper political time. I would be remiss if I didn't point out that the emblematic reforms in Greece happened at a very bad conjuncture. Usually it is under pressure that we dare change things in health, despite the pressure from this sector. Another thought I'd like to share with you before I call to the podium our established and learned colleagues is the results of a study that's been running for 7 years. Now, for 7 years, we've been ascertaining that 75 to 80% of the population is doing systematic use of health services. So there's a field of regulation that concerns everyone. Another one is that 1 in 3 has problems and obstacles to access the health system that come even under very positive fiscal conditions. 1 in 3 states that they have the intent to pay additional money for health services. Let's put a pin on this. And citizens say that the inability to implement the necessary reforms in health is primarily due to the lack of political will and the political cost that it entails compared with the reaction of political pressure groups and interest groups. So this shapes and forms a field that is very demanding. It is a very difficult thing to regulate the health sector. It's one of the most complex areas of public policy and politics, and this is the environment in which we'll talk about the possibility to achieve consensus, political consensus primarily. Commitments vis-a-vis the society from both sides. I mean, it's impossible for the minister to change, the general secretary or the government to change, and for a plan to change because they want to bring their mark and to place their mark on health. These are the stakes, I believe, in health, and this is what we'll discuss with the exceptional speakers we will have at this roundtable. I'd like to thank them all for accepting our invitation. I should like to call to the table the alternate Minister for Health, Lung Specialist Mina Gaga, Mr. Stamatis Vardaros, who is health advisor of the president of Syriza, Mr. Tassos Yannissis, Professor Emeritus and past Minister of Social Security and Social Insurance, I think. Unfortunately, we have just been informed that Mr. Andreas Loverdos will not be able to join us due to an unforeseen commitment, which means that we have extra time for our discussion. Can you hear me? I should like to welcome you here as well. Now, Mrs. Gaga, you have the floor. You have 6 to 7 minutes to make a brief introduction. Right, I believe that this is a very good introduction, and I heard the previous speaker say very interesting things. The world changes around us. We have different technology. It's the patients who are much more active, but they need to be more active. And health becomes, it is a necessary thing. It needs to be accessible to everyone. It needs to be sustainable. And in order to better organize it, we all need to be together, to stand together. And not just talking politically, but all together, the doctors, the medical technology companies, pharmaceutical companies, the patients, all those who have anything to do with health. So let's start from the first thing. The first thing is to have the data. The second thing is to listen to the patients, to listen to the health users, to listen to those who produce products to be used by the health users, because those who produce something need to feel that they do so and have something to receive in return. And we need to be certain that there are some rules, that everything we need for health is really sustainable. And I really understand that we need to have some benefit for something that is offered on the basis of research and has a huge cost. But we need to make sure that it's such a benefit that the health systems and countries and states will make it over time. And it's the benefit of everyone, of the patients, of the systems and the countries, but also of the companies that produce the products that are needed to be purchased. So let's start from this, that the systems evolve. And as already Mr. Suliotis said, that in Greece we saw two big changes over the past 12, 14 years. The memoranda that changed the funding of the national healthcare system and of health in Greece in general. And second, coronavirus, a crisis that proved that health systems need to be flexible. And this, I believe, is important for us today. Everything we plan needs to be flexible. Now, we need 1,000 units, 1,000 beds, 1,000 beds. But in a pandemic like this, we may need 1,500. This we need to have the possibility to change, and we need to have the possibility and the capability to staff everything on the basis of the needs of the patients and not on the basis of calculations we made without absolutely no data. So one thing is that we need to have all the data there and have the possibility and capability to change the use depending on what we need. So let's say that we're on Crete. There is an earthquake and we have 200 injured people at hospital that normally has 30, can accept 30 people per day. I mean, we have big hospitals. I mean, Narkalohori, we had Pagni and the Venizelion hospital, and the two hospitals that were large and have a lot of staff that could do it. It could have happened near the hospital of Ierapatra that has very little staff. So we need to have the possibility to move our potential or to change our structures on the basis of what we will need. Now, I heard that the Stavros Niarchos Foundation, an architect, say that he was asked in France to convert a car industry into a hospital. So he needed to convert an existing building to a hospital, and they needed him to build a parking lot that has a huge cost, and he didn't want to do it. So he went to Israel while he was drafting the plans, and he realized that the hospital parking lot has, its entirety has oxygen supply, and it can be turned into an ICU very easily. So he said, yes, I will make the parking lot. So we change, and we change by seeing the systems and the possibilities of what we want to do in Greece. What do we want to do in Greece? So we listen. We get the data, we listen to the staff, and all the more so the citizens in all areas of the country. We see how many use health in their country, how many move to a different place to receive health services. And talking with the people, we trying to draft the health map, which is very important for us all. An example, the island of Paxi, they have 3,000 permanent residents and they have a health center. It's impossible to build a hospital there. I mean, it's easily understood by everyone. We can't have all the cases dealt with there. In the incidents, we have more incidents in summertime, and we can send more doctors and nurses in summertime to meet the increased needs. But the health structure cannot be a 400-bed one and 600 doctors, because the population is that of 3,000 inhabitants. So all things can happen on the basis of what we will need, what health use we can make in each place. And there needs to be collaboration, which is the other model we're interested in. So can I make a specific operation at a certain center to have it very complex? I will not have it in Lefkada, for instance, but if I have 3 patients, instead of moving them to Athens, I can move myself and go do the operation in Lefkada, and to have the patient's family there to be able to heal in their environment, their home. Things, easy things that we can discuss about and we can collaborate on. Another big weapon we have is digitalization. All Aegean islands have the possibility for telemedicine. So even a young doctor can discuss with a reference hospital, with a specialist regarding any problem with their patient. A thing we change, and we change immediately, is the emergency rooms, and we are in consultation with the urgent medicine company, and we raise the education levels, and we want all the doctors at the TEPS. We don't have them already. We are creating them to be able to be certified doctors, so that any doctor, any patient who has an acute problem in any part of the country to receive the care they need, be that a trauma or an infarct or an anaphylactic shock, or they have a simple dyspnea, and to be able to either be hospitalized in the health structure they have been into, according to the capabilities, all to be transferred, but to have the first aid, proper primary health care to save their lives no matter where they are, be that mountainous Chios or Zoumerka or the Evangelismos Hospital of Athens. This is a big bet, it's a huge stake, it's a big change that we believe will help everyone. The second thing we change, and you will start experiencing it in a few months, it will be completed in 2 years. It's the TEPS. The TEPS become single and unified. Patients can follow 2 routes. One route that is for ambulatory patients, and another one for more heavy patients. We will not move patients from a medical center to medical center, from doctor to doctor. The doctor will visit the patient, depending on their needs. These are just a few things. I think I've overshot my time, so I will put a stop here and we'll go on. Yes, we'll have opportunity to have the discussion. I would like to keep what you said about the evidence-based health policy, because it will help us fiscally to be more disciplined and also to be certain that we do is rational. I should like to give the floor to Mr. Vardaros. Mr. Vardaros? Good afternoon. I should like to thank everyone very much for the invitation. It's a very difficult conjuncture, and I think it's difficult for a number of years. And we're talking about that due to the fiscal adjustment over the past 2.5 years and the pandemic. But it's a difficult subject that this panel has to deal with, because the difficult thing in health policy, at the end of the day, is to look for consensus and for agreement. I'm talking about the political forces and the academics as well. I mean, it's a more elegant way in which academics express their differences and their objections. At any rate, when the invitation came, what I started thinking was points, bullet points, that with emphasis on the public healthcare system, that we could find some political areas of meeting points. And the most easy thing that popped to mind was the Doxiades plan. The most progressive project, plan, innovation that came from a conservative politician in the late 70s, early 80s. It was not implemented then, but it was implemented by PASOK in 1983 by Paraskevas Avierinos and Yorgos Yenimatas. And this is a success story that lasted for 40 years. With all the difficulties and the problems it entails, it still lasts 40 years later. I think that's the value of the national healthcare system and the need for further enhancement thereof. It is a point on which we can and we should agree on. It's the way we do things that is different, but this is indeed a matter of public debate to resolve and of political dialogue. I believe that in the period that preceded these 2.5 years as regards the public health system, we did have a shift of sorts, both at the level of idea and political approach. And I would be remiss if I didn't say that in the first period, in spring 2020, and here I would preempt some questions. Yes, you are with the opposition, and the target and your aim is to point out the problematic points and the key issues, the ineffective things of government management. Yes, but this is not all we do. The first period of the pandemic was a positive period of dealing with the health crisis. And I believe that this happened for very specific reasons. It happened because, quite appropriately, the natural leadership of the health system had the main say. And I'm talking about the experts committee. The communication tools at the disposal of the government were used in a relative, I wouldn't say sparingly, but it was as much as it should. Okay, I mean, and this changed in due course, and I believe that therein lie the difficulties in individual issues such as vaccination or the management of cases that have fueled political debates of a different level in a different climate. I mean, the approach of the government has changed ever since, and of course the reaction of the opposition to the management and handling of the health crisis. Of course, it was trust and confidence, rather, in the public, in the national healthcare system. And I'm saying this because we have people from the market in the room, and you know this better than I do. This is not always an adversarial relationship. We believe that investing in the public health system is a growth choice, because through its growth it gives more room to the market and to make opportunities for investments and for further activity or furtherance of the activity. So this is a part I should like to focus on. The second thing is things that Mr. Filiotis mentioned earlier. Governments, Mr. Souliotis rather, said that political formations have a tendency to reject or to set aside successful examples of previous governments, or either reject them or to allow them to fall into disrepute by not using them. So there are consequences in the politics and the policy of health over the past 2.5 years during this government's term of office. And there was work done by the previous government that was put to good use, in my opinion. The very good work done at the level of digital infrastructures that was utilized, and was utilized positively, both during the pandemic and in the use of health services by the citizens. I don't know about the health system management. I don't know whether we have a better picture of the situation. We did have this difficulty. Monitoring the health system or the management of the health system is a timeless problem. This on time that we call it, it's usually the data, to connect with the previous reference, the data come in a delayed manner to those who evaluate and make the decisions. So this is, I believe, a point that I will be happy to hear that progress has been made, and maybe it's a target for the next period on which we can agree. The part of receivers participating even in the decisions or the management of the health system, the healthcare recipients, is an issue where consensus has been achieved. It's a request on behalf of the recipients, and I believe that it's very difficult for political forces to find things to say against it. And it helps with the efficiency of health systems, helps with transparency, with management, with procurements, with everything. And one more issue that is very important has to do with accountability. The accountability of those who have positions of responsibility in management. And these are interventions that you very well know are not costly, financial, fiscal cost, no cost. But they help very much in enhancing the reliability of the system. I'm referring to the example of establishing social accountability of health structure managements to the local societies. We did this very systematically when we were in power. I don't know whether it stopped completely, but I haven't seen for quite some time a similar initiative. I beg to disagree, because I was in the system. There was none. There was none. Not in the past, not just in the past, but there was none. Now, I believe this is a point of disagreement. Now, I'm talking about the open accountability to local societies, that you could hear anything ranging from very serious things down to opinions that were borderline serious. But at any rate, it gave the impression that health services had some connection and some link to the local societies. And it was very important in the everyday life of the health system. And it was very important in exercising management by the people who had the responsibility to manage the health structures. I would like to close my parenthesis here. But I believe that there are cases in which the government could continue some positive steps taken by our governments. Another one is the interpartisan committee on drugs. It was an effort to co-shape decisions. The area of the drugs, it's very sensitive, critical, and very expensive, if I may, area. It's a matter, it's a spearhead. Okay, if we can have consensus on behalf of the political forces, the more we have consensus, the more we can allow the market to plan ahead with some greater safety or security, if it's possible. But even at the level of financial management, we have a bigger safety and a better management, ease of management. Another issue, I don't know how we're doing time-wise. It's another issue that I believe that this government could carry on. It was an important intervention for us. It could be modified or changed. It's the primary health care. And I'm talking primarily about the local health units. They started being developed. During the previous government, we had 127 in place. It's a common understanding through the evaluation reports and from what we perceive from the local communities with a very positive mark and footprint, was that the estimate we had is that that institution ceased, or rather paused, if I may. I didn't want to say ceased, I said paused. It was, of course, dragged by the pandemic or the low priority it had, and it fell into disrepute and disuse. And 3 years later, I'm taking into consideration the health crisis as well. The government comes again with another legislative proposal in the area of primary healthcare. It's the personal doctor. Parts of it were part of Law 4486 of 2017 to go into an entirely different rationale with improved financial terms. We need to accept that and acknowledge that, both for private doctors and public doctors, public health system doctors who will participate in this institution of the personal doctor. Let's see how this works, but what I maintain is that in a country that has a rather privatized part of primary healthcare, I think 80% of primary healthcare expenditure is private sector. It's covered by private sector, if I'm not mistaken. The parallel development of public structures would improve tangibly the level of services to the citizens. This is something I should like to point out as a point that continuity could be observed. And at the end of the day, we heard a lot about the Tommies, that they were Soviet-inspired units, and I'll be rather provocative to say that, well, we wish that the European Union funds to fund such structures. They were not Soviet structures. Alternate Minister says, well, no, I did not say that. The response is that, yeah, of course, it was your predecessor. But in fields where we have a distinct, or rather a marked monopoly presence of the private sector, the development of services on behalf of the public health sector that can be beneficial for the public interest may have an important regulatory role to cover needs that many a time the private sector understands their coverage differently. For instance, the primary healthcare structures that have interventions as well in public health, and it's not easy for the private sector to do interventions in public health. They will, well, private doctors will not make an epidemiological evaluation. There's no scheme to intervene in the community, in the promotion of health. Why, says alternate minister, why can't they? What, in an organized way? What, a freelance doctor? Yes, of course, why not? What, the checkups and the prevention programs? I think it's a one-use, single use. No, there needs to be a change of mentality from the doctors that starts from education, training, and goes into the way we do medicine in the primary healthcare. This is what I mean. Okay, I beg to differ. I insist that these public structures... Well, of course, I'm interested in the public health system, but there are people who provide services who are in the private sector and people prefers them and go there, and they can do their work very well and to do it in an organized manner on the basis of instructions issued by the public sector. I mean, okay, it's the duty rosters, and then the duties, it's something we know. Well, madam, of course I'm not referring to that. It's still happening. The more protocols you have, the more evaluation and assessment tools you have. The part of governance of this system and the cooperating providers plays a role and is very useful. What I'm saying is that organized prevention and community intervention is a very difficult de facto thing to be done by the private sector. There, you need the public structures. I will respond to that, says the alternate minister. So you need the parts of the social state to communicate with one another. Yes, it goes without saying, says the alternate minister. So I believe that the government did not assign the gravitas it should and the priority. I don't know whether it was a political choice that is there. It was a choice. Yes, I will answer to that, says the alternate minister. Yes, I'd be glad to hear your answer. So you said, and I heard it very positively, about progress in the TEPs. It was a very important thing to actually make new jobs in the TEPs of the country. Of course, there was the institutional shell that needed to be completed, and it's a very important thing to see this progress. And also parts, to come to a conclusion, parts in which we believe that we need to agree, and there is a field for consensus. It is the need to enhance and support the healthcare system. And there is a need to staff people more. So it was not 5 or 10 years ago. So you know very well the systems that are based on the human factor are very difficult to be built. They're very easy when you don't work in the way you want and the intensity you need and the sufficiency of funds for them to have a problem catching up with the forerunners. So we need a plan of investment in human resources. And let's close with this so that we can move on. So in a permanent way, through an improvement of the conditions and the remunerations, with full and exclusive jobs, and this is a point that we will disagree, of course, and definitely with incentives, particularly with those structures that in the insular part of the country cannot, at the moment, sufficiently attract doctors, and they cannot respond and meet their goals and their targets. We need steady points of health service there. I mean, the example of Paxi is something that no one could disagree. I mean, we don't need a 400-bed hospital on Paxi, but we need a pediatrician in Ikaria or on Sami.
We need some time for the questions after your interventions. I do understand what you're saying, that we need to have continuation in the good practices. I see that you agree, but please allow me, in my capacity as an observer, though you agree, you tend to disagree in your public discourse. So I want to give the floor to Mr. Yannitis. How do you see this discussion going on? Under which circumstances can we expect consensus in this area? Thank you, and thank you for the invitation to be in this conference. I'd like to thank Mr. Bekatselos, the president of the chamber. You know, when I received the invitation, I remembered something that maybe you remember. Nikos Egonopoulos, do you know this name? A poet, a surrealist. There is a verse in one of his poems saying, "General, what did you want? Why were you in Larissa? You are a Jew." So that's how I feel now, because everybody has a relation with each other. I am like, the outsider. Nevertheless, I am here to speak about certain topics, and I have thought about these because they are very interesting. So I shall try to share with you my thoughts organized in 5 remarks. Number 1, the recent COVID crisis showed that the risks in the health system as a tool to deal with these risks can very quickly become a normality, and the politicians in general have to be able to respond to new, unprecedented problems. Let me note that the fact that a system like the health system can go through several changes and be extraordinary instead of ordinary based on several crises, this can be a problem for many other types of areas of policy, not only health policy. And it's not only the policy that is going to provide measures or solutions to the problems that you have painted throughout the morning. Second remark, consensus, commitments, and collective action. I think that this is much more important than we tend to imagine. Obviously, there is a misinterpretation here that there is no consensus. This is not true. There are huge consensus in a very specific area, which is do nothing. We all agree that we do not do anything. Many stakeholders agree that they won't do anything, no matter what the problem. Of course, I'm not speaking about consensus at the lower denominator, But a collective action could be today a critical term for the success or failure of a political endeavor. For which are related to the new landscape for two reasons. First, the pandemics, as you know better than me, are connected to many unknown factors and can be global. And second, the health problems are not a localized problem. They are a part of a new category, unprecedented global risks, as for example, at the model of climate change, climate immigration, etc., that cannot be dealt with locally by a country alone. So we need to have the synergy of several countries that will work together. If we had only some health problems or a pandemic, it would be different. But now we have another situation. We have many crises together. And we might have unprecedented incidents. So if you want to deal with such a threat as health problems, for example, this would mean that you cannot act individually, but you have to prioritize your problems because a government has many types of problems. So you need to take money from somewhere to give to the appropriations of health. If we have multiple risks, the more protection that we want to give to a specific of the risks, the less efficient you will become in dealing with the other risks. Point number 2, consensus is necessary not only during pandemics for the health system, but for many other reasons. Of course, we have demographics, which presents an obvious aging problem, but the reasons are that the developments that we go through are not just developments, they are a paradigm shift that disrupt our daily life. The problems today are very complex and difficult to be acknowledged by the current political mindset. The political profile of society is important to take into consideration. I believe that all governments are condemned to be unsuccessful if they have to deal with multiple problems. Every government will know that they have many failures to face because it is humanly impossible to deal with so many different serious problems successfully. Nevertheless, many societies, ours included, are characterized by acute and artificial collisions sometimes. Collisions just for the sake of the conflict, without any reason whatsoever. And the major question here that relates to the central topic of our panel is how to reach consensus and what kind of consensus when the elements of political careers are at the other side of society's growth. Remark number 3, we do not know beforehand when the menaces are going to be actualized, how and when, And since it is impossible to have beforehand an efficient defense system to deal with all kinds of risks that might come up, it is logical for somebody who doesn't know the details of the medical fields to provide a strategy of a flexible organization and structure of the health system. This is not logical, and it's not logical to have standalone infrastructures here and there in a country without having an overarching planning. Of course, the health system is very sensitive one and has very specific characteristics. You need to be prepared so as to intervene efficiently. Such a strategy is related with funding, of course, organization of the system, new facilities, new specialized knowledge, and the organization of different mindsets and synergies in between different bodies. I know that the pharmaceutical companies in Greece have achieved very important milestones during the last 15, 20 years. This is also related to the services provided by certain professionals in the medical area. A critical economic denominator to all the aforementioned, in order to have the equipment and infrastructures and the medicine and systems in place. So a denominator for any major issue is productivity and the achievement of good growth rates. So this is another type of discussion related to the success of policy making in general. If we have a growth momentum, then a government will be able and well motivated to face any type of menaces, because the need to accumulate resources to the hotlines will not make you absorb funds from other serious areas of your policy. On the other hand, a low growth rate has, of course, several impact to society, but also low remuneration to the medical professionals. Remark number 4. In the conditions that are going to prevail, the state is going to play a very important role. Everybody speaks about the state without any ideology behind the discussions, and they all want to understand which is going to be the role of the state. But not any state, not a state that will have certain partisan or political preferences and do not deal with the problems, but rather with other dimensions of the problem's expressions. But apart from the state, we also have the political system as a whole, the political powers, forces, and bodies and persons. We need a more open system of critical thinking and understanding collective values and purposes that will refer to both bodies, institutions, and persons. We need other types of behaviors, other types of awarenesses. The problem is that today, the society, in less than 15 years, has gone through three important turbulences: political crisis, an economic crisis, a social crisis, and a health crisis. For this reason, we have seen in the society skepticism about the main values. The GDP of the country is suffering. The GDP of the country in 2022 is equal to the one we had in 2004. This means that we have worsened our position, and that's why the population do not trust the politicians, and they do not seem to embrace rationality in their positions or decisions. And this seems to be very well weaved with the people's mindset. I've seen, for example, behaviors during the pandemic. So I believe that a total, an overall, a holistic involvement of the society, along with the states, the government's policies, can ensure success of a policy. Of course, I do not have a specific example in mind where Athens, for example, or other major cities or areas in Greece will be extremely so happy as to go out in the streets and shout hooray. But of course, we understand that the problems are here, and the problems make us fail. And remark number 5, my last remark, we saw that there is disagreement in between parts of the society and the policies. We saw responsibility and irresponsibility at the same time in the same policies. I think we need to have a way to give efficient solutions to major problems, no matter what the reactions of big parts of the populations might be. We need to see how we can continue, no matter whether people react, without, however, being authoritarian in our governance. Of course, I cannot speak any solutions. The solutions are not a matter of a person, but a matter of group work. Trying to be politically correct regarding the characteristics of people, we have also to consider that responsibility is an important characteristic for everyone, especially in positions of power. Thank you. I do agree with you that we are at an age of disruption. We see the paradigm shifts in many areas of life, but of course the political system is to blame for this. Sometimes it conceals the problem. In the health area, for example, we do not have any reserves. So if a need emerges, we don't have the means to support it, to support the solution. Also, it is problematic that health expenditures are considered to be costs. We do not understand that this is also an investment. a higher expenditure for health services is depicted as cost only. I do agree with you that sometimes if the governments try not to make anyone unhappy, then they cannot they cannot function properly. Because accountability has to be taken into consideration where decisions and political decisions are taken. Not all politicians agree with each other. We have our differences. So let me ask another question. What about populism? Did you recognize the populism that in the public discourse during the pandemic, for example, vaccination, etc., which made people not having confidence in the proposals that the government made? 99% of the scientists said that this is the situation, while people would believe something totally different. So we had the conspiracy theories, etc. How do you comment on this?
Well, of course, it was cause of concern, not just from one part of the health system, but all this negativity, what it did is it hurts, and it's been mentioned by constitutional specialists and everyone, but it was not stressed as it should have. I mean, you can't attack a fundamental right of someone, which is health, life, or death, because you have this or the other opinion. This cannot be done, or even if it's done, we need to see why. Second, what I saw is that it did not only concern Greece. I mean, we thought that it was only us in the beginning, and this is what makes us feel that we are this way or another. Of late, I don't mean the past 2 years, I mean the last 6, 7, 8 years, we saw that in many societies that we considered as operating in a rational way or a more effective and efficient way, we saw phenomena and things that, went above and beyond the criticism we had for our own selves here in Greece. This, of course, raises a wider and deeper concern and a problem. Phenomena like pandemics are not opportunistic and are not once in every while, but they're far more frequent. Not in the form of the pandemic, of course, but in the form of something like that. So the question is, what happens when large parts of the society cannot agree and support, efforts that does not need unanimity, but huge chunks of society need to support it. And if they need to follow policies because people are offended because they think they're heard, but being offended is different than reacting just for the sake of reaction. So there one needs to see how societies operate under this new system. Disagreements like the ones we had in Greece and elsewhere are the best recipe for failure. And this is something we've seen, how societies that have managed to come into terms and agreement in their interior, historically, not just now, have made it better, much better than we have. Societies that only live in dissent and dispute and in disagreement have managed to be much more regressive. We believe that say fakir in India does not care what happened in the civilized world as per capita income. I'm happy to be here, so that's the end of the story, okay, end of the line. Right, thank you very much. Mr. Vardaros, if I may to say something about what you said earlier. You said that the private sector cannot support prevention programs. Now, this huge fragmentation and compartmentalization is socially wrong. It's not important who holds the means of production. The matter and the issue is to have access to the services without burdening themselves financially. And as an example there, is the 11,000 private pharmacies. So when someone goes there and exercise their insurance right, do not go to the private sector, they go to what we call the social state. So I think that you have over-evaluated and overstated the position of the means of production. A certified medical center or a certified pharmacy is part of our social state. It's not something outside of it. And I'm saying this because you mentioned earlier that prevention programs cannot run like that. If there is central planning and the population's targets have been defined, etc., etc., there is nothing wrong. And it has nothing to be jealous of from any other system. And we're talking about the flexibility that is much more rational in the private sector, and it's much more speedy implementation. This is like a remark, but I would like your comment. And I have a question. Did the government do everything wrong in the management of the pandemic? Did you disagree with everything? A second. You talk about hiring and new jobs, and I have the same question for you, Mrs. Gaga. Have you evaluated the needs? So if I came here with a bag full of money and I said, hire as many nurses and doctors you need and I can pay for them, do you know where they will go, to which structures and why? Do you know where the gaps are and say we need 5,000 nurses, or is it just a number you're tossing around because it sounds good and it's attractive? This is my gravest concern. That there is a planning not on the basis of documentation and evidence-based, but just to sound right. And this is a question I have for the both of you. And one last thing. People accuse you that you didn't have a clear-cut position during crucial and critical period for various issues such as, for instance, vaccination. These are my questions, and I would like to answer very, very fast if you can. Well, Mr. Souliadis, it's impossible to answer these questions shortly. First of all, I agree with the ascertainment. It's not the approval of a theory. There is no, fixation as to who holds the means of production, but history in this country has shown that the private sector, or rather I have a feeling that the optimum use of resources is not something I see happen everywhere in the public-private sector, rather. There is a difference, a value difference. The public health system meets the needs for health services, and the private sector has, not always, many a time, this, induced demand. And this difference causes distortions. What I said in my initial introduction is that when you have public structures that incorporate and integrate a series of functions under the wider umbrella of the primary healthcare with integrated health services, this example is something that you carry on, you evolve it, you develop it. If there are difficulties, you evaluate and assess it, there are positive evaluations, and you correct. You do not leave it stagnant for 3 years, allow it to fall into disrepute through the non-use, and then update part of the previous planning, the private doctor, and say that I will introduce protocols, I will have them participate in prevention programs and this and that, because I've come up with resources. Because this is not rational either. This was the substance, the essence of my previous remark. Now, regarding staffing, yes, we're talking about quantity, but at the same time we need to redesign what needs we want the health structures all over the country to cover. I do agree that we need to redesign and redefine the health map and the health services map in the country, and we need to develop new services that the SC, the National Healthcare System, has no presence. I mean, in physical rehabilitation, there are very few structures, and they are underdeveloped. So it will help us to have to evaluate all this in terms of public interest and trying to achieve better services at better prices. Now, this is not something we heard, but this is one of the targets. So regarding the last part, so yes, staffing, we have the plan regarding the 15.5 thousand hirings. It's to have new permanent hirings, to have permanent jobs. We are making a comparison with a permanent post because these permanent tenders may work and say that, well, we did advertise a position on Kalimnos and they didn't go. So we need a continuity here. We need a prospect. We saw this during our time in power when people were in Germany, for instance, and their primary care was not the wages and the salaries, because they couldn't have comparable salaries in Greece as in Germany, for instance. But they want to have a prospect that there is a plan, there is a design for more jobs to open up, and I need to have some job safety and security when I go to serve in such a structure. I will not be alone in a clinic. There will be other doctors for support, and I will have the support through telemedicine by a reference center or a university center even from the mainland, from the continental country, from the more central health structures. So this answers the losses we had, not in 2019, but even in 2015. We had a 5-to-1 hirings to hirings ratio by the institutions. So we needed to have this keep going and not have it interrupted through the replacement of many people by people with contract holders. So this is part of the incentives to enhance and support the health system. And the last thing you raised was whether our position was clear or not on key issues. I think we were very clear and very timely when we talked about vaccinations, our official position on vaccinations. Syriza Progressive Alliance, through our president Alexis Tsipras and through Andreas Xanthos, the unit head. So our position was that of in support of the vaccination campaign in symbols and in essence. They were the first ones to vaccinate themselves, our members, well, most of them, and they were there all over the political spectrum and all over society. And Professor Mithyanidis said things very, very correctly. There were different voices heard. It is part of a democracy, isn't it? There were different voices heard within the very health system. So one disagreement we had was that regarding the employees of the healthcare system that were suspended. I mean, it is irrational, okay, for people who were not vaccinated for this or that because their education was problematic or the training was problematic, or because they were misinformed or uninformed, or they were not the recipient of targeted information. We had many cases of nurses, young girls, who listened to OB-GYNs who said, if you are pregnant now, the child will be born with problems. So there was a huge impact on behalf of the church. Many religious people working for the healthcare system were influenced more by the theological indoctrination rather than scientific truth. We did see these things as well, but we supported back then and we still support now, is that especially for those people, you could have adopted increased safety measures for them and the patients and the rest of the staff to be active, because it was like shooting oneself in the foot to take these people offline at a value level as well. It is perfectly acceptable, the right to protect public health, but there is also the equally respectable right to employment. These were not people who had, well, most of them multiple sources of income. Their salary was their livelihood, and they were put off the health system in an exaggerating or authoritarian and unfair way. I don't know whether I covered all the questions. Yes, absolutely, says the moderator, who gives the floor to the alternate minister to close this meeting and to comment on what was said. And I have one question for you. If you have a plan for the evolution of the national healthcare system and an answer to the accusations made to you that you did not enhance the national health system primarily during the pandemic. Now, I've been working for 35 years in the national health system, not one or two, from the time that I was an intern. Well, you don't look it, madam. Right, well, thank you, but I do believe in a national health system that is flexible, that follows the times, that follows the wishes of the patients and the wishes of its staff. You already spoke Mr. Siliotis during your introduction that 1/3 of the patients wants to pay for something. Now, in the morning, we were in a telco with the WHO, and the first speaker was Dr. Crook from Harvard University, with whom we will run a study now. Because we're very interested in the health services users' opinions to design everything. And he said anywhere between 10 to 35% health users in health systems such as the French one or the American one are not satisfied with the way the health system deals with them. So the first thing we're interested in is for health users to be satisfied in the way they're being dealt with, that their needs are met. And health workers, health professionals, to feel that they are productive and that they are remunerated appropriately. Now, when they were suspended, I was not with the ministry, I was with the hospital, and I thought that reasonable because we were missing people. I went to Yanitsa. One of our colleagues was in Hippocration in Thessaloniki, and we didn't have the COVID vaccination yet. So it was very important that we lost people, and it's not reasonable as the government to say that I will leave those who have this opinion to join a COVID department. It's perfectly reasonable. It's not just for public health, it's for public health as well, but it was primarily for the protection of themselves because people were lost. Healthcare professionals were lost. Things have changed. It's something we see, and we'll probably make another decision. We can see this as per the epidemiological data because we have other issues that concern all of us. So, in order to make health planning, we need to have data. I hear what you say about the region. I worked in Athens, and the hospital management never was accountable with the local community or anyone. Now, whatever we said was not met with any interest. But truth be told, local society is very important, but the local society cannot do health design and planning for a country, for a government. Let's say we have the island of Rhodes. There is a hospital in the northern part of the island. If someone wants to go from Pefkus or anywhere south, will need 90 minutes driving. So we need to have another health structure closer. We also need some specialized doctors. We will go there some days. Now we have Lasithi. 4 hospitals, population lower than Rethymno with 1 hospital, doctors twice as many as Rethymno with fewer population. There's no reason in this, there's no rationale. So people need to have their hospital, they need to have their care, but we can't need 150 doctors for the same population that need more people there. So it's something that we need to see as a society, because I need to remind everyone that free of charge is something that means that I, as the Greek taxpayer, pay, and the money I pay is managed by the government and it channels them somewhere. So I need to pay the money to have a viable and sustainable system. So the only thing we need more is data. What do we need? We need to deal with emergencies appropriately. We need to deal with chronic diseases appropriately. We can't have surgeons or neurosurgeons everywhere, but we need to have a standardized procedure on the basis of which patients will need cardiological surgery or neurological surgery to have them, or to schedule surgeries that can also be performed in small hospitals, even if we need to have teams of people to go there. This is something we will discuss. And there we need consensus because it concerns us all. I need to say that at this point that trust is something that we lack in Greek society. Why? Well, because the state, through time, does not handle and does not take citizens as sincere and honest. And the same goes with the citizens. And the biggest problem of the Greek state is that everything changes day after day. So you try to do some programming or a planning, you're a businessman, you start a business, and in 3 months the law has changed and it's different. So you go as a doctor to some place and in 3 months things change and you need to do something different. So this is impossible. The consensus we need is for the long-term planning that we all need. What we also need is to clarify our laws. So the 3 things that I need, we need to keep as a take-home message and have a consensus is to listen, agree, and that we are there to listen. Okay, it does not mean that we will all manage things together. We'll make the decisions together, but it means that we will have listened to everyone before making the decisions. The decisions need to be made, and they will be made. And truth be told, decisions must not be changed the day after. We had a meeting with BIS yesterday. I said 3 things. Out of these 3 things, our colleagues do 2 of them and use them to their benefit. It's not a political way to work. We say the whole truth and we move forward. When I go out and say that Greece has more cardiosurgical centers than we need, and the minimum cardiosurgical center has 650 cases, and the other person says that they have cardiosurgical centers we need more, depending on the cases, these are not the data. The data say that the smallest cardiosurgeon has 650 people. It's not 12 centers per population. England may perform surgery on half Egypt and half India or France or anything. Their cases are there. It's not only that their cases are there, it's written how well they did and the mortality they have and the disabilities they have. These are the things that we need to follow all together. We need to put forward and to start. We want to have high quality health services, and we want to have high quality health services everywhere, and we want to have the new drugs. We want to have drugs that we will not spend the whole budget of indication, but where we need in the patients who will truly make a difference in their lives. We see about drugs in cystic fibrosis that have changed the lives of children who would die at the age of 20 or 25. Now they live good lives with high quality. If it's 200,000 euros per year, we need to pay 200,000 per year. This is worth it. We need to think about other things, and we also need to think that at the moment we don't have rules for specific things. We have hospitalizations abroad and drugs that cost 1,800,000 because someone shouts and takes it. It's not a way to work as a state. The way to work as a state is this. These are the rules. The basis of these rules that are the same for everyone, because we are a state of we are here. And we are a state of law, or a rule of law. This happens not because I have a friend with the government, I receive the drug because I put pressure. These are things that we need to say for everyone to know. We clearly want what's best for all patients. We clearly want what's best for Greek citizens, and this is definitely the best for everyone, not for the one who shouts the most or the one who raises the more havoc. This is what I can say. Let's keep this as a take-home message, and the best condition to have the wider consensus and consents is to have discussion, and not just discussions behind closed doors with pressure groups. The request for democracy in health is here. We evolve as a country, and we need to congratulate you for the initiative, and the previous government did a similar attempt. We're talking about patient centricity, and we need to go by the law. The health systems serve patients primarily, and secondarily their creators. I would like to thank you all very much, all speakers, for this brilliant discussion. We have a light lunch break, and we will be back in half an hour's time.
Good afternoon, Natasha Sparadorou. I thank you for being here. And I thank, of course, the team of the Hellenic American Chamber for their invitation for me to come here and moderate the panels. The HealthWorld of the Hellenic American Chamber is an institution in the health sector. We are honored and happy to connect with a very important scientist online, Mr. Yorgos Pavlakis, researcher of the Cancer Institute of the USA, with research focusing on viruses and immunotherapies, especially focusing on cancer. He has contributed to the creation of new vaccines and medicine. Welcome, Mr. Pavlakis. Thank you very much for the introduction. I would like to thank the organizers for the opportunity to be among you, and I would like to speak about biotechnologies and not the pandemic, the COVID pandemic, but I am open to any topic. We are very happy that you are here. Here we are today after 2 years of pandemic, almost 3 years now. We have seen major changes all over the world. We have seen many changes in the society, in our behaviors, the labor market. How do you believe that the next period will go? Do you worry that we have flu and pandemic and COVID together? Last year, I believed that we would reach normality before the pandemic would end, and this takes place indeed already. But unfortunately, the pandemic is still here, and we are having a problematic winter in front of us because the citizens are not careful anymore. And this is, of course, necessary because otherwise we would be very stressed. At the same time, we see many different types of problems, financial problems, for example, or social ones. As regards your question, as regards the future, many scientists expect a new wave of COVID-19 next winter. I'm sure that we'll see a wave of the virus in Greece due to the aged population and the fact that people are not wearing masks anymore. Already we have seen the numbers rising, the COVID cases rising every week. The good news is that it seems that we have only the O5 type in Greece, which can be well dealt with the new vaccines. But of course, there are new types out there which are coming. As regards flu and other respiratory viruses, they have started expanding already. So I'm afraid to see these two together. Because if the epidemic waves coexist, simultaneous, then we'll have more serious implications. So I think that Greece has to avoid what happened last winter, which was the worst in the pandemic. But of course, we need to be very attentive and careful, and my advice would be vaccination and public health measures with the masks in specific areas, concentration areas, which is a simple measure. So you're not so optimistic as I hear, but nevertheless, let me ask you. You have frequently said that COVID was never a flu, a simple flu. So has it changed since the beginning of the pandemic? And has the disease that it causes changed? And since you mentioned the updated vaccines, I would like your opinion, dear professor, because the next jobs are boosting the organism, but I think that many people are afraid. They don't want to go to be vaccinated. They are not very. They do not trust whether their immune system is going to be influenced. We know that the virus changes every 3 or 4 months. And the new types are more aggressive than the previous ones. They are very different than the initial stem and the initial strand. And however, though, the diseases that are caused are not so different. What has changed is us, because now we are vaccinated. And now we have different levels. We have a stronger immune system. Unfortunately, the problem remains that COVID creates problems in many parts of the body. It's neurotoxical, and it's not. It shouldn't be out there. We would have victims continuously then. We don't want our children, our students, to be exposed to these viruses again and again every year, because these can lead to further damage. As regards the updated vaccines, I believe that they're going to be very helpful, especially in the beginning of the winter, while we're having the O5. When the new strands are coming, probably PQ1, then in this case, the vaccines may be not so helpful, but nevertheless, they are going to boost our immune response. Nevertheless, let me add that I wouldn't be afraid to get a jab every year. On the contrary, I think that everyone should understand that we have a new virus here, which is worse than the flu, but needs a similar response to update our vaccination every year. Until we have the annual one, which seems that is still delayed. But what you say is encouraging. You're not afraid of the new jabs. No, of course not. The vaccines at hand have been proved very safe in relation to whatever we had until today. So I personally am not afraid to administer one every year. Recently, Tom Vesseler, the developing biologist from Ludwig, has written that that's why we have resurges of the epidemic again and again, every now and then, and rather serious ones. And this is the reason why he says, as a scientist, to endorse vaccination because otherwise the immune system is not going to be well supported. Of course, you have the index of hospitalizations as well. All the indices are useful. An important problem is resistance to the virus a few months after vaccination. This is a huge problem and a long-term one. That's why we need the extra jabs, because these booster shots help us boost our immune system. So this way, we hope that will deter the next waves of the virus. Another important problem is that we don't take measures like wearing a mask, because without measures, we cannot block out the major pandemic waves. When we have such waves, we have new viruses along with the COVID. So epidemics run in waves. Okay, what about the treatment medication that we have? Monoclonal antibodies, etc. Are they helpful for those who suffer from the disease, especially the vulnerable groups? Yes, we have progressed a lot in these treatments. We have very efficient treatments, especially for the elderly. If you are in these groups, you need to see your doctor right away on the first day you have a symptom and take medication. Especially if you take your medication in the first 5 days, this is going to help. This will be very helpful. Now, the monoclonal antibody aerosol, it's the only one that has been left against Omicron and therapy. We have further medications that are coming. Apart from Paxlovid and Remdesivir. Let me ask you one more thing. Do you have any worries about the coming winter, apart from COVID? Do we have any other challenges in the health area? The apes pox is another danger for public health. We have seen some cases in Greece. So what can we do in order to be protected? And maybe do we have a new pandemic under Portas? The situation that you just described is that we have already entered an era of pandemics. I would like to stress once again that despite the various menaces that are around, the neurotoxic COVID variations make me more afraid than any other virus. This is a new dimension that we didn't have before, because no other virus changes so drastically and so quickly. Polio virus, where we had one case in 200 children, hasn't created so many problems in the society. However, on the other side, coronavirus might be even worse. worse than the polio viruses, at least as regards the frequency of neurological implications, as well as thrombosis and pneumonias and deaths, of course. But certainly it's not only COVID. We have more viruses that can create new pandemics, as the one that you mentioned, and also flu. In the next few years, we foresee that it will come back very dynamically. I remember that we have treated the pox the same way as we had with the HIV. So here we are in a new era of pandemics with new pathogens like coronavirus that adapts to the human life very quickly. I do remember, since you mentioned flu, that 1 year ago I had asked you, when is the next pandemic knocking on our door? And you said in 3 years, and we'll have a flu pandemic. Yes, this is my forecast, unfortunately. We need to take stock of our knowledge and in order to be able to deal with all the other pandemics that are coming. Pox virus is here already. It's going to be very problematic if we leave it grow in our society. So, in conclusion, dear Professor, can we prepare ourselves for the major public health challenges that are ahead? Can we expect that we shall go back to the life we had before COVID? We need to close the discussion capitalizing on the lessons learned. We have to say that the global society can organize itself efficiently. Technology has progressed a lot and will manage to succeed as long as we do not repeat the mistakes of the past. The pandemic is here. We have to remember this, and we need to strive persistently in order to take care of it. We need a primary care system, a very good health system, and very good medical professional. The scientific progress has given us all the tools to provide solutions for coronavirus and any new pandemics and epidemics. We have vaccines, we have diagnostics, we have drugs. We had these last year as well, but we need to inform the audiences properly. In addition, all other measures have managed to control the numbers of deaths, and the progress is huge since last year. This year, we're not going to allow thousands of deaths. This is going to be a major failure. Other countries have done this since last year. So the main message is get your shot and try to be protected, wear your masks, and especially in indoor spaces. We're going to take your advice and follow what you say. Thank you very much, Professor, for being with us. We were very honored that you were with us here today to share your knowledge. Thank you for inviting me.
We should like to thank Professor Pavlakis and of course Mrs. Pagadorou for the beautiful discussion. And we'll move on to the third session, Building an Innovative Biotechnology Ecosystem, Incentives to Support and Attract Investment, moderated by Professor Achilleas Gravanis, teaching pharmacology at the Medical School of the University of Crete. And we should like to call to the floor Mr. Vasilis Kontozamanis, Mr. Ragoussis, and Mr. Artavanis, I think virtually will join us. So you have the floor, sir. I should like to thank the Hellenic American Chamber of Commerce for the kind invitation. We have a very important, in my opinion, subject for the future of the country, not just at the level of economy, but also at the level of education, at the level of health. As we heard rather convincingly, the issue of health does have reference to the economy. So I believe that what we will be discussing today is a subject that is directly linked to the modernization of the country in the years to come. What we usually don't do in Greece is to take a look at what happens in countries that have a tradition in issues, and we try in an organized way to transfer that experience to our country. So for this to happen in biotechnology, let's see what the international ecosystem of biotechnology has as stakeholders and how they react. First of all, especially after the outsourcing, the main source of development of new knowledge and innovation is the academic and research institutions. We know that a large part of private sector investments, primarily in the United States and Europe, goes no longer to in-house research and development, but to close collaborations with academic institutions, institutes, and new startups. The amount is very high and amounts to billions of dollars per year. So the difference is the tax systems and state funding for them to facilitate truly investments from abroad, international investment, that is. The third pillar and factor is the private sector. It's what the sector that takes the risk, which is very large in biotechnology and pharmaceutical industry, so that the necessary funds are there and available for research and development to progress. Today we have three very important representatives of all these three stakeholders. Mr. Kontozamanis, former alternate Minister of Health and currently Special Advisor to the Prime Minister in health and biotechnology and pharmaceutical technology issues, was both fortunate and unfortunate to be the first one to deal with the huge and unprecedented for us issue of the pandemic, and in a way that was particularly efficient with his colleagues and his co-workers, and they were the object of discussion the world over. Academia is represented by allow me to call him, legendary figure of academia, Spiros Artavanis Tsakonas from the University of Harvard University, because he was for years the chief scientific advisor for development of new drugs. And of course, the private sector is represented by Mr. Zachary Ragoussis, who comes from a company that is also a legendary figure, at least over the couple of years, with another couple of companies that helped us in the field of medicine, but also society as a whole, to deal the pandemic in a rather efficient way. At this point, I should like you to take no more than 5 or 6 minutes. You're all very experienced, so that we can have time for discussion. I would like to give the floor first to Mr. Kontozamanis for no more than 6 minutes. Thank you, Mr. Gravanis. I would like to thank the AmCham for the invitation to participate to this very interesting panel. You made rather a reference to the pandemic. Allow me to say that what we lived through, what we experienced, were unique. They were historic moments for the country. And the weapons we used in the pandemic management using biotechnology are the best proof of how much biotechnology has changed the landscape of health and to what extent the development of biotechnology drugs has improved human health overall. In December of 2020, if memory serves, I think we had a first meeting which we presented last May, presented to the Prime Minister. The object was how Greece can become a hub for biotechnology. We had the distinct pleasure of having high-ranking officials from pharma and biotechnology join us, most of them Greeks from the diaspora who had very successful careers abroad and shared their experience with us. And please allow me to say that all these people had been invited in the past again to share their experience, to give suggestions, provide suggestions, and it was said quite clearly that we said these things before. The issue is for you to implement them. And I would be remiss if I didn't say that this is Greece's chance. It's now or never. We need to see how we will implement these proposals, and Greece can in fact become a hub in biotechnology. There are big countries like France, Germany, China, the United States and the United Kingdom who are very active in biotechnology, but there are smaller countries like Belgium, Israel, Switzerland have a very noted and marked presence in biotechnology, and there Greece can in fact take a very small piece as regards the pie of biotechnology. And the competitive edge for our country is the human capital we have. And this can be seen from the study also that we have submitted and we have filed and we're implementing it. It's more an issue of human capital rather than monetary resources in order to develop this sector in Greece. And this is what we are planning to do. The initiatives described in the report have to do primarily with investing in fundamental research, and Spiros Artavanis is indeed the most appropriate person to talk about that, so I will yield the floor to him shortly. And this has to do with the upgrade of both quality and quantity of research in Greece. And of course it's the incentives that need to be provided for companies, biotechnology companies to come to Greece actually. And it has to do primarily with the production of drugs, with clinical trials and biopharmaceutical services. Because, well, we see that companies outsource a lot of services. And here is indeed a field of glory for us, because we do have the human capital and we do have the infrastructures as a country now in order to support such services, and we can and should bring these investments back home. So the part of production is very important. We need to spread the message that, Greece is investment friendly, and we have clinical trials where we have a lot of quite a long way to go. But I believe that everyone is in agreement as to what needs to be done. We know what must be done and we'll do it. So I believe that we will get a great part from the clinical trials, a big chunk of clinical trials. So it's the part of services where Greece can be a hub, and we can reverse the brain drain, bring the people back to Greece. What is also very important is the findings of our report, which is from our survey or our study. Provided we have the terms and requirements, as we can see from this study and report, to create the appropriate conditions to attract more investments, it is very easy after that for the investments to actually come, because it's more an issue of human resources and human capital rather than funds. And this is the reason why a company would actually come and invest in our country. What I should like to say and reiterate in conclusion, so as not to take up too much of our time, is that indeed the study, and we all know this, concludes by saying that yes, Greece can in fact become a hub for biotechnology despite the fact that we are a small country. And this is made absolutely clear by many factors, and primarily from the developments in biotechnology that show that a very small entity can create something very big and even to be disruptive, as we say in our native tongue. Technology varies and is very wide, so there is room for competition for all companies, be they small or large. And the structure of biotechnological products, primarily as regards cost, they are of high cost, indicates that it is more an issue of, how shall I put it, more an issue of quality rather than the productive capacity of a country, i.e. Greece, in order to produce biological products. And the big advantage, the big edge, is that we have Greeks not only in Greece, but all over the planet, who could come back and will work on research, but also work on management and support services in the field not only of biotechnology, but also of pharmaceuticals. And truly to allow the sector to help the financial growth of the country. There are efforts being made within the country in the field of biotechnology that need to be supported. And I'm confident that in the conference of next year we'll be here again and give you some real tangible examples of what we will have achieved by then. Thank you. Right, thank you then. I believe that the most convincing way for the government to convince us, Mr. Kontozamannis, that they are indeed interested in biotechnologies with the selection of the president of the National Council for Research, Technology and Innovation. It's our next speaker, Professor Spyros Artavanis-Tsakonas, who has the tremendous opportunity and advantage to live for a great number of years. I will not say exactly how many years. If he wishes to divulge that information, he may. In Boston, where I believe that we can learn a lot of things, primarily through his experience of Spyros Artavanis, who, as I said, has two caps. He is a great researcher, but also a person who tried throughout his life to transfer some of that knowledge and translate it for the good of patients and the industry as a whole. So Spyros, you have the floor, sir. But before Mr. Artavanis starts, Mr. Gravanis put the issue very correctly, and the equation I have to give you, that in order to have biotechnology, so this is a word that we have not defined appropriately. So the basis for innovation in this field is one, and it's single. It is the quality of basic science, and that is all. Mr. Bourla or Mr. Agousis will not come to Greece to invest if they do not know that in science, I'm talking about in science, that they need to invest in drug innovation if they don't know that there will be quality. In order to have quality, on the other hand, what we need, undoubtedly, is serious support on behalf of the government. And this is something that I think the government realizes from what I've already talked about in my capacity as president of the National Council for Research, Technology and Innovation. And I believe that there is consent. We are trying in every possible way to correct what is wrong in education, and as Achillea said, we cannot distinguish between the third grade education from everything else. And without research, and high quality research, it is impossible to have an appropriate and innovative biotechnological innovative system. I feel that, like Mr. Kondozamani said, the wish for people to come back from abroad where they have been very successful in these sciences is indeed something that we will need to try and make. How will these people come? We need to give them not only the opportunities to progress in their science, but we also need to give them financial incentives, actually, to have to make a livelihood. Someone who has had a certain career abroad, be that in Europe or in the States, for them to come back to Greece and continue their career in Greece, if a 40-year-old with 2 children comes to Greece, it's not an easy task to come with $2,000 or 2,000 euros per month. It's very difficult. So there are things that we can do immediately to help with the brain drain that Mr. Kondozamanis was talking about, but also science. Can we do that? Do we have the human capital in Greece so that by correcting bureaucracy and red tape and even increasing the money we can do something important? I believe that yes, we can. And I do not think that the first thing we need is money. Money is definitely necessary, and the more money you give us, the better it will be. But it's not the money that is the key and the most important thing. The most important thing is to create, to come up with ways to combat red tape and the fragmentation of money. The Ministry of Health, the Ministry for Development, the Ministry for Health, the Digital Governance, the Agricultural Ministry, all these ministries have money that supposedly are spent on research. If we were to put all this money together under a single umbrella, which is my personal crusade to make this umbrella as a single space, I believe that we will advance very, very fast. Not in 10 or 20 years, but we can advance rapidly. There are exceptional cores in Greece. We have excellent quality of research in biotechnology, and there are, of course, parts that should not exist. So this is what we need, this strict evaluation. What we're trying to do is to raise the quality and increase the quality of research. This is the key issue for Mr. Ragoussis to be able to go to Mr. Bourla and tell him that here we have something important, something significant. How else will he go to Mr. Bourla and say we have something important? We may be cheaper. Or the clinical trials we talked about earlier with Mr. Kondozamanis are something entirely different than research and innovation. Innovation in clinical research will not be performed by us. We will simply provide our services. So I should like to thank you very much for the invitation. I should like to stop here. I said enough and we can start the discussion. Thank you very much, Spiros. We will come back to the issues you raised, and let's move on with Mr. Zachary Ragoussis.
who, dear friends, is here because in a very well-documented way, Pfizer is interested in the country. And he's a very good example, at least to us who have been in Greece for a great number of years, in Crete 30 years, and we were fortunate enough to have an extrovertness over the past years towards the United States. It was really, Mr. Ragoussis, a pleasant surprise regarding the power and the strength with which Pfizer decided to invest in Greek scientists and Greek society. So what are the main criteria that led you as a company, apart from the fact that the CEO of your company is a well-gifted Greek from Thessaloniki? Now, he took into consideration the business elements that led you to come here with this very great strength, because it's a huge force, it's a huge investment to Thessaloniki, and not only there. So, having Greece set a goal or a target to enter the field of biotechnology is the best thing that can actually bring everyone together. What I was saying before is that I'm very honored and I'm very interested in what you have to say, and we have to thank you on behalf of Pfizer. Going back to the regular courses, say that we found things in Greece, and we didn't find it just in Thessaloniki. We also found that in Crete, in Patras, and in Athens. It was the necessary potential and the terms to invest where we actually invested, because it is digital research and technology. So let's see how a company may think in biotechnology. Could I please have my presentation up on the screen? Right. So I think that we should first of all say that you started with the biotechnology ecosystem term, and I think that what counts is to take a look at the ecosystem and see the dynamics that it has, and to see it in a wider way. A big company starts looking at the global and reaches down to the local level. So let's take a look and see that as far as research and development investments are concerned in the field of biotechnology, over the past few years, we will see that the United States are still the leader, and they have a part of the market, and we also see China coming up second, and those who appear to be losing part of the market is Europe. Now, let's look into that, because this will clearly activate the EU's reflexes that Greece can put to good use as to the investments that may take place. Is the health sector important for Europe? Yes, it is. If you can look at this chart, in the United States, technology sectors are primarily those that absorb the largest percentage. It's ICT service. If we take a look in Europe, it's automobiles and other transport. Second is the health industry. But is health industry in biotechnology what interests us? No, unfortunately not. Observing this diagram, one can see that the United States are still dominant, and the investments made in biotechnology are 11 times more than those performed in Europe. And the trend is not optimistic for the EU. The more we progress, the lower it goes. Europe still invests in traditional pharmaceutical industry, and this is a good thing because, well, it secures jobs for a large part of the population and a big part of the market. But the question is, how is this linked with today's discussion, which is innovation, research, and research in, state-of-the-art areas. There is a very recent analysis in the EU that says something that I really liked it, which is why I will repeat it. Innovation will come. Innovation will happen. The question is where and when. The where is determined by the comparative parts and comparative shares of investment. The when is the convergence of research sectors and investments in the same time and place. Then we will have the result we are looking for. So let's take a look at ATMPs, which is advanced therapy medicinal products, gene therapies and all these things. You see, in the green line we have the EU, okay, it's Europe rather, which maintains more or less the same level of investment, whereas the United States and China increase them. And it's important because this is a snapshot of the future today. It shows a trend. It's indicative of a trend. And I believe that if one were to study all the analysis of Europe, this is a message well received by Europe. And they will transfer funds where they must. The issue is for Greece to participate in all this. So let me move to the key question we have here. What is the incentive that will drive a country or an entire continent to invest in this direction or the other? You will see that the most important things on the slide are the following. One of them is that progressively the Chinese market is increasing. The Chinese market is starting to adopt patent protecting rules and regulations. And if you see my first point, it's impressive. In a period spanning 20 years, the PhDs produced by China are slightly more than those in the United States. 20 years ago, they weren't even comparable. Which begs the question, who is innovative and who is the pioneer in this thing? Well, of course, it's the academia. They move ahead and everyone else follows. So let's see from this whole study, I have distilled a few things. There's a lot of interesting things. I just got the key drivers. The first and foremost, it was already mentioned. I don't want to spend any more time. It's the quality of the scientific ecosystem, the ecosystem that exists, and it has a lot of elements. It's Mr. Gravani's, how Mr. Gravani started with his presentation, and I think we'll need to take a look at this, because you see the second bullet point is that one needs centers of excellence, research scientists, and skilled, specialized research staff. And this is the general direction of the state today. Anyone with an eye out for news knows that where we invest as a country is the beginning. After academia and academic knowledge, what one needs is such centers and institutes where someone can see a practical connection between academic knowledge and the potential implementation and application in the future. I think it was, indirectly mentioned that this sector does not measure cost. Biotechnology does not go where cheap potential is needed, and this is also very good for Greece, because Greece is not a country that is competitive in terms of cost, and of course it cannot compete against India or China in that respect. And of course there is digital infrastructure. It is easy to build digital infrastructures in Greece, and this is proven, and I'm answering to your question now. The fact that we did have the previous two elements, academic capacity and even plethora of supply of competent people. We had the institutes in all those countries I mentioned. It's simply that Thessaloniki has the ideal size as a city. So they gave us the opportunity to invest there. In biotechnology, we need another couple of steps before we reach that point. Here on this slide, I have borrowed a piece of data of how technology influences clinical trials. Another thing is to be able to have not an ecosystem, but a structured, organized system that is particularly competitive, because today, unfortunately, not only in Europe, but the world over, no one comes to check your space, where your sites are, where your buildings are, the premises, or your people. What they see is your digital footprint. And this is very important, because this can be good for us. Okay, maybe our digital footprints, if we build it correctly, maybe even better than the reality, but we need to have our digital copy, our digital avatar. As far as we're concerned, and when I say we, I mean the companies, what clearly plays a role is the current market. If the new product is perceived by a state, a continent, or a community as their asset rather than cost, then a door opens that leads to biotechnology. Otherwise, a similar door may very well close. It is clearly very important at this point to include in the conversation all stakeholders, all those who will be influenced by biotechnology. And of course, I'm not just talking about the academia, institutes and the companies, but also those who will be the recipients, the patients. They need to be ready. So a question would be, how many Greeks would be willing to participate in a study or a vaccine clinical trial, not of a treatable disease or a curable disease, because most of the time these trials have to do with advanced stage patients, so they participate. So what sort of mentality or mindset do we have as Greeks, and let's not ask about the others, to participate in something like this? So it needs a mentality of acceptance of innovation and participation in innovation. Because something that was mentioned early on is that innovation does have risks that need to be calculated. I will keep this for the end of the discussion, and I will put a full stop here because I used up too much of the time available. So my answer is that yes, we were mature for the investment made in Thessaloniki, because you see that there's a series of investments. It's not just us, but please heed this, that it's not the same investment at the same level. I mean, in digital economy, what does one want? Is a good connection, computers and brains. Well, Greece has all three of them, and it also has a good environment. Biotechnology wants and needs something extra, which is institutes that not only produce PhDs at the universities, but for these PhDs to have direct practical implementation. Thank you very much. Thank you, Mr. Agousis, and I will start with some comments and second questions from you.
Let me start by saying that indeed digital technology does not regard only the part of health. One of my topics in my research, both in Greece and Boston, is tissue mechanics. There is an important need for new materials and to create new biological devices that are medications by themselves. It is in these new types of pharmacology, which is not only chemicals, but also it can be devices plus cells plus genes. It's not a symptomatic treatment, but it's a systematic treatment. In other words, it solves the problem. There's an important area here for AI and machine learning to design this kind of new types of materials. Biomaterials, in other words, micro devices, which are either used for diagnosis or for treatment. I believe that Pfizer's example, which has already some types of applications of this kind, have to be seen in both academic and entrepreneurial terms. This is a more ambitious part that will need liquid biochemistry and biology so that it can be utilized this way. So what do you believe about this idea, including this type of activity so that the industry worldwide will have ideas so as to go to the proof of concept stage for the new devices? Many say that there is no prototype. No prototype of treatment can be created in Europe, in Greece. I'm sorry, but this got me an idea that can be promoted internationally, and this exists already in Greece. This is very important and very interesting, both for Pfizer and for other pharmaceutical companies. In Thessaloniki, we have started learning the ecosystem, and we have started already some discussions there are some institutes and groups of people that are going to be tested via some initial projects. In Thessaloniki, we don't have only local programs, but we have also programs that run in the USA. So it is nice to involve some local bodies so that the knowledge and capacity can be transferred. And this way, if there is a good idea out there, we can adopt it early on. We are still beginning our work, but we are rather fast in our progress. And very soon we'll be able to present something. Maybe in 6 or 9 months from today, we're going to present some first results of these first contacts. But of course, this is not easy. You know this better than me. Cooperation needs time. And a common view on things. Not like we don't want just to protect, we want to provide new solutions. And we know that all the stakeholders can be committed to invest in time and effort. A second question related to the private sector. I see some trends in recently. We have many changes in the Greek landscape recently in many levels. The mentality within the academic institutions about research. There was no research at all some decades ago. And I also see the private pharmaceutics industry. They are bolder. They are taking risks. For example, I cooperate with the new biotechnological park, Athens Life Tech Park at Sparta. This is another positive surprise. I see that the private sector slowly but very seriously proceeds to investments which are not state subsidized. So they start this kind of efforts. I think that the Greek industry has to adopt this philosophy and act as an intermediate with the international industry. I would like your comment on this. What do you think that the Greek pharmaceuticals companies need to change in their mentality? And I'm speaking about Alpen, Pharmaten, Dermo Pharmaceuticals, in order to undertake this role. I know these examples myself. I am sure that there are more. Which do you think that should be the characteristics for this decision-taking so that the pharmaceutical industry can enter this innovation era. Very quickly, very briefly, because we don't have much time, there is no risk to invest in this area because this is a long-term sustainability game. So it is necessary for the companies to invest there, and the new investment law gives the companies and the investors the opportunity to put their monies in these kind of operations. The alternative would be to stay with the traditional chemical drugs production. In my opinion, it is good that the Greek companies are bold, and I think that more of them should do so. I think that today we see the pioneers of the future. The remaining companies should ask themselves, why do the others invest in these innovative solutions? Mr. Tsakonas, in the academic community, we know that there are national science foundations in other countries, for example, which establishes a pillar of research at a national level. As the president of such an organization, very briefly, please, how do you see this endeavor being actualized? As you know, from the very first moment that I undertook the leadership of ESETEC, along with the previous president, Mr. Venizakis, we started focusing on what you mentioned. It's one of my priorities. We need to create a uniform area. It's not an NSF, it's something different. And there, we should develop national research strategy. Also, funding. This is something that we want to create. There's a lot of discussions with all the stakeholders so that we can be able to go to the government and propose something very concrete. My own opinion, in its a personal opinion, is that we should have a Ministry of Research and Development. The basic characteristic of such a ministry is to listen to the opinion of professionals in the area. The national strategy for research and the coordination of research in such a ministry or an organization, if you like, should not take place, should not be conducted by bureaucrats, but professionals from the market. I believe that this is very important and very critical. This single area is actually a concept very important for research to grow. Without this, we are not having any actual solution to the problem. Mr. Kouzamanis, you represent the state here, so one of the main elements that attract investments, as you know, is to provide tax and economic and financial motives so that major companies take the risk for investing in a country which doesn't have a tradition until today in activities like biotechnology, etc. So, in your opinion, what should the government see, and so that the public discussion can open and reach a political consensus in order to become attractive in serious investments? Of course, we need to have a government that believes in investments and it believes in synergies with the private sector. And this current government believes in the aforementioned. In the last couple of years, we have given already some tax tax motives. And there are further initiatives that will follow. And we have some other proposals in mind so as to establish a framework that will attract investments. So we have the knowledge, we know what has to take place, we know how to do it. So we hope that very soon we're going to have very tangible results. The most important thing, allow me to say, the most important conclusion of this report, of this study, is that these efforts should be longer than the term of our government. We shouldn't see changes every time that the government changes or our ministry changes. We don't want to see decisions being disrupted, because only this way we can give the message to the companies, to the entrepreneurs, that Greece indeed is an area, is a country where somebody can invest. This whole effort on biotechnology has been supported by Stelios Papadopoulos a lot, who is going to be with us in the next panel. He's a very important personality in biotechnology. It was our honor that we worked together along with Spiros Artavanis and all the other personalities that invested in time and shared their ideas with you. I met with Stelios virtually online every Thursday night with our team for 1.5 years in order to work towards this direction. It's a very important advantage for our country to have this kind of scientists along with the government. Thank you very much. So next year I'm going to propose that you come again so that you will be able to announce the results of your effort to the benefit of biotechnology. Thank you very much for following our discussion. Thank you, Mr. Tsakonas, thank you, Mr. Kotozamanis, and thank you, Mr. Agousis, for the discussion. Yes, I hope that next year we'll be here. We'll be here again with the results. We have Stelios Papadopoulos now with us, chairman of the board of Biogen, and he's going to have a discussion with Mr. Papachelas. Mr. Papadopoulos, are you online? Good afternoon. Can you hear me, Mr. Papadopoulos? Ευχαριστούμε, κύριε Παπαδόπουλο, που είστε μαζί μας. Να σας ρωτήσω πώς φτάσατε εκεί που είστε. Καταρχάς, πριν από 30 χρόνια μπήκατε σε ένα αεροπλάνο, είχατε $200 στην τσέπη σας και δεν είχατε τίποτα άλλο μαζί σας. Οπότε, ποια ήταν η ιστορία σας, πώς φτάσατε εκεί που είστε σήμερα? Δεν ήταν πριν 30 χρόνια, ήταν πριν 55 χρόνια. Εγώ ήμουν 30, είμαι λίγο πιο μεγάλος από ό,τι φαίνομαι. Μεγάλωσα στη Θεσσαλονίκη. Ζητώ συγγνώμη που δεν θα μιλήσω στα ελληνικά. Μιλώ ελληνικά, αλλά όταν είναι για θέματα επαγγελματικά ή επιστημονικά, προτιμώ να μιλώ στα αγγλικά. Ξεκίνησα ως ηλεκτρολόγος μηχανικών, στην ηλεκτρολόγο μηχανικών στο MEP. Ήθελα να γίνω επιστήμονας από πολύ μικρός, μου άρεσε η επιστήμη. Στην αρχή πήγα το τρένο και πήγα στο Παρίσι και μετά πήρα αεροπλάνο, γιατί ήταν πιο φτηνό έτσι. Και το 1967, τον Ιανουάριο, πήγα στη Νέα Υόρκη και τα υπόλοιπα είναι ιστορία. Να σας ρωτήσω, έχετε δουλέψει πολύ χρόνο στον τομέα σας. Πείτε μας πόσα πράγματα έχουν αλλάξει, πόσο πιο δύσκολο ή πιο εύκολο είναι να επενδύσει κανείς και να προσελκύσει ταλέντα σε αυτό το χώρο. Πολύ καλή ερώτηση πραγματικά. Εγώ από την αρχή έχω ασχοληθεί με τον τομέα αυτόν και νομίζω ότι ήμουν πολύ τυχερός που βρέθηκα στην πλευρά της τεχνολογίας από την αρχή. Και πραγματικά κατάλαβα εξ αρχής πόσο ωφέλιμη θα ήταν αυτή η πλευρά της τεχνολογίας για τις ανθρώπινες ζωές. Θα έλεγα ότι από τα τέλη της δεκαετίας, μάλλον από τις αρχές της δεκαετίας του 70 και σε όλη τη δεκαετία του 80, όλα όσα κάναμε ήταν αρκετά απλοϊκά και απλουστευτικά, θα έλεγα. Εστιάζαμε σε μία βασική τεχνολογία, την παραγωγή της ανθρώπινων πρωτεϊνών που θα μπορούσαν να χρησιμοποιηθούν σε μικροβιακά συστήματα. Ουσιαστικά ήταν ένας εναλλακτικός τρόπος να δημιουργήσουμε ανθρώπινες πρωτεΐνες. Και να δώσουμε ένα παράδειγμα, από εκείνη την εποχή οι ανθρώπινες πρωτεΐνες ως φαρμακευτικές ουσίες, π.χ. ινσουλίνη, εκείνη την εποχή και μέχρι τότε εξάγονταν από το πάγκρας κάποιων θηλαστικών όπως χείρων και η αυξητική ορμόνη εξαγόταν από πτώματα από ανθρώπων μετά από απομόνωσή τους. Έτσι λοιπόν η πρόσβαση σε ανθρώπινες φαρμακευτικές πρωτεΐνες ήταν δύσκολη. Έτσι λοιπόν η βιοτεχνολογία ήρθε να μας λύσει αυτό το θέμα. Και η επόμενη μεγάλη εξέλιξη, τη δεκαετία του 90, ήταν η διεύρυνση της τεχνολογικής βάσης του τομέα αυτού και η έλευση των αντισωμάτων. Ήταν ειδικές πρωτεΐνες οι οποίες αναγνωρίζουν συγκεκριμένους ιστούς και όταν χρησιμοποιούνται ως φάρμακα, επίσης αυτό επεκτάθηκε πολύ και στη συνέχεια η τεχνολογία αυξήθηκε τόσο πολύ που θα μας έπαιρνε ώρες για να τα πούμε όλα. Αλλά το θέμα είναι ότι μέχρι σήμερα έχουμε φτάσει σε ένα σημείο που πλέον η βιομηχανία είναι πάρα πολύ καινοτόμο, ανταγωνιστικό και εστιάζει στο κεφάλαιο. Σήμερα στις ΗΠΑ οι καλές εταιρείες έχουν ξεκινήσει από τα εργαστήρια των βασικών των κύριων πανεπιστημίων, του Harvard, του Yale, του MIT, του John Hopkins και η αρχική χρηματοδότηση είναι $100 εκατομμύρια αυτή της τάξης πλέον για 1, 2 ή 3 χρόνια και μετά υπάρχουν περαιτέρω χρηματοδοτήσεις για να συνεχίσει το εργαστήριο. Και φυσικά η δαπάνη είναι πολύ μεγάλη. Για να δημιουργήσουν ένα προϊόν έχουν ήδη δαπανίσει κάποια δισεκατομμύρια δολάρια. Η λειτουργία λοιπόν τέτοιων εργαστηρίων καινοτόμων είναι πολύ υψηλή, πολύ δαπανηρή. Και αυτή τη στιγμή δηλαδή σημαίνει ότι έχει κλιμακωθεί αυτή η προσπάθεια πάρα πολύ από τη δεκαετία του πριν το 2000. Κάτι που μου κάνει εντύπωση πάντα στον τομέα σας είναι το εξής. Το ρίσκο. Το στοιχείο της αποτυχίας. Νομίζω ότι το γνωρίζετε γιατί δεν μπορεί κανείς να φτάσει ψηλά αν δεν πάρει ρίσκα. Πώς το δέχεστε αυτό? Πόσα projects δηλαδή αποτυγχάνουν για να επιτύχει ένα? Αγαπώ τα δεδομένα. Και όταν λέω δεδομένα εννοώ ποιότητας, ακρίβειας δεδομένα τα οποία μπορεί κανείς να βασιστεί. Και σας βεβαιώ ότι είναι πάρα πολύ δύσκολο να απαντήσει κανείς με σαφήνεια αυτήν την ερώτηση, διότι πρέπει να απαντήσει κανείς στο τι είναι ένα project. Η απάντηση είναι τα περισσότερα είναι projects. Μπορεί να είναι το 80% ή το 70%, αλλά στο πλαίσιο ενός project ξεκινάς κάτι, αρχίζοντας από μια ιδέα και ξέρεις ότι μπορεί αυτή να πετύχει ή μπορεί να αποτύχει. Οπότε πρέπει να είσαι εξοικειωμένος με την αποτυχία, να μπορείς να τη διαχειριστείς. Και το μεγαλύτερο ανταγωνιστικό πλεονέκτημα των ΗΠΑ αυτή τη στιγμή έναντι του υπόλοιπου κόσμου είναι ότι η αποτυχία στις ΗΠΑ θεωρείται η βάση για να μάθεις κάτι και να είσαι πιο αποτελεσματικός σε μια επόμενη απόπειρα που θα είναι επιτυχημένη. Το βασικό διακύβευμα στην Αμερική είναι αυτό. Στα σπορ, το baseball είναι το αγαπημένο παιχνίδι των Αμερικανών. Η μπάλα αποτυγχάνει να βρει το στόχο της 70% των προσπαθειών. Δηλαδή 7 στις 10 φορές είναι έξω. Άμα κάποιος λοιπόν έχει 3 επιτυχημένες βολές, είναι πολύ καλός. Άμα έχει 35% είναι άριστος. Άρα λοιπόν η αποτυχία είναι συνυφασμένη με την έννοια της προσπάθειας στο mentality, στην οτροπία των Αμερικανών. Να σας ρωτήσω για το θεσμικό πλαίσιο. Είναι πιο άκαμπτη από στην Ευρώπη ή στην Αμερική? Ναι, κοιτάξτε, ο Οργανισμός Φαρμάκων και Τροφίμων έχει ως αποστολή του να προστατεύει την υγεία του έθνους και μετά να βελτιώνει την υγεία του. Με πολλές κλινικές μελέτες και με πολλές έρευνες πάρα πολλά χρόνια έχει υπάρξει ιδέως επιμέλεια για να διαβεβαιωθεί ότι κάθε έρευνα που γίνεται σήμερα είναι πολύ πιο ασφαλής και πιο σωστή από αυτήν την αντίστοιχη που γινόταν πριν από 20-30 χρόνια. Αυτό είναι το αποτέλεσμα του θεσμικού πλαισίου στις ΗΠΑ, το οποίο ουσιαστικά έχει καταφέρει να ελέγξει τον κίνδυνο σε τέτοιου είδους εγχειρήματα στην αγορά. Τα τελευταία 10-15 χρόνια βέβαια φαίνεται ότι υπάρχει μια πρόθεση μεγαλύτερης ανάληψης κινδύνου. Δηλαδή να υπάρξουν κάποια προϊόντα, π.χ. φάρμακα, να φτάσουν στην αγορά χωρίς να έχουν γίνει πλήρεις κλινικές μελέτες. Και μιλώ ας πούμε για την accelerated approval, την ταχεία έγκριση. Σε αυτή την περίπτωση έχουμε ένα θεσμικό πλαίσιο το οποίο λέει ότι αν μου δείξεις κάποιους δείκτες αξιόπιστους που μου δείχνουν ότι το συγκεκριμένο φάρμακο αντιμετωπίζει την συγκεκριμένη ασθένεια, χωρίς να μου το έχεις αποδείξει πλήρως, αλλά να είναι ενδείξεις να είναι πολύ ισχυρές, τότε μπορώ να προβώ σε μια ταχεία διοδότηση και αυτό έχει μεγάλο αντίκτυπο στην εξέλιξη των φάρμακων αυτών, αλλά και της σχετικής νοοτροπίας. Γνωρίζω εταιρείες που έχουν πάρει τέτοιες ταχείες άδειες και έχουν καταφέρει να βγάλουν προϊόντα τα οποία τελικά έχουν εγκριθεί από τον Οργανισμό Φαρμάκων. Διότι κρίθηκε ότι ήταν ασφαλή τα φάρμακα αυτά να αντιμετωπίσουν συγκεκριμένες ασθένειες. Υπάρχουν βέβαια και άλλες περιπτώσεις. Έχω κατά νου το κάναμα, ένα φάρμακο της ASI, μιας ιαπωνικής εταιρείας, που έχει υποβάλει αίτηση για ταχεία έγκριση επίσης, για ταχεία διοδότηση. Είναι ένα φάρμακο το οποίο την περασμένη εβδομάδα μόνο υποβλήθηκε και περιμένουμε να δούμε αν θα πάρει έγκριση ή όχι. Πολύ καινοτόμο και αυτό το φάρμακο. Σίγουρα γίνεται πιο αυστηρό το πλαίσιο, όμως γίνεται και πιο ευέλικτο. Δηλαδή, προσπαθεί να λύσει προβλήματα και να αλλάξει νοοτροπίες με τρόπο διαφορετικό από ό,τι στο παρελθόν. Θεωρείτε ότι μετά τον COVID έχουμε φτάσει σε μια διαφορετική εποχή, έχει αλλάξει η πανδημία τον τρόπο που λειτουργείται? Με τον COVID είδαμε ότι μπορούμε να κάνουμε σχεδόν τα πάντα. Οι πιο βασικές αλλαγές που έχουμε δει σε όλο τον κόσμο είναι η έννοια ότι μπορούμε να είμαστε παραγωγικοί χωρίς να κάνουμε συνέχεια τα ίδια και τα ίδια. Για παράδειγμα, εγώ σήμερα είμαι εδώ μαζί σας μέσω Zoom και ελπίζω να συνεισφέρω σε κάτι θετικό. Πριν από 3 χρόνια δεν θα μπορούσαμε να έχουμε ένα υβριδικό συνέδριο, μια συνάντηση όπου η μισή δεν θα ήταν μέσα στην αίθουσα. Αυτό είναι πολύ θετικό, διότι μειώνει τα ταξίδια, μειώνει τα κόστη, αλλά δεν χάνουμε την αποτελεσματικότητα της συζήτησης. Τώρα που έχει υποχωρήσει η πανδημία, έχουμε αρχίσει να ξαναταξιδεύουμε. Συναντώ ανθρώπους που είχα χρόνια να τους δω πραγματικά, τους έβλεπα μόνο στο Zoom Και να πω ότι η αλληλεπίδραση μέσω Zoom είναι αρκετά ρεαλιστική. Σίγουρα έχουμε χάσει κάτι. Αυτό που έχουμε χάσει είναι η παραλεκτική επικοινωνία ή η κοινωνική συναναστροφή. Νομίζω ότι θα μπορέσουμε όμως να συνεχίσουμε με έναν υβριδικό τρόπο. Αλλά για να συνεχίσουμε με τη δουλειά μας όπως την κάναμε πριν την πανδημία, οι άνθρωποι χρειάζεται να ξαναεπισκεφθούν αυτήν την ισορροπία ανάμεσα στην επαγγελματική και την προσωπική ζωή. Όπως λέγαμε παλιότερα, δηλαδή να βρίσκονται σε απομακρυσμένα μέρη, στη Μοντάνα, στο Τενεσί, στο Άρκανσο και να εργάζονται από μακριά, να τηλεεργάζονται αντί να ταξιδεύουν. Το τελευταίο ζήτημα αφορά το πώς οι φαρμακευτικές εταιρείες αλληλεπιδρούν με τις μεταβάσεις. Και πώς μάλλον με τους φαρμακευτικούς επισκέπτες υπάρχουν συγκεκριμένες συναντήσεις μεταξύ γιατρών και επισκεπτών που διαρκούν πάρα πολύ μικρό χρονικό διάστημα και ο ιατρικός επισκέπτης έχει λίγο χρόνο για να καταλάβει τι ακριβώς κάνει το συγκεκριμένο φάρμακο και να το επιβεβαιώσει στο iPad του. Αυτό είναι μια πρακτική που δεν είναι πολύ αποτελεσματική. Και μπορούμε τώρα με την εικονική αλληλεπίδραση να λύσουμε αυτό το πρόβλημα το οποίο ήταν τόσο σοβαρό στην παρελθόν και να γίνουμε πιο αποτελεσματικοί. Νομίζω ότι στον τομέα μας όλοι προσπαθούν να το κάνουν αυτό και θεωρώ ότι είναι πάρα πολύ μεγάλη καινοτομία. Θα είναι πολύ μεγάλη καινοτομία για τη δουλειά μας. Δεδομένου του ότι πλέον οι φυσικές αποστάσεις δεν μας απασχολούν πια. Να ρωτήσω, θα μπορούσαμε κάποια στιγμή να δημιουργήσουμε μια τέτοια κουλτούρα έρευνας και παραγωγής στην Ελλάδα? Ήδη συμβαίνουν διάφορα πράγματα, ήδη είμαστε αισιόδοξοι, αλλά ρωτώ τη δική σας άποψη. Θεωρείτε ότι μπορούμε να φτάσουμε στην κρίσιμη μάζα, να έχουμε ένα brain gain αντί για brain drain που είχαμε μέχρι τώρα? Να σας πω, ο κύριος Κοντζαμάνης ήδη μας είπε ότι τα τελευταία 2 χρόνια υπάρχουν κάποιες προτάσεις για να σχεδιαστεί το τι μπορεί να γίνει στην Ελλάδα, για ώστε η Ελλάδα να μπει στην παγκόσμια κοινότητα των καινοτόμων κρατών. Ο κύριος Γκραβάνης με μεγάλη σαφήνεια μίλησε για τα ζητήματα της καινοτομίας στο προηγούμενο πάνελ. Σίγουρα η καινοτομία είναι μια ωραία λέξη, τη λέμε όλοι. Μας θέλουμε όλοι να μιλάμε για βιώσιμη γεωργία, για ανανεώσιμες πηγές ενέργειας, για οργανικά λαχανικά. Σε όλους αρέσει αυτό. Αλλά το θέμα είναι ότι δεν μιλάμε μόνο για λέξεις. Με την καινοτομία, ένα κράτος ή μια κοινωνία των πολιτών πρέπει να βάλει τα συστατικά για να φτιάξει τη συνταγή και να δημιουργήσει ένα οικοσύστημα το οποίο θα οδηγηθεί θα φτάσει στην καινοτομία. Όπως είπε και ο καθηγητής Γραβάνης πριν, πρέπει να δημιουργήσουμε μέσα στο ακαδημαϊκό ερευνητικό σύστημα ένα πλαίσιο έρευνας, το οποίο θα αξιολογεί τις επιτυχημένες προσπάθειες σε άλλα τέτοια συστήματα και να τις υιοθετεί. Στη ΣΥΠΑ, όσον αφορά την κλιμάκωση, αυτό το κάνουμε. Άρα η ερώτηση είναι, μπορούμε να έχουμε στην Ελλάδα 2-3 εργαστήρια που να ανταγωνίζονται με τα εργαστήρια άλλων χωρών? Βεβαίως και μπορούμε. Είναι πιθανό και δυνατό. Αλλά χρειαζόμαστε τα κατάλληλα άτομα, την κατάλληλη χρηματοδότηση, την κατάλληλη ηγεσία. Όλα αυτά είναι απαραίτητα. Αλλά αυτό δεν οδηγεί μόνο σε πολύ καλή έρευνα. Είναι καινοτόμο από μόνο του. Αλλά σίγουρα χρειάζεται να έχει και μια κλινική συνάφεια με το στόχο μας. Αν υποσχεθούμε στη χώρα ότι σε 10 χρόνια μπορούμε να λύσουμε μια συγκεκριμένη ασθένεια και αν μπορούμε να το τεκμηριώσουμε αυτό ιατρικά, τότε αυτό θα γίνει. Δηλαδή, πραγματικά δεν χρειάζεται να λέμε μόνο τις λέξεις, μπορούμε να οργανωθούμε και να φτάσουμε εκεί που θέλουμε. Έτσι, στην Ελλάδα ή στη Βουλγαρία ή στο Ισραήλ, αν θέλουμε να κάνουμε κάτι, τότε θα βρεθούν τα χρήματα και θα γίνει. Δεν είναι θέμα, είναι θέμα σχεδιασμού και εκτέλεσης. Άρα λοιπόν χρειάζεται να ξαναοργανώσουμε το ακαδημαϊκό σύστημα, το ερευνητικό. Και ο κύριος Γραβάνης μας είπε πολύ καλά παραδείγματα αυτών των ευκαιριών. Θεωρητικά λοιπόν χρειάζεται να περιμένουμε 5-10 χρόνια μέχρι να οριμάσουν αυτές οι νέες κινήσεις, αλλά αντί να περιμένουμε απλώς για να γίνει ένα θαύμα, η πρότασή μας είναι να κάνουμε κάποια πράγματα, όπως είπε και ο κύριος Κοντοζαμάνης, που έδωσε κάποιες ιδέες που σχετίζονται με την βιοπαραγωγή, τις ιατρικές κλινικές μελέτες κτλ. Ένα που θα μπορούσαμε να κάνουμε είναι να δημιουργήσουμε νέες δουλειές, να είμαστε παραγωγικοί. Αυτό θα βοηθήσει το οικονομικό περιβάλλον στην Ελλάδα. Το δεύτερο που μπορούμε να κάνουμε είναι να δημιουργήσουμε και να εκπαιδεύσουμε επαγγελματίες, ανθρώπους που όταν οριμάσουν οι καινοτόμες ιδέες θα είναι σε θέση να ηγηθούν αυτών των εταιριών που θα δημιουργηθούν στην Ελλάδα, γιατί θα είναι καινοτόμοι στην νοοτροπία τους. Αυτό θα είναι με ορίζοντα 5-10 ετών. Αυτές λοιπόν οι ιδέες όσων θα μπορούσαν να γίνουν. Το βασικό σημείο εδώ είναι ότι χρειάζεται να καταλάβουμε πώς να φτάσουμε σε αυτές τις καινοτόμες ιδέες και τα καινοτόμα προϊόντα. Πρέπει να έχουμε μεγαλύτερα περιβάλλοντα, τα οποία να είναι πιο ευνοϊκά για την καινοτομία, να έχουμε νομοθεσία που να βοηθά τις επιχειρήσεις, να κάνουμε, να προοδεύουμε, να αλλάξουμε το νομοθετικό σύστημα. Δεν μπορούμε να έχουμε 15 χρόνια περιμένουμε για να δοθεί απάντηση σε μια απόφαση, να ολοκληρωθεί μια δίκη. Πρέπει να είμαστε σίγουροι ότι υπάρχουν τέτοιες δυνατότητες και να αγκαλιάσουμε την καινοτομία ως χώρα. Αν εγώ, για παράδειγμα, πάω σε έναν ασθενή της ΕΠΑ και του πω ότι πρέπει να περιμένουμε την κλινική μελέτη να βγει, γιατί τα φάρμακα που έχουμε σήμερα δεν μπορούν να σου δώσουν λύση στο πρόβλημά σου, τότε αυτό δεν θα είναι ικανοποιητικό. Αντιθέτως, αυτό που θα πω στον ασθενή είναι ότι μπορείς να μπει στην τάδε κλινική έρευνα και να πάρεις το πειραματικό φάρμακο. Και με την συνένεσή του αυτός μπορεί να φτάσει στη θεραπεία. Η Ελλάδα δεν είναι η μόνη χώρα. Χρειάζεται να έχουμε συνένεση. Το τελευταίο που έχω να πω είναι ότι η κυβέρνηση δίνει σήματα ότι αγκαλιάζει την καινοτομία. Μας το είπε αυτό ο κύριος Δραγκούσης. Καινοτομία σημαίνει νέα φάρμακα. Νέα φάρμακα σημαίνει βιοφάρμακα και αυτό σημαίνει έρευνα, ανάπτυξη, επιτυχίες και αποτυχίες, κόστος, γιατί αυτά είναι πιο ακριβά φάρμακα από τα γεννόσιμα. Στις ΗΠΑ αυτή τη στιγμή που έχουμε το μεγαλύτερο προπολογισμό κονδύλι για φαρμακευτικές δαπάνες κατά κεφαλήν, 9 στις 10 συνταγές είναι για γεννόσιμα, γιατί είναι υποχρεωτικό. Αν υπάρχει γεννόσιμο, το δίνεις, δεν δίνεις κάποιο άλλο brand. Και αυτό συνταγογραφούν οι γιατροί. Και δίνουν οι φαρμακοποιοί στους ασθενείς. Και τα λοιπά φάρμακα, αυτό το 10% των brand, είναι ακριβά φάρμακα. Αλλά πρέπει να καταλάβουν όλοι ότι η καινοτομία κοστίζει. Αλλά αυτός είναι ο μόνος τρόπος να έχουν οι ασθενείς τους πρόσβαση σε αυτά τα νέα φάρμακα. Τα επόμενα 10 χρόνια έχουμε τον κίνδυνο να βγούμε εκτός αυτής της καινοτόμου αγοράς. Επειδή λόγω των τιμών που δεν θα είναι ελκυστικές για τις εταιρείες. Η Ελλάδα είναι σε αυτή την ζώνη κινδύνου.
Υπάρχουν άλλες χώρες και οι μικρότερες που μπορούν να είναι υποδείγματα σε αυτό το πεδίο, σε ό,τι αφορά την τιμολόγηση ή την καινοτομία? Για την καινοτομία, νομίζω το κλασικό παράδειγμα, οι πάντες στην Ελλάδα θέλουν να χρησιμοποιούν σαν σύγκριση το Ισραήλ, γιατί είναι παρεμφερές το μέγεθος των δύο χωρών, μικρές χώρες. Η μεγάλη διαφορά όμως, όπως το βλέπω, είναι ότι το Ισραήλ είναι μια χώρα με τεράστια διασπορά, πολύ μεγαλύτερη από ό,τι η ελληνική, που κατά κάποιο τρόπο συμβαίνει να είναι εξέχουσα στο φαρμακευτικό τομέα. Και αυτή η διασπορά έχει πολύ μεγάλο μοχλό πίεσης για να αναπτύσσεται η έρευνα στο Ισραήλ. Η χώρα είναι μονίμως εμπόλεμη και πρέπει να αντιμετωπίσει προκλήσεις και προβλήματα για τα οποία η τεχνολογία ίσως να είναι μια πολύ ενδιαφέρουσα προσέγγιση και για την προάσπιση της χώρας. Και πάρα πολλές καινοτομίες στο Ισραήλ έχουν προκύψει ακριβώς από ερευνητικά προγράμματα που σχετίζονται με τον αμυντικό τομέα. Το ΑΕΠ του Ισραήλ είναι διαφορετικό από αυτό της Ελλάδος, αλλά εν πάση περιπτώσει είναι ένα παράδειγμα του πώς μπορεί να γίνει. Ένα άλλο χαρακτηριστικό παράδειγμα που χρησιμοποιούμε είναι το Βέλγιο, πάλι αντίστοιχο μεγέθους με την Ελλάδα. Το Βέλγιο έχει πολύ μακρά παράδοση στη φαρμακευτική βιομηχανία, με παλιές παραδοσιακές φαρμακευτικές βιομηχανίες και πολύ ελκυστικό περιβάλλον μέχρι πρόσφατα. Το Βέλγιο ήταν η έδρα για τα κεντρικά γραφεία των μεγαλύτερων και πιο διάσημων φαρμακευτικών εταιριών. Άρα υπάρχει τεράστια δραστηριότητα και σε επίπεδο πανεπιστημιακό έρευνας και σε μεγάλες και σε μικρές εταιρείες. Και άλλο καταπληκτικό παράδειγμα βέβαια είναι η Ελβετία. Πάρα πολλά από τα στοιχεία που έχουμε σε ό,τι αφορά τις ευρωπαϊκές δαπάνες στη φαρμακευτική έρευνα και ανάπτυξη, κατά κύριο λόγο αναφέρονται στην Ελβετία. Με κολοσσούς έχουμε την έδρα εκεί. Αλλά ακόμα και εκεί η έρευνα που κάνουν γίνεται εκτός Ελβετίας. Δεν υπάρχουν επαρκή άτομα, επαρκή ανθρώπινοι πόροι για να γίνει όλη αυτή η έρευνα. Τελευταία χώρα που θα ανέφερα και πάλι με παρεμφερές μέγεθος στην Ελλάδα είναι η Ιρλανδία. Η Ιρλανδία έγινε μείζον τόπος προορισμού για την κατασκευή βιοπαρασκευασμάτων, γιατί πριν από λίγα χρόνια αποφάσισαν να δημιουργήσουν το κατάλληλο φορολογικό περιβάλλον. Χρησιμοποίησαν, δημιουργήσαν δηλαδή ένα ευρύτερο μηχανισμό με επαγγελματίες, υπηρεσίες, νομοθεσία, αλλά καθώς και στην αρχή ένα πολύ ευνοϊκό φορολογικό περιβάλλον. Και τονίζω ακριβώς ότι οποτεδήποτε μιλάμε για ξένες επενδύσεις στην Ελλάδα, κατά κύριο λόγο χρησιμοποιούμε τη λέξη κίνητρα και πάντα σκεφτόμαστε φορολοπαλλαγές, ωφέλη, όλα τα χρηματοοικονομικά δηλαδή, τα οποία προσπαθεί να προσφέρει η κυβέρνηση για να προσελκύσει εταιρείες. Είναι ένα σημαντικός λόγος αυτός, αλλά δεν είναι ο κυρίαρχος λόγος τον οποίο θα έρθει να εγκατασταθεί τέτοια εταιρεία. Το ευρύτερο οικοσύστημα το οποίο ελκύει ανθρώπους να εγκατασταθούν ζητεί πολύ περισσότερα. Η Ιρλανδία είναι ο μεγαλύτερος παρασκευαστής δαπανηρών και καινοτόμων βιολογικών φαρμάκων ανακεφαλή από οποιαδήποτε άλλη χώρα στον κόσμο. Αναρωτιέμαι κατά πόσον η Ελλάδα εξακολουθεί να παράγει ταλέντα. Τα ελληνικά πανεπιστήμια εξακολουθούν να έχουν ταλαντούχους αποφύτους. Το βλέπετε? Κατά κάποιον τρόπο αυτό που βλέπετε είναι αυτό που θα θέλατε να δείτε. Είμαι ιδιαίτερα ευαίσθητος στο να εντοπίσω ελληνικά ταλέντα. Αν θέλετε, αισθάνομαι μεγαλύτερη πνευματική συγγένεια. Και αναφέρεται κατά κόρον πάρα πολύ, αν θέλετε, της ελληνικής διασποράς, γνωριζόμαστε στην Αμερική, συναντιόμαστε και συζητάμε. Δεν ξέρω τα στατιστικά, δεν μπορώ να σας πω αν είναι πολύ ψηλό το ποσοστό, μικρό κλπ. Αυτό που μπορώ να σας πω είναι ότι δεν πιστεύω ότι το σύστημα το πανεπιστημιακής εκπαίδευσης στην Ελλάδα είναι υποδειγματικό. Θα σας έλεγα δηλαδή ότι πραγματικά έχει τεράστια περιθώρια βελτίωσης. Αλλά ναι, υπάρχουν ταλέντα στην Ελλάδα και όταν το βλέπουμε και το εντοπίζουμε είναι όταν έρχονται στη ΣΥΠΑ και αναλαμβάνουν θέσεις σε τελείως διαφορετικά θεσμικά όργανα, διαφορετικές δομές. Νομίζω ότι αυτή είναι πραγματικά η πολύ ευγενική διατύπωση του χρόνου, της χρονιάς, αυτό που είπατε για τα περιθώρια βελτίωσης του εκπαιδευτικού συστήματος. Εν πάση περιπτώσει, καταλαβαίνω ότι θέλετε να είστε διπλωμάτης. Τώρα, σε ό,τι αφορά την μετά το COVID εποχή, με τα καταπληκτικά φάρμακα, την νέα εποχή, την εξαποστάσεως εργασία, έχετε τον ίδιο ενθουσιασμό ή είναι γενικός ένας ενθουσιασμός των αδών? Κοιτάξτε, θα σας πω ότι αυτή η βιομηχανία ξεπέρασε κατά πολύ οποιαδήποτε προσδοκία σε σχέση με αυτές που είχα δεκαετία του 80 και εξακολουθώ να αισθάνομαι ενθουσιασμένος και να βρίσκω συναρπαστικές τις νέες προσεγγίσεις, τις νέες ανακαλύψεις για την αντιμετώπιση κλινικών ασθενειών, νέες ιδέες και projects στην ανάπτυξη φαρμάκων. Ναι, όντως αισθάνομαι ενθουσιώδης. Δεν μπορώ να σας πω ότι βλέπω ξαφνικά ότι ο COVID μας έδωσε, ήταν ο μοχλός ανάπτυξης και ήταν η αποφασιστική καμπή για να βελτιώσει ικανότητες των επιστημόνων. Το μόνο που θα έλεγα ως μοναδικό σε σχέση με το ότι προέκυψε από τον COVID και που έχει νόημα είναι η χρήση της τεχνολογίας mRNA για τον πασίγνωστο λόγο της παραγωγής των εμβολίων, όπως ξέρουμε, τη Μοντέρνα και τη Ζενέκα. Είναι ένα πολύ καλό ερώτημα εδώ, το οποίο ακόμα είναι αναπόντητα, κατά πόσο αυτή η νέα τεχνολογία mRNA θα αποτελέσει τη βάση για επιπρόσθετα εμβόλια για άλλες ασθένειες. Ή θα έχουμε, αν θέλετε, ένα γενικόλογο εμβόλιο επί τη βάση τεχνολογίας mRNA. Νομίζω ότι πιθανότατα, ναι, θα συμβεί αυτό. Το απότοκο ερώτημα είναι κατά πόσο θα υπάρξουν εμβόλια εναντίον του καρκίνου επί τη βάση αυτής της τεχνολογίας. Αυτό είναι πολύ πιο δύσκολο να απαντηθεί και δεν είμαι πεπισμένος μέχρι στιγμής ότι θα υλοποιηθεί κάτι τέτοιο. Αλλά αυτό που είδαμε με τον COVID είναι ότι η πλατφόρμα mRNA για την αντιμετώπιση μέσω εμβολίων λιμωδών ασθενειών είναι τεράστιο επίτευγμα. Και άλλο καταπληκτικό είναι η όθηση με την οποία οι χώρες και οι κανονιστικές αρχές ταυτόχρονα ανά τον κόσμο προχώρησαν σε συνέργεια για να διατεθούν άμεσα τα εμβόλια στον πληθυσμό. Ήταν πραγματικά αξιοσημείωτο, ήταν πολύ πέραν κάθε προσδοκίας. Και το να παρεχθεί σε τόσο σύντομο χρονικό διάστημα εμβόλιο τέτοιας αποτελεσματικότητας είναι επίσης εκπληκτικό. Άρα, συγχαρητήρια και στις εταιρείες και στις κανονιστικές αρχές. Και ίσως σκοτεινή σαλίδα γι' αυτό είναι η απροθυμία του γενικού κοινού να εμβολιαστεί. Εξακολουθώ να εκπλήττομαι και να αναρωτιέμαι γιατί υπάρχει αυτή η αντίδραση που υπάρχουν τόσοι αντιεμβολιαστές. Είναι πραγματικά έγκλημα κατά της κοινωνίας. Και με αυτό σταματώ. Ευχαριστούμε πάρα πολύ. Ήταν εκπληκτική η συνομιλία μαζί σας και ελπίζουμε να σας δούμε σύντομα στην Ελλάδα. We thank Mr. Papadopoulos and Mr. Papachelas for the very interesting discussion we just followed. We proceed to the next session, effective approaches in the role of the labs. I would like to invite Mr. Paschalis Apostolidis and the Secretary General, Mr. Anastopoulos, Madam Tsuma, Mr. Kikilias, and Mr. Gogos. Thank you. This very interesting discussion with Mr. Papadopoulos that really showed the future. Let us move back to reality, the Greek reality. And as Ilias Pirtounias has said, let us view the more effective approaches in the management of patients and the role of data in health. And allow me to make a brief introduction before we launch our discussion. The pandemic, therefore, has proven how important it is to have access to health data so as to exploit them scientifically and attain better results in well-targeted treatments. The European Commission has realized the huge importance of that data and has set as a priority the creation of a European space of health data until 2025. Specific European countries such as Finland have made quick steps ahead and already exploit health data for the benefit of science, patients, and the health system of the country. Our country has been discussing the issue of exploiting e-prescription data. No other country has the quality of our data, which is a real treasure. but we have only been discussing it ever since 2004. I wonder what impedes us, and we cannot follow suit as other member states so as to exploit that data, because the data of the GDPR is not the cause, because other member states already exploit that data. Could you please hold your time at 6 minutes so as to have time for discussion? So I first give the floor to Mr. Anagnastopoulos, who is the Secretary General of the Ministry of Digital Administration. Good afternoon. Thank you for the invitation. The question was straightforward and the introduction. Allow me, however, to start my address in continuing the previous session and the excellent dialogue between Mr. Papachelas and Mr. Papadopoulos, who also spoke of subjects having to do with Greek innovation and to what extent this is feasible, given the factors that have to do with the diaspora, because the Greek diaspora, as we've heard, is smaller than that of Israel. And I would like to point out that especially our country has the great prerogative to have an excellent academic diaspora, because on the basis of surveys conducted in the past, I remember Hellenic Bank, Bank of Greece survey done, it has been demonstrated that Greeks that have started their studies here and are now in foreign universities has an excellent record in high caliber publications. And I believe that this might be something which would be desired, not because only it is desired by them, but would be nationally beneficial, so as to invest in the innovation forces and to have them back in the country. The second thing that I would like to say is that thinking about sensitive data, in order to process that, one needs the appropriate infrastructure, and we have lately managed to have excellent infrastructure that we have offered to the field of health, such as electronic platforms, for instance, Zoom and so forth, for the various sectors, or the cloud infrastructure, which is being developed, but also through networking, that we will have the excellent network connections and therefore infrastructure. All that is necessary so as to have good, efficient services offered. Now, let me dwell on the issue of data that you touched upon. Indeed, data is an issue, and I will not speak strictly of medical data, but I will speak of the data in public administration. We have managed to hold an extremely successful experiment of vaccination. This was unprecedented in our country as well as in all other European countries. So we managed to integrate in this vaccination and set the priorities and integrate all the Greek population that were eligible. Some 8.8 million Greeks were set in list of priority, and this has led to an automated process of setting one's dates, appointments, and getting vaccinated. So that means that not only did we exploit all the platforms available through SMS, web, citizen centers, drugstores, we also managed to have all citizens in a way so as to have them cover that date. This happened for the first time, and that meant that we could deal with problems. This was not to be taken for granted, neither has it happened before. And this was a success that allowed our country to have a vaccination program that was globally acknowledged as technologically successful, but also based on data that allowed us to build those applications. In other countries, this was not attained, yet we managed, and we did it because we had the possibility to process that data and build applications that were created on reliable data. Therefore, the key for all that was interoperability. What you also say about medical data, this has to do with a broader sphere of interoperability, which allows a citizen to make a demand, make an application to the state, and retrieve all set of information, such as the case of Fuel Pass, for instance, or other kind of platforms, where, for instance, a citizen files an application, and we can retrieve immediately data, whether he has paid the traffic dues and all that information. So he doesn't have to scan documents, have them checked and all that. All that takes place automatically, both in observing GDPR and on the consent of the citizen. And this is most important because now we have a citizen that with a single citizen's application, we have another 6 actions taking place and being affected in the background by us. Therefore, also the example of vaccination certificate was such an successful example. This certificate in our country, as was presented by the Prime Minister, offer the possibility to be innovative in the foreground and demonstrate that we have innovative ideas which are being adopted and can move ahead. With regard to interoperability, it is right and necessary to find the the common rules so as to find, identify, collect and retrieve that data. There are simple queries which are not easy to answer unless you have the appropriate quality of data. For instance, the father or mother who wanted to make an appointment for the child, unless we have the necessary data at the necessary registries, this could not be attained. Unless we have the possibility to know that someone has the specific data and has indeed the possibility and the power to set an appointment for the third party, that would not be available. So in order to be able to offer a wealth of services to the citizens, it's necessary to have the appropriate data, so as for the data to be clean and reliable. Finally, it is very important to have security services. That is where one can exploit with additional security factors, as it happens with the bank transactions, as it happens with the responsible declaration and power of attorney, and whenever one needs services that need further classification. So that's why we have a registry where one may have secured a mobile number, and therefore we can have the renowned code reaching the mobile phone and corroborating one's identity and being authenticated when using some applications. The multiple communication channels are also important, serving the citizen. The data of public administration are not separate from that health data. These are the data that allow us to have the wealth of health data combined with services that one will need so as to build the whole ecosystem of the overall services. Finally, with what you mentioned vis-à-vis data processing, all the solutions have been proposed and adopted at the European level. We move towards that direction. We know very well that there are limitations that have to be observed, but in order to be able to extract useful data for the future, for demo and other surveys, we will must have the possibility both to process indices in a macro level, but also and macro level as well, so as to retrieve the appropriate information. Thank you. This is in guise of introduction. Thank you for observing the time. It is a fact that what you said, even 2 and 2.5 years ago, will be science fiction. We speak of hundreds of millions of transactions when some 3 years ago we started with from 8.8 transactions in 2018, 34. This year we will be concluded with 1 billion. We hope, as the Minister, Mr. Pierakakis, has said, we will be reaching 1.5 billion. What's most important, it's not merely the number that is in most transactions. It's not that a citizen enters, it's what we do behind it on the citizen's consent, so as to retrieve all that necessary. It doesn't have to do anything. So these are transactions for which the citizen doesn't realize what we do, but there are so many transactions that we do for him without him knowing about them.
Right, I should now like to give the floor to Mrs. Tsuma. She is the president and the CEO of a very particular organization. It's not very People are not used to seeing that in other European countries. It's IDICA. Okay, so I have a presentation there. So she's president and managing director. I have a presentation there. So do we have the presentation, gentlemen? Let's bring up the presentation by Mrs. Zuma. So how do I control this? Right, so just speak out loud, say next slide please. You'll just say next slide and it will change automatically. It's voice activated. Right, so thank you very much. So the organization, that is a rather particular one, is the organization that is IT based. It is especially built to support the healthcare sector with health information systems. It's a health ICT that handles and manages the ICT of the Ministry of Health. So we are de facto required and needed to do and deal with big data. So big data were created from all these years of operation of the healthcare systems, which we are called upon to process and elaborate in order to move on to the next steps of the evolution of health services addressed to the citizens. So this big data has some characteristics. All organizations are seeking those tools that will allow them to utilize big data. Same as with our case. So let's go and see very, very fast the 4 V's of big data and how they find application in the big data of health, and especially the IDICA health big data. So the 4 V's are that the volume is particularly large, particularly extremely high data download speed. The second V is velocity. The third is the extremely wide variety of data, variety, and the quality of the data and the reliability to be true, veracity, is the 4th V of big data. Now in our case, and starting with the first feature, which is volume, the data that we have as IDICA or the Ministry of Health, or as the state if you'd like, is around 800 million prescriptions, 300 million referrals for 12 million patients from 50,000 physicians, from 10,500 pharmacies and 2,650 diagnostic practices. This is built and set up from a number of daily exchange and introduction of data from all these points. We know very well that every day citizens visit doctors, every day prescriptions are filled, every day prescriptions are made, every day referrals are drafted, and every day referrals are executed. So we need velocity, speed. Now the speed and velocity at which these things happen today is exceptional. All these data are exchanged among all these focal points very, very fast. The doctors know it, the pharmacists know that, and they experience it every day. Regarding data form, obviously these data could not be processed in the way we're discussing about were they not in a specific structured form. So they are entered in a structured form as per the rules of IT for these big data, which is why we have fast access and reliable as well. Yes, because they are data created using specific rules from the source. And there is no other intermediate processing of these data. These data, at the moment, are utilized via a BI system. There is a BI system that we use,
so as to have the information available when needed and where needed. How is this information collected? Well, information sources are rather numerous. They're all third-party systems of all manufacturers and partners of the physicians and pharmacies. They are primary healthcare. They are e-government, through which citizens come in contact and with all systems and all other systems of Greek administration. They are My Health, the patient health record, which is built by this exchange, the My Health application, which is the last service for the citizen where we exchange and find data. They are the various registries, like the COVID registry. They are the LIS, from various centers, diagnostic and hospitals. And they are the e-health certificate system. So there is a full, complete exchange of information from the systems in which the data are created towards the e-prescription system. Here again, quite indicatively, I have put on the slide some numbers regarding the volume of data we are called upon to process. And here the way these data are created. Here I have some numbers that talk about the millions of visits, the number of citizens who have activated paperless prescription, e-prescription, the number of intangible prescriptions, the e-prescriptions already handled, and, well, intangible communication is one that we're in a very proud position to say that is used by an increasing number of citizens. Because it's just that. It's a digital service. There is no paper to be used and to intervene in the communication between the citizen, the doctor, and the pharmacy. Where do we use and utilize this information today? Where does the Greek state and the Ministry of Health use this information? We monitor and control pharmaceutical expenditure. We create individual patient registries that are very useful both in prevention and treatment of these illnesses. Another area is the identification of vulnerable groups, and our first successful exercise was the one mentioned by the SG. We located those vulnerable groups that were indicated by the patient, by the groups of doctors, to prioritize in vaccination, and they were located and identified through the utilization of these data. We didn't expect each and every citizen who is or considers themselves as vulnerable patient to come forward and prove it before the hospital or actually the vaccination system. We identified them, we gave them priority in the vaccination system, and then their appointment was already prepared for them to receive their vaccination first. Proof of the fact that we do in fact utilize the data is the next pages you can see on my slides. You can see various statistical analyses regarding the utilization of data from the e-prescription system. I will not spend too much time on these. Moderator says we have another minute. Yes, I will not insist on these because it's pointless, because I want to show several ways in which we today and every day utilize this information for the monitoring and control of pharmaceutical expenditure, and is available both with the Ministry of Health, with the AOP, and any other organizations and agencies need this information to perform their duties, to draft strategies and policies. So this BI system is now fully in full use for utilizing the data. Further utilization regarding patient registries
has to do with the various and individual information regarding specific patients and specific conditions, and therefore the monitoring of their progression individually. At the moment, we have the cystic fibrosis registry, the COVID-19 patient registry, the COVID-19 vaccination registry, people in the influenza vaccination registry, registry of childhood and adolescent neoplasms, and registry of vaccinations of children and adolescents, which means that individual utilization is also performed of this individual data. Skipping forward, I should like to say that there are many ways to present statistical information from a BI. I showed everything. And in conclusion, I will skip forward to the next thing. I wouldn't want to take up too much of your time to say that finding any individual categories and groups, starting from the vulnerable groups or any other groups and assemblages of patients are needed by the healthcare system to be able to provide them with services or to perform preventive medicine is already a given in our country. And preventive medicine is something that we've already started as an action where really there we dip into that ocean of information and we fish out those specific people who need to be, for instance, notified so as to perform the preventive checkup or preventive medicine or whatever, or preventive activity. So, in conclusion, big data benefit our health. At this point, I should like to thank you very much for your attention. Thank you, Mrs. Truma. I have followed the progress of IDICA from 2012, since it was in the cradle, actually. You've made leaps forward. I mean, everything we saw today was science fiction 10 years ago. I should now like to give the floor to another organization and their representative, Mr. Kikilias, who is contract director with the National Organization for the Provision of Health Services of the AOP. I think it's the second largest social security fund after the AOK in Germany. So will you stand? Will you take the floor? I have a presentation. May I borrow the remote, Dr. Tsuma? Thank you.
Good afternoon. Thank you for the honorary invitation. It is a great joy for being again this year in the HealthWorld conference. I'll start by what has been said by most speakers, that we are in transition at the European level for establishing the European space of health data, and the European Commission has set very specific goals, especially with a view to exploiting all that data, promoting innovation, and of course, in full observation of GDPR. These goals should be, of course, translated and transposed in national level, and it is the dialogue in Greece is mature, I believe, for respective agency. You will see, however, that it is a very mazy environment. Data is collected everywhere. We also collect data not only through IDICA, but from secondary education. We knew ERGs are expected, but how come that AOP has a central role? Because it uses 6 billion euros so as to produce and buy health services through a broadened health suppliers. So the cooperation with IDICA is self-evident. It is the biggest public contractor in the health system. We have already sent for very important DRGs, as mentioned in the morning. We weigh all the needs, analyzing data. We promote clinical excellency after having processed data that we have at our disposal, and that's will lead to innovations and reforms. Let me show you an innovation of AOP. Many years ago, a small team of people with great scientific knowledge and in cooperation with the Hellenic Radiotherapists Society designed the so-called radiotherapy. Through this model, we manage to control in digital environment all the expenditure pertaining to radiotherapy. We know the plans, we know the planning and the sessions that take place, and for the whole health system, both public and private sector. And you will say something specific. What have we managed this way? First of all, we can pay. The reimbursement was not evident the previous year. And we create the appropriate environment so as for us to know in real time the needs of patients and therefore establish joint lists for people in need for the appropriate radiotherapy without any additional time delay. Another element are the multi-genes therapies related to breast cancer. I have the honor to be in charge of the negotiation committee with the companies. After a broad study in our organization and viewing the cost-benefit analysis deriving from such agreement, we arrived to such an agreement and had special type contracts on high criteria. But at the end of the day, we would like to know how much we would were to spend. So we saved 1 million euros. If you think that most of you come from pharmaceutical companies, there was a curtail of 80% of expenditure of patients that would go through this examination without having redundant chemotherapies. And of course, a huge social benefit for those women. Going on quite recently, I can break you here the news that next week we will announce the contracts with companies that are able to offer the organization bioindicators for mutations, brackets A1 and 2. So in these cases concerning some 2,000 women, this is a specific target group, we managed through negotiation to save another 500,000. Many high value and high quality agreements are signed. And let me refer precisely the data because it also concerns hereditary cancer. So one must know the personal data of the third person. And we have introduced ISO 27000 for the labs that are involved in these therapies. Quality is a central quest for all insurance companies, especially the paying ones. A first study was made. We analyzed all the labs, and from this data collection, both from IDICA and the other agreements that we have at hand, we managed to create the models on very qualitative criteria for the payment of the radiotherapies. In the next stage, the audit of all expenditure will take place in real time. There are innovative machines, and when we speak of health technology and state-of-the-art technology, there are state-of-the-art machines that can transmit pictures, images to our center and know in real time whether an MRI should be affected or not. You have 1 more minute, Mr. Kikilias. Yes, I'm concluding. Of course, we do not stop there. We already prepare new projects. We try through the broadening of the digital portal to come closer to citizens. We have already launched the dialogue with specific target group patients, such those suffering from diabetes or renal diseases, to have in real time the administrative support from employees in our agency. And of course, we need a state-of-the-art business intelligence that we will run stochastic models so as to forecast our needs. So in conclusion, I'd like to say that definitely this is the time to view how we'll exploit this digital transformation and on the strategic planning that is set through the RRF and the funding offered. For us, it is sine qua non because by exploiting that data, we can establish the services, the health services to be offered by AOP, and use that data as payment tools so as to attain the best possible agreements on qualitative agreements, criteria. This is the minimum, I believe, because the use of data is to the benefit of all. Thank you. Thank you, Mr. Kikilias. And last but not least, let me give the floor to Mr. Gogos, the professor of general medicine and director of Metropolitan. And I have to comment that your calm voice of briefing, of appeasing us, but also of alerting us whenever it was needed during these 2.5 years of the pandemic, along with other eminent scientists, has been of great value. I have been following you and watch you every day through mass media.
Thank you very much for your kind words, and I must say that I really did enjoy the previous presentations. I'm truly glad because, well, now we have in the country the foundations to start what we've been talking about all these years as clinicians, which is to have data in our hands. And then I would like to say that what Mr. Anagostopoulos said was a huge success with the vaccines that was unprecedented for Europe even. Now, for Mrs. Tsum, I would like to say something that should go without saying. She mentioned that we know in Greece how many vulnerable populations we have, the immunosuppressed and the heavily immunosuppressed, because when one is drafting health policies, it's impossible to do it without this information. We didn't know how many vulnerables are in Greece, and I think we're close there. Now this, I must say that we do have multi-gene testing before the chemotherapy. These were biomarkers that were considered expensive, but when you take a look at the cost effectiveness, it's clear to see that everything goes well. These are huge steps forward. Now, like Mr. Apostolidis said, that we have data and information from the e-prescription. Why don't we have the data that this information can yield? And my question is, how can the average Greek, your garden variety Greek, and I as a citizen have direct access, and congratulations without you doing your ministry with the financial data, the e-wallet that we have, etc. And why don't we have the personal health data, which is even more valuable? So we still have a long way to go, and I would say that I, as a clinician now, I'm a doctor who is in the first line, has been in the first line for 40 years. I used to hold high staff positions as a director of the medical service and a chairman and governor of a hospital and so on and so forth, but also as a professor, because all these things have to do with education and research. Data provide food for research as well. It's very useful in our country. So what do we want at the moment is to have real data on patients. The medical record, the personal medical record. We all know that, and if you don't know that, I will inform you that a patient who comes from the family doctor to the health center, and from the health center they're referred to the hospital, and from one hospital to the other hospital, and then they're re-referred to their family doctor, there is no personal file and record following them. So you need to expend financial resources to redo x-rays and CT scans and MRIs and everything. So it's absolutely necessary for the patient, for the attending physician, and for the health system to streamline the provision of services and the financial services, to have the personal medical doctor, to have all this data. I think it's something that's starting now and we can move forward. Another huge issue we have the world over and in our country is to collect the real world data, which is extremely useful. Why? Well, because they confirm the data of clinical trials that are currently running. It's not what we really see in real life. We have new treatment, therapeutic interventions that need to apply to the actual people, because each country has its own particularities, its own diseases, its own patient profiles. We have vaccines, where it's very important to have real-world data in order to communicate them to the people. And all this must be done soon, because they will yield a lot of data which will rationalize and streamline expenditure and the offer and provision of services. Also, we have the epidemiological data which we need to have available at some point. I have the honor of being a member of the National Committee on the Pandemic. And what we've been seeing that it's necessary is data, be they epidemiological or real-world data or whatever other variety of data there is out there. So it is of the utmost importance to have that as well, I'm talking about real-world data, but also disease and condition epidemiology. Let me bring an example of successful recording in Greece. It's COVID and the HIV. It's the only two conditions on which we have data because treatment depends on recording, monitoring, and processing of data. And I should also like to point out that, well, in our country we do have some successful processes and some best practices. I would like to refer to what happens with the multi-resistant and the poly-resistant bonds. Now, we are currently registering them. There are a lot of programs like the OD program, the CLIO of the Niarchos Foundation, and a Horizon project that is out there. Well, we have now these multi-resisting diseases and conditions, and the recording is the data that will come from real-world data in our country will lead to the appropriate interventions, because interventions without data are difficult and many a time disorienting. And another huge thing and a huge success, and I want to close with this, it's a huge success of our country that is based on the SIP team that I'm coordinating now. We have collaboration with 56 different hospitals in the country, and through the collection of data on COVID, epidemiological data, we managed for the first time in Greece, I think it's unprecedented, to have an equivalent, which is an interleukin-2 inhibitor on COVID disease, to make it, to allow it to be approved through the EMA. And now we're in negotiations with the FDA for them to issue their approval. And this is based on the discussion and collaboration of many clinics in Greece and a tremendous data we have on SIPS and COVID. This is all. I don't want to take up too much of your time, and I would like us to go on with the discussion.
That has been extremely interesting, and this proves that this effort, I believe, was launched by Greece, yes, mainly from Greece. That was my question. We'll start from the last so as to conclude with the first speaker. Therefore, I consider this is a real example on how an attending physician or the infection doctor society can use the data produced so as to give feedback to the ministry to make the appropriate decisions and perhaps curtail the expenditure because certain treatments are far cheaper than others and better exploit the health resources. Am I wrong? No, you're absolutely right. You know that the European Data Center, I think you mentioned that, and in Greece there must be some central service that will be collecting data from work groups. It's not only infections. The cancer doctors also have such teams. The blood doctors, the gastrointestinal physicians, there are such groups, and there must be a central database in the Ministry of Health so as to have much data collected as a country in order to cooperate with other countries as well on equal footing. I omitted saying that there's another step that was made because we also need biomarkers. A positive step was also ODP establishment, that is the Organization for Quality on Health Data, because thus they may be asking specific data from the whole health system. Nice, quite a characteristic example, therefore. And I will address first Mr. Kikilias and Madam Tsuma because they go hand in hand, those two organizations. How can we, and what will be the role in the decision-making process, Mr. Kikilias and Madam Tsuma, in the reallocation of resources within EOP? We've heard the minister say in the morning that he is in a very difficult dilemma how to allocate the resources. And we also heard Mr. Papadopoulos of Biogen, who says that we must invest innovative treatments on genes, which cost a lot. So therefore, this might be a tool for saving resources. How do you view things moving as far as EOP is concerned? I agree. It is very important to analyze data. Actually, we also have an ongoing discussion with SPHE, that is the Hellenic Association of Pharmaceutical Companies on how we'll be using biomarkers. Through such procedures, AOP has managed to conclude agreements by gaining money. Of course, this is not money to be distributed as dividend to shareholders, but in order to shape the appropriate environment so as to have enough pooling, so as to attract investment for R&D and have new treatments introduced and have the appropriate profile so as to have the patient who will be taking the appropriate treatment without having someone other losing this chance due to rebates and clawbacks. Same question to Madam Tsuma, adding that that data, of course, having full coverage and protection of GDPR, what are the problems that you view and how can they be solved so as to have anonymous, that data anonymous and have access granted to the pharmaceutical companies, because all that is valuable and the pharma industry is disposed to spend millions on such terms in order to have access to that data. Well, we must tell you that first of all, we are merely an IT organization who do not make decisions, but we can offer our data to AOP, whomever other public agency, in order to make the appropriate decisions. And we are the body, the public body, so as to pursue the same discussion, that can be this central agency of IT. I reiterate, we do nothing more than that, that will be able to coordinate and create the appropriate technological platforms so as to offer information. The particular efforts of a research group or another research group of a hospital are obviously beneficial, but at the end of the day, we must have an organization that will collect all that. We will have common laws and rules, because there must be an interface of the data collected in two different organizations, so we can play this role as far as information is concerned. That is, we can be the coordinators and have the edge ground that is incoming, so as to have all the data and a common space under the umbrella of the Ministry of the Health and available to those needing it. We already have anonymization of data whenever it's needed. The issue of availability of data for statistics, over access of data, especially in the field of pharma industry, is institutional. It's not technical. Technically speaking, well, obviously, technical approach and potential and capacity exists. We should solve the institutional problems, issues existing. And again, this is not in my realm of responsibility. Thank you, Madam Tsuma. Let us conclude with the Secretary General, that we all know that is not, of course, the person making the decisions. We must observe the time. I'm sorry. We only have 25 seconds at our disposal. We haven't observed the time. We're already lagging half an hour in our agenda. But we can have the discussion on a bilateral basis later, after the end of the session. So let us conclude with the Secretary General. We know that the Minister makes a decision, but the work is affected by the Secretary General and his staff. So with all those challenges that we've heard here in this session, and having as a tool for 2022-2023 RRF, the Recovery and Resilience Fund, which will greatly assist you in this work that you very clearly described, how do you view the role of Digital Administration Ministry in synergy of the Ministry of Health, having the availability that both Mr. Kikilias and Madam Tsuma presented, and the need for saving resources. Indeed, our ministry, both institutionally speaking and as an accelerator, has helped to organize actions, to accelerate them, and it will also be helping in the future for those actions to even have better perspectives to the benefit of the Greek citizen. What Madam Tsuma has said is true. As IT organizations, we can help the work of the responsible agencies, specifically the Ministry of Health, so as to have the appropriate information, so as to make the appropriate decisions. The tools, however, is something that we can help in, as well as in technological and other decisions. In order for all these things to be materialized according to international practices, this is important. It is also true that many projects are integrated in RRF. We'll be viewing a radically different situation in the short and mid-term, so as to have a far better quality and exploitation of data. Let me dwell, however, on something regarding the patient's record. It's true that this record, this path in the course of a patient from the family doctor to a hospital is lost. And in due course, we will be having this record and have the analysis of all the data. But let me dwell more specifically on the subject. In the private sector as well, if someone comes and makes some exams, can one see his data from in a web environment? Is it something that you have secured in the private sector? Even there, at the international level as well, not only in Greece, it's a service which is not offered. We work on that. It demands both technological and other infrastructure, but both the identification of the patient himself between different systems or hospitals and all those actions demand a very cautious planning so as to end at appropriate conclusions. That's what Madam Tsuma said. We plan very cautiously and correctly so as to have the appropriate result. But let me add, as far as applications are concerned, in our country, we have innovative system at a global scale. The patient has access from his mobile phone to the health data that the public sector has at its disposal. I totally agree. Because there are also the issues of private security, the GDPR, as we well know, and with insurance and all that. It is a very difficult task. I totally agree that this must regard the whole level, both private and public sector, primary or secondary care. You're absolutely right. I think we have exceeded the time. I apologize, Mr. Ifandopoulos. I thank the distinguished speakers. Have a good evening.
Well, I apologize for appearing as the pit bull of the conference, but we do have a schedule and we need to keep up with it. So I apologize, Professor Ifandopoulos. Let's move on to the next session, which is the role of health technology assessment in the pricing and reimbursement process. We'll be joined by Professor Elpida Pavi from the Department of Public Health Policy and Dean of School of Public Health, University of West Attica, moderating. We have Flora Bakopoulou, Associate Professor of Pediatrics, John Ifandopoulos, Professor of Health Economics and Social Policy, and Kostas Athanasakis, Assistant Professor in Health Economics, with the kind request that we keep to the time limit allocated. Thank you. Dear friends, welcome to the 5th session of this HealthWorld, the 21st annual conference HealthWorld. We'll be talking about the role of health technology assessment in the pricing and reimbursement process. We have talked about the role of health technology assessment. We know it's a wider terminology that examines various factors, aiming at showcasing the value of a technology in health. We will be focusing today mostly on pricing and reimbursement. We have the pleasure of being joined primarily by Mrs. Flora Bakopoulou, who is chair of the Adolescent Healthcare, or rather chair of the Health Technology Assessment Committee of the Hellenic Ministry of Health. Yannis Ifandopoulos, Professor Emeritus of Health Economics, and Assistant Professor Kostas Athanasakis in Health Economics and Health Technology Assessment. Mrs. Bakopoulou, to cut a long story short, you have the floor. I'm assuming you will be talking to us about the situation today regarding the Evaluation Committee. Thank you very much for this kind invitation. If I may have control over my slides. I would like to share with you some recent data from the committee's operation. It is an 11-member committee. You can see the people comprising the committee. We have the subcommittee of evaluation for the exceptional requests. It is a 5-member committee. Now, the most recent data pertain to 776 new applications received by the committee as of January, or rather from January 2020 until today. I should like to remind you that it is when the new committee was established. Despite the backlog of 106 requests and the 776 new applications, today we have very few files still remaining to be assessed. It is somewhere around 50, so the productivity of this committee is ever increasing. From the first quarter of 2020, when we took over as the committee, the assessment pertained to 15 files per month. Essentially today we have doubled our efficiency to over 28 evaluations per month. You can see here the course of the 493 drugs, barring generics, that were assessed. You see out of 493, 375 drugs have been referred directly to the negotiations committee. 100 have been referred directly to the Minister for Health, whereas the remaining have received a negative no approval. You can see here that we have a team of 82 external partners who are all doctors. We are active not only at the national level, but as of recent, we have seen activity in the European level. You all know that as of January 2021 or December 2021, EU regulation of health technology assessment was approved. It was published in 2021. The first steps in this regulation was to set up the coordination group. An invitation was also dispatched to the stakeholders to express their interest in order to set up the stakeholder network. In April 2022, representatives were appointed with the European coordinating team for medical technical, Mrs. Ioannou and Nigli, and for drugs, Mrs. Kani and myself. The HTA regulation is expected in the first 3 years to function in a preparatory form. As we said, the coordination group has been set up. Other steps, preparatory steps, are to be expected, with the ultimate aim being in 2025 first to assess and evaluate cancer drugs, the next 3 years until 2028 to assess and evaluate advanced treatments and orphan drugs. And the full implementation of the regulation is expected in 2030 for all drugs that are licensed through central procedures via the EMA.
Our country is represented through the committee in the newly established heads of agencies group, the so-called HAG. It's a group of the HTA committee's heads aimed at preparing the national systems to receive the new European regulation and to have a common field of understanding, common page of understanding. Our country is also represented in UNET HTA 21. It's a consortium of sorts that evolved in 2021. We had the UNETA Action 1, 2, 3, and then the UNETA 21 in 2021, which has as its goal to publish and issue guidelines on methodological and procedural issues in order to support the implementation of the EU regulation and the harmonization thereof in the member states of the EU. I should like to thank you very much for your attention. Thank you very much, Mrs. Bakopoulou, also particularly for the fact that you respected the time allotted to you, which will give us the opportunity to discuss later on. I should now like to give the floor to Professor John Ifandopoulos. Can I have the slides now, please?
Okay, thank you. Thank you. So, start counting time from now. I will try to present you within these 6 minutes that I have to observe 2 questions. The first question is, was it necessary to introduce HTA in Greece? Why should it be here? And the second question, HTA post-era, what will happen? Because we've already seen from the previous speaker the huge work done. Ever since 2018, we had already published our concerns proving the need for an HTA in our country. And it was interesting that in those 2 articles that were broadly aired abroad, we register what is HTA, what is the role of the EOF, what is the role of the Ministry of Health, and what is the role of EOP. Within this diagram, we had given succinctly what are the procedures and the processes for the operation of HTA in our country. Allow me to focus on the very hot topic of pricing. Let us see how pricing was shaped in our country from 2001 to 2019. That the HTA organization was established. What happens? Here we see the weight harmonized prices for medicines, fully harmonized index. Mr. Kostis Athanasakis will tell us we leave the technicalities outside. So what do we see? And it is worth exploring. We see the European Union as it evolves. Poland, again, ascending trend. And here's our country with the yellow line. See from the average of the European Union how disparate were the prices. And see the abrupt drop, equally abrupt ascent, and the gradual final shaping. So we can clearly distinct 2 periods. The first period before, when our country was uncharted waters, divergent from any form of Europe, and then from 2014 and onwards with the MOUs and so forth, how converging is our country vis-à-vis the other European Union countries. Making an analysis from 2001 to 2019, we see Poland somewhere in average, Romania the same. We took those 2 countries because they've got the lowest prices in the basket we use, in the basket of reference, and Greece is the highest. What is interesting, however, in Greece, to see the great differentiation. And in this diagram, the Lee diagram, we can see the differences. We can see the differences in the Impressionism at the same time. Where is that? Take the x-axis, the horizontal one. Here is the European Union, and here is the trend.
an evolutionary trend in all European Union countries around the average. Poland is similar to the EU average, Romania with some problems, and then a similar trend. Oh, our dear country, chaos, total disparity. We go on, seeing how this same line is transposed into indices. So in indices, when seeing the indices, we see that the European Union has a consistency in time, statistical consistency, then follows Poland with an excellent synergy with the European Union. Same for Romania, but more or less statistical difference, which is insignificant, and Greece, negative. What does this mean? Statistically important deviation. Of all the European Union countries, our country was the divergent par excellence. Europe would move positively, we would go on to the negative, the opposite direction. And now let us see today and tomorrow and see what are the possible assessment methods. Let us distinguish in two categories, the clinical one and the financial one. Let us compare those two and see how we assess the value and how we assess cost efficiency. And the academia, Mr. Athanasakis, Madam Pavi, and all the others who are somewhere here offering to offer knowledge and a plethora of data. In continuation of the previous panel, the answer, give me data and I can measure everything. This we can prove. Two more slides. How we should wonder about the future and what should we assess and where do we put the emphasis from now on? First of all, we should be based on medicine, or the clinical dimension, and efficient therapeutical results. No. Should we accept the studies from abroad as imported by companies without seeing the Hellenic particularity? Should we base solely on budget impact analysis and cost effectiveness analysis, or with a broader discussion? How reliable are the epidemiological data offering knowledge? IDICA said and has presented us. Same with AOP. But I never heard the word university or academia, and I have all here people present who are researchers, who are hungry researchers and ready to devour any data available. The use of medication, what is it? Where? What's the element of cost in real structures of the health system? Not the DRGs that we are using, which are theoretical, that include only 20% of the real cost, because 80% that has to do with the personnel payroll is not included. Real cost data. What is the notion of value and how this concept of value, does not coincide with the price of the medication. And finally, what is the value of assessment? And I conclude with this slide. Germany, the UK, the whole negotiation and pricing is based and is in your hands, Madam President, on the basis of the so-called value-based pricing. What does this mean? That means that prices are determined on the basis of the value. It's not economics and accounting, it's a value science. And there, the budget that you use currently is a secondary factor. And at the end of the day, what do we have in these models? The effectiveness cost is a criterion, and Mr. Athanasakis will dwell on the subject. It is a multifactorial analysis so as to make the appropriate decisions. Thank you for your attendance and right on time.
Thank you so much, Professor Ifandopoulos. You're notorious for being precise. I should now like to invite Mr. Kostas Athanasakis. Mr. Athanasakis, which do you feel are the most important developments in the health technology assessment in the European environment today? Of course, in relation to Greece. Thank you very much for the question. Now, I should say that last time we found ourselves together with Yannis Ifandopoulos, I promised myself that next time I will set it as a term that I will not speak after Yannis Ifandopoulos. Well, I forgot about it, and this is what happened, you see. Well, you were torrentious once again. And it's not the first time, it's not by accident. So, if you please, Mr. Chairman, if you invite me again, please remind me not to step on the same puddle of mud. Right, so I will try to say something that might inspire the audience in this very late time. Now, if one could distinguish and separate, rather, the developments in two fields. Regarding the regulatory field, it's what Mrs. Bakopoulou mentioned. The key regulatory change right now, it's the joint European regulation that was passed after a lot of woe. Europe says it delayed for 2 years due to the pandemic. Well, things are not exactly like that, because there were 2 years delay because there were huge reactions when the text got to the national representations. It had a lot of problems. I had given the opportunity to see it at some point. What was published compared to what was the object of the deliberations by the committee the previous years was definitely very different. However, one should say that the changes are not simply something that has regulatory extensions. The changes in the European regulation are something that dates back 20 years from the Joint Action 2, the Joint Action 2. You remember, Madam Dean, the contribution, your contribution there as well, up to and including the changes in legislation. And as of 2011, it went through hell until it reached this point. But in essence, what it does is not simply a regulatory change. It performs a change that is based on the core of health technology assessment. What it tries to do is to get the application to work faster, to bring these applications to those who need them, and of course to allow, because I think this is classic in European policies, to leave the final decision with the member states. This leaving is not entirely innocent. It's not, oh, fine, okay, we've done the work, it's your decision because it's your instruments. It has to do with what Yannis Ifandopoulos said earlier, Professor. The fact that many elements from the assessment, and primarily those of the financial evaluation, are not transferable. What is not transferable is also value systems, the non-countable, non-measurable issues, what we call the value bases in the system. Now, regarding the scientific part, which is the second pillar, if we can say a few things about that as well. Speaking, wearing my cap as associate editor in the journal. Now, the most hot thing in evaluations and assessments is deliberative processes that have been mobilized very much in international literature. We see them primarily doing that, and I believe it is due to the attempt made by the HDAI with this society over the past few years and the 2021 publication as to how the deliberation and consultation processes need to be performed in health technology assessment. It is a marvelous paper, truly a marvelous paper, because not only does it say and describe the elements of such deliberations, it also places the actors and the fields this deliberation needs to be made as such. Those of you who are interested in those democratic procedures, I suggest you read it. I suggest I stop here and we can pick up where I left off later on. Right, Mr. Athanasakis, thank you very much for keeping up with the type. Professor Ifandopoulos, Mr. Athanasakis spoke of the importance of consultation and deliberations. Do you believe that in Greece we have such consultation procedures, and what would it take for us to acquire consultation culture, not just for technology, but for health technology? Now I will pick up the torch and the hot potato as well. What happens in Greece and what happens abroad? Now, consultation and deliberations means that there are data, facts. And consultation has 3 stages that we need to take into consideration. The first one is the price. The second is volume, which part of the market we're addressing, and the third and most important part of the consultation, which is not discussed currently, is the one management tree agreement, is the pay-per-performance. I mean, how good is the drug? What are the results? And depending on the results, we will make the decisions. And good companies that are truly innovative ones do not want to deliberate and make consultations on the price under conditions of clawback and rebate, which is sort of a haggling situation. Now, we performed a recent study on clawback and rebates that will span to 2030. If the current situation continues to 2030, there will be no more companies, because the burden is huge to shoulder. The states may utilize other funds. So deliberation and consultation means a bilateral relationship that is evidence-based, which means that we have data from the AOP and the VICA data on the table, we have the clinical protocols, and on the basis of those, they say that we'll need to find something that will reduce hospitalization, that will increase the quality of life, and presto, there's the study. The one that is not something that is real in Britain or something that happens in the United States of America or whatever. So the researchers are there, the finger pressed against the trigger, and we're ready to work with Madam President and her team. That is doing great work. And tomorrow to see our country not in terms of prices, clawback and rebate, or in volume, but pay per performance. If there's a good drug, I will reimbursement. If the drug is not good, I will abolish it.
Okay, thank you. Since you turned your look to Madam Bakopoulou, I will also give her the floor for a question. You showed us the work of the committee and the whole productivity that you have shown and how you proceed. What would you expect? What you wish the state to offer so as to be even more effective and productive in your work? What kind of assistance would you wish for? Mr. Ifandopoulos spoke of the assistance you may have from researchers, but I speak about institutional assistance. And how do you view the future of HTA and your committee in Greece? Well, the cooperation with scientific societies is very important. And this is precisely how we proposed and had the change institutional framework. And now we can select external auditors from the academia. This was non-existent before our committee was established. This has greatly facilitated our task, and there's a huge field for cooperation that can be discussed. What I see in view of the European regulation is that we must boost HTA through people who will be permanent employees, permanent staff. And this is extremely important for the secretariat, the scientific secretariat, because as things will evolve the next years, the cancer, that is the medicine that is being assessed, we will submit the whole file centrally. So we should have the appropriate secretariat that will be able to enter the European platform and retrieve all the documents, because the documents will not be refiled at national level. And the joint clinical assessment report is most important. That would be a report where all the views and divergent counter arguments will be registered, but there will be no conclusion drawn. This was voted and adopted in the European regulation. So you realize that the national state will still exist, will be necessary. The drugs that are to be assessed the next year will be very few. We start from 2025, and the first year there will be only one medicine to be assessed. So there will be, we will not have the national HTA vanishing, but the role of the scientific secretariat will be decisive. We must have the appropriate people, and we only have excellent scientists. We must have a more permanent work relation so as to perform this task, that we will demand access to central data banks and will be most useful and of critical importance. So a transition from a committee to a body, you mean an agency, the way you describe it. Well, that would be ideal. I don't know what's the capacity for that, but if this cannot be implemented in the first stage, what should be done, I believe, would be to have the secretariat staffed, or for the current people to have a more permanent relation, because there are people who have acquired useful experience, they know and love this work. So it will be extremely helpful if they remain, because they will be necessary. The alternation of people in these posts does not help, especially when these people have proven their value. Thank you. I hope that the state pays heed to that and listens to your claim. I'd like to address a question to Mr. Athanasakis. Mr. Athanasakis, we saw that in order for the HTA to proceed in Greece, what is most important is to have the appropriate personnel with the appropriate knowledge. How do you view this capacity building that we should have in Greece so as to reach the point to be effective and have a real operative HTA in Greece as well? This is a very interesting query, and thank you for raising it. In the first years when we started discussing about HTA in Greece, and then I do not refer to this grant link originally. I say when we really entered into the gist of the matter, the first question, the first issue was whether we would have people supporting this subject. Well, people are always available, to be honest. Professor Ifadopoulos has hundreds, if not thousands, of university degree holders from the public health school. There are 3,700 alumni from this program solely. So critical mass was over there, always there. The point is that this critical mass has to be continuously trained and retrained so as to respond to the ever-changing needs and demands. For instance, the way we assess currently things has not in 2022 has nothing to do with what happened in 2012 or in 2002. And there's no relation the way we perceive the so-called system of values and how it was introduced in the normative parts of the decision has nothing to do with the similar regime of the past where it was practically non-existent. Therefore, we need a training that will respond to these needs. For instance, I'm telling you, next week, a pan-European meeting takes place in Salzburg. On the subject of HTA, supported by Ansford, the University of Maastricht, and the European Medical Institute. I will be a speaker there, having the closing speech. On the subject, as Madam Bakopoulou has mentioned, I will be speaking of the procedures of European integration in the HTA field. These people will be training that personnel that will go there for a whole week, only on the issues of financial assessment. You realize how big are the demands and how far we should reach. We do have the personnel. The point is, how are we up to date? And at this point, the work to be effected by universities must be abundant and continuous. Thank you. I would like to thank you all. I see that there's no more time available, so we should conclude here. In concluding, I would like once again to reiterate what I always say, how important I personally consider in HTA to have the participation of all the stakeholders. I consider that this is most important, especially for the demonstration of the value and so as to cover all domains of HTA. I warmly thank you the panelists and you who attended this session.
And cost effectiveness in time, Madam President, precisely. Well, we said that the effect must be good, but the cost, well... And after this most interesting conversation, we have reached the final session of today. It was a marathon long day. It is the hospital at home, a new era in the provision of treatment and care at home, moderated by Mrs. Vanna Kiakatu, journalist with ERT, the national broadcasting station. We will be joined by Mr. Yannis Kotsiopulos, Secretary General, Mrs. Olga Balaura, Angeliki Angeli, Mr. George Mitropoulos. You are kindly requested to take your places on the panel. I don't need to repeat that time is of the essence. Good afternoon, everyone. I should like to introduce myself. I'm Vanna Kiakatu. I'm Editor-in-Chief in Hertz and HealthView, Director of editing team. So I'm moderating this discussion that has to do with a very interesting idea. An idea that could be, Columbus's egg in many issues faced by the healthcare system. It's an idea that's not a novel one. From as early as 1992, there is a provision for a hospital at home service, even in 1983 for psychiatric patients. So today, 30 years later, we are discussing how this, generally unknown idea, it's unknown to the patients and unclear for those dealing with health-related issues, can become more precise, more clear. I think we have the appropriate speakers. I should like to welcome them and give the floor to the institutional representative, Mr. Yannis Kotsiopulos, who is Secretary General for Health Services with the Ministry of Health. Good afternoon. Thank you very much for inviting me to this conference. It is very important to open the dialogue to include new innovative health models like the hospital at home. Like you said, it started very, very slowly and for quite a long number of years, but we can move on to a new phase, to redesign health services. And to speak the truth, this discussion stemmed from a discussion I had with Dr. Tsanakas, who does the pediatrics hospital at home, who explained the story of a young child, Konstantinos, who used to live outside Thessaloniki. He was a healthy and active boy who contracted a very rare heart disease that forced him to stay in the hospital for a long time, which also forced his family, his carers, to move to the center of Thessaloniki from the area they lived, to spend long hours at the hospital. And there, the idea was born as to how we can hospitalize these children closer to its carers. So Dr. Tsanakas explained to us the entire scientific model around pediatric hospital care at home. It concerns children who are in need of intensive care at home, which can be done with safety. And I think we have a couple of slides to show, don't we? So from that idea, what stemmed was to see whether we can expand this model of care, not just for children, but also other patients who need care at home for other ailments. And could I please have the clicker? Right, okay. Click, click. It's working? Right. Whether we can expand it to cover other groups of patients to offer services at home. Patients suffering from, heavy ailments who need to spend long hours at the hospital. People who need to be constantly rehospitalized and their patients who have to suffer through hospital infections. People whose family suffers from the fact that they need to care for them over long times in a hospital setting, which entails an indirect cost for the family and a direct cost for the state that needs to care for a patient in a hospital setting. So we're trying to come up with a model in which the patients will receive better care at home by a healthcare team comprising nurses and doctors with less cost, with more safety and in a better environment. We filed this as a project with the RRF. It was approved by the European Union, so we do have the funding to start it with 14 million euros. It can start very, very soon. In the next few months, we have the entire preparation, so it will start sometime in November or December at the latest, and it will comprise these 4 sub-projects. The first sub-project is the upgrade of the institutional framework, because there is an institutional framework in place covering hospital at home. But this does not cover the additional medical actions that will be required for hospital care at home, which, as I explained earlier, pertains to some specific medical acts that may not be performed outside the hospital setting. The second has to do with the use of technology. It's very important. It's not something we used to have in the past, Mrs. Kiakatu, when we first introduced this project. Now, with telemedicine and telemetry, we can monitor and follow the patients at home. They can be connected with the information systems of the hospital, and when the nurse or the doctor visits the patient at home, we have set up an environment that is similar to an ICU. We have the systems that communicate with the hospital systems, and we can provide safe care at the patient's home. The third sub-project is the building of 8 centers in 8 hospitals. These centers will offer this service. In the beginning, we would have liked them to be more numerous, but the project is rather limited in its funding, so we can only cover 8. They will start on the current institutional framework. When we pass the new one, they will be upgraded, and we will be able to have additional medical actions and there. The third is to measure the quality, the indicators and the indices that will measure how much better care these patients have. So we start with the current institutional framework that was passed in the summer and allows us to do more things. We still have a ministerial decision that needs to be signed in November so as to kick off. The new legislation, which is a deliverable of this project, will be expected around spring 2023. So is it worth it? Of course it is. Here I have the photograph of a child that received. This is a photograph of Konstantinos, the child I explained about, who is no longer with us. This boy told Mr. Tsanakas something that if we get better and become better, everything will improve. So it's up to you and the rest of the speakers to explain how we can offer more services of oncology care. It's not just cardiology. We already have in the States oncology patients receiving hospitalization at home, and to do this in our hospitals as well. Thank you very much for the first presentation. You were on time. I have a host of questions, but I would like to to hear from the other speakers. So I will give the floor to Mrs. Olga Balaura with the Agios Savas Hospital, the oncology hospital, for her introduction.
Good evening. Could I please have the pointer? Thank you. In Agios Savas and in the goal-setting framework, and with the assistance of Roche and Ernst Young, we submitted a technical bulletin. That was a detailed study on a program for oncology treatment at home. We called it ECOFEN, which means from the house. And it is a very specific title. We saw that with the available resources of Agios Savas, if we were to develop home care, we can indeed have an oncology treatment at home and really upgrade the life quality of patients and be far more cost effective. Here we depicted the whole existing situation, the status quo, so as to reach the procedures that we eventually submitted so as to have a complete study. I do not see this that far away, so we'll adopt Mr. Ifandopoulos' method, Professor Ifandopoulos' method. I will be errant, strolling around lost my presentation. Thank you. So, as you see, we planned the service Ecofen from the house, recording our resources, the resources we had at the hospital. So we described the situation. That is, setting the question, what would we need to do to perform today? So we had the analysis. We recorded how many treatments we can have per week, how many people, personnel, and how it would operate. The next stage was Ecofen 2, one step ahead. We even reached Ecofen 3. I apologize for the slides, the way they come. So we recorded the existing situation, and we saw that we actually had an absence of such a service. So we said we are to develop an innovative model of home treatment, because otherwise we have time delays, we have transport delays, we have important problems of hospital-afflicted infections, who have bad psychological condition of the patients, who have need for increased home care. Family environment, especially for cancer patients, plays a very important role in their mental boosting and therefore their improvement. So we depicted what we have. The first is Nikos Kourkalis. This is the daily care unit we have. By recording the procedures that we have there, KIN, this is a unique such unit, public oncology unit, that is accredited of 152004. So we recorded the existing situation and we moved on. We said, this daily care, let us try and offer it at home. So we started describing Ecofen 1. Ecofen 1 means that IOSAVAS, having the legal framework, can launch it tomorrow. Now, Ecofen 2, which is an upgraded service where we have the involvement, we actually broaden our geographical scope. We upgrade our services. We introduce additional services, so as to have medical files, have a real-time communication of doctors with nurses that go at home. And we move to Ecofen 3, which is a wonderful project at national level, where this includes covers all the hospitals that have the available resources to be able, if they have the resources, to adopt the study and therefore adopt Ecofen at any moment. What does Ecofen 1, 2, and 3 entail? We have calculated everything in months, in teams, in personnel, what we need in digitized services. You see that in bullet points, but actually imagine that under each bullet, each line, we have all the services and necessary resources. What are the benefits of this program as we describe it? You realize we speak of far more qualitative services in a familiar environment. This is of great psychological boost for the patients, reducing time and the risk of hospital-afflicted infections, respect to the dignity. We have the family close and next to the patient, great benefits for the hospital, great reduced waiting lists, a gradual reduction of cost, an increase of services quality, greater coverage in numbers, greater access and to funding, competitiveness, and we have benefits for the national health system, attaining the main goal for a qualitative health service. Anyway, this year in the European Union, whatever concerns cancer patients is of immediate priority. IOSAVAS, following this policy, has entered the process of accreditation as comprehensive data center. We are the unique cancer hospital entering this process. Of course, we need 2.5 years to be accredited, but we have launched the process and we start adopting more qualitative approaches and procedures in our hospital so as to be better, especially vis-a-vis the patient and then to the personnel as well. Methodology that we applied, yes, and Young, will present the methodology, so I leave the slide, because we spent hundreds of hours on this huge board where we would depict each procedure. But within this part, we included the interviews with hospitals that already apply this program. We spoke mainly with the UK and Christ's from NHS, and they were really astounding experiences. We saw patients that have taught a radically different profile. There are other people after this home care. We spoke with physicians that could coordinate that, and do not imagine that had more resources than us, because the geographical areas would cover, it's as if someone left Ayosavas and offered this service to Lamia, huge distances, nothing to do with Greece, really. Here's what I said beforehand. We have depicted, we have Kin, that is a Kurkulos daycare center, and Ayosavas, so we have depicted what the daycare center offers, so as to have the treatment offered at home, and what the Ayosavas departments must do so as to support that. This is very analytical. We have every detail from the way we will have the preparation of the substance of the medicine in hospital until how it will securely reach the patient, how it will be administered, if there are complications, how the patient will come in contact with the hospital, the whole technology needed, all the resources. You see, the transportation, the treatment, the orderly and nurses, the collection and disposition of waste, the hospital waste, technology. I put that so as to prove to you that we've examined everything in every detail, minute detail. Not all patients can be included in that. There are specific criteria for integrating these patients. I have no physician here to analyze that, but I can give you it roughly. The attending physician will select the treatment. We have specific drugs that are included in the list. Not all treatments can be offered at home. The patient must definitely to have done the first 3 cycles of treatment at the hospital so as to know that there's positive response to this treatment, there's no counterindication. He must be in a phase of maintenance with the drug. There must be a stability depiction, a resonance stability. He must also have e-prescription because, of course, we update the medical file. The patient himself and his family environment must be cooperative and be able to communicate with the doctor and have it in connection with Nikos Kourkoulos. This is the first step, communication spot in the case of adverse effect, and then with the hospital at a later stage if there's something more critical. I gave you the benefits of the system. For us, this is of the utmost importance, and we look forward and expect the legal reform from the Ministry of Health so as to immediately implement those changes. Thank you. Thank you. You were very convincing, I must assure you. Well, benefits might be given in a bullet points, but it was fully understood how important they are. So let us come to the private sector. Madam Angeliki Ageli from Roche, Hellas. So we look forward to listening to you. What synergies can we have for the private sector to cooperate with the public one so as to accelerate this plan?
Right, brilliant. Thank you very much as well for the invitation. I will try to convey all this information surrounding this activity described by Mrs. Balaura. What is the role of a pharmaceutical company and how they can be a true partner in such an endeavor that is exceptionally beneficial and forward-looking and beneficial for the health system in general. I will be focusing on why a company like Roche undertakes such a feat and tries to help. focusing on three main pillars that, if we take the example of cancer, for instance, which is a field of expertise for Roche, our goal and aim is to help solve the problems experienced today in the country concerning this ailment and the three pillars that you can see on the slide. It has to do with the actual focus on the patient centricity, and what actions may be implemented. This pillar includes the example we are discussing today, and two other pillars that have to do with the system funding, the healthcare system funding, various solutions and thoughts we have, but also the very important issue we're discussing of the lack of data in the system. This third pillar is working cooperatively and jointly with the other two under discussion. We are envisaging and working for the past 2 years with the thoughts of offering innovation to the health system and mostly to the patient. Above and beyond drugs, above and beyond treatments, we no longer want to manage the problems we have in front of us as a company that brings drugs to the patients. But what we want is to really be partners with the healthcare professionals and the healthcare system through co-creating solutions for patients. So with this vision in mind, we transition to Ecothen, as presented by Mrs. Balaur in the beginning. Our thought and our aspiration was to optimize, in general, the patient's journey, striving to create value in every step of the disease experience and how we can help them manage it better. So if I may run through what was presented as a final product by Mrs. Balaura, I should like to say that we started by responding to Agios Savas Hospital initiative to help co-create a solution that would standardize oncology patients. We evaluated and assessed, I can hardly read the font, says the speaker. We explored a spectrum of solutions to find the most efficient one that meets clinical and safety guidelines and considers capacity limitations. The next step was to verify the need and pulse check the solution's feasibility with other ecosystem stakeholders, whether it is something viable. The following step was, respecting the vision I described earlier, we identified a solution that would allow this standardization to be adapted easily by other hospitals in Greece that meet the criteria for all oncology patients. Having taken all these steps, we designed a cancer patient-centric home care prototype, the details of which were detailed earlier, working with Ernst & Young, which we delivered to the Agios Savas Hospital and the Ministry of Health, integrated, complete and whole, so as to be able to be used the day after. The benefits were mentioned already. I should only like to focus on the huge benefit for the patients, upgrading their quality of life. We can all clearly understand how much difference it is for a difficult disease such as cancer, a patient to be able to receive their treatment at home, at the time they choose, the day they select, and for the time interval they opt for, rather than having to go through the ordeal of going to the hospital every now and then. In conclusion, I would like to say that Ecothen and the delivered solution is turnkey. It's ready to be implemented tomorrow, once the legal framework is in place. As far as we're concerned, we aspire, and it is our vision, to see this solution being adopted for cancer patients across Greece. And why not similar ones for patients in other therapeutic areas facing similar challenges of patients having to go to hospitals for their treatment to be administered. Roche is a company that wishes to continue to partner with the ecosystem and primarily to co-create and support integrated solutions along with the other stakeholders that improve patients' experience in the system throughout their journey concerning their disease. In conclusion, I should like to express our sincere thanks because this project was a particularly demanding one and time-consuming, if I may say so. I want to thank Mrs. Balaura, first of all, and the Ayosavas Hospital. The first internal medicine clinic, Professors Ratavanis and Nicolaou, who worked in true depth in order to have something tangible that could be used by the ministry the day after. Definitely the ministry and Mr. Kotsiopoulos for lending us an open and receiving ear to adopt something innovative to the benefit of Greek patients. It is particularly important, and it is a huge positive step in the right direction for the country and the provision of care and treatment and therapy for Greek patients. Ernst & Young, because the help of E&Y was particularly valuable throughout this journey. And last but not least, the internal team of Roche, for the perseverance they exhibited, their devotion and dedication to the project. I want to help them. Sincerely, they managed to make the impossible possible, and let's hope that we will see it take action, Mr. Secretary General, so that we may offer this level of care to oncology patients all over the country. Thank you.
Thank Madam Makeli. I believe the Secretary General said that he is ready to have this program implemented starting tomorrow, although we have to wait for the law until the beginning of 23. Yes, there is a ministerial decision that is currently being drafted in the Ministry of Health so as to start. So we can start with the existing resources of Ayosavas, because we have made an analysis with Madam Balaura that we can launch this project immediately without additional funding from RRF. Once we have the additional funding from RRF, we will have an extension of the project in the other 8 centers that will be selected. Fine. Now we give the floor to the last speaker, Mr. Yorgos Mitropoulos, who is in charge of healthcare and life sciences in Ernst & Young. You have the floor. Good evening. A difficult and rough time. We have no one putting pressure on us at the end, but I will observe the time. The motto of EY is building a better working world. And in this project, we felt, us and all the teams we cooperated with, we really felt that we building a better world. We really worked for something that would be good in our small world, if you like, micro world. Madam Balaura said a lot about the project of ECOFEN. I will try to show you the backstage, behind the scenes, how we did it. So, when we started in the summer of 2021 discussing this project, we quickly realized that this was not a project regarding a scientific dimension, and we would not be able to help in that anyway, but had many facets having to do with organizational and administrative aspects, from the processes that had to be identified, followed, recorded, technology, and most importantly, the legal framework. We did have a legal framework, but not the one that would determine the operation of the service. And this whole project had to be based both on global practice that we would have to find from organizations such as Christie that was mentioned beforehand, and the locality. This was the most important mandate we had, that is to have what's best for the Greek patient. From the onset, we had a vision of contribution, a commitment that was matched both by Ross, IOSAVAS, and the ministry. We worked in depth. From our side, we had 7 sub-teams with more than 10 or 12 specialties represented, both from Greece and abroad, specialties having to do with health, but not solely, finances, legal department, technologists, engineers, and having to do with personnel management, so forth. So it was a transversal team that worked excellently together, and it was an excellent experience for all of us. I didn't let Madam Balaura to steal, take away my slide. This is the methodological tool we used. We started by trying to understand the current situation. What was a patient's trip? We started from Nikos Kourkoulos and IOSAVAS Hospital. We spoke with personnel, both not only physicians and nurses, but also the legal department and other departments of the hospital. And most importantly, we took interviews from the patients. For us, who do not have a daily contact with patients, this was an eye-opening experience. This made us even more committed, becoming more committed, when we had the patients explaining the need for this service, for Ecothen, because both for sentimental, emotional reasons, that they have a negative feeling when they go to the hospital. No hospital creates positive emotions, not even an obstetrician's hospital. But also for practical reasons. Some told us that in the middle of COVID, I have to take the bus or the mass transport because I cannot afford a taxi for my treatment. Things these are daily routine. So we depicted the current situation. We viewed what we can keep from the current situation, what are the characteristics that must stay, because let us not forget that there was already a center for home care in IOSAVAS, and we tried to find the best cases. So we examined the USA, the UK, Australia. These are the 3 countries that have already a successful implementation of this service. And on the basis of the knowledge we gathered and the contribution of the team and the other partners, we jointly planned the future trip of the cancer patient in this service. And then we viewed all the dimensions of that service. So this trip starts on specific steps: the entry, admission in hospital, programming, the test labs, the transition, the treatment, the whole process until the ongoing monitoring. So for each step of each lap of the travel, we examined what the patient must do, how he feels, and what would be the best experience in each step. We examined the medical team, the attending physician that is, or the nurse that we will do. These are the foreground people. What are the steps that they should do? What are the risks they are faced with? What should they pay heed to? In the backstage, the administrative staff of the hospital, the supervising physician, the drugstore, even the car team. What is the role of each one? How are they to support the whole trip? And finally, technology, most important part. What technologies can we use that are already available, or what new technologies should be introduced? For this whole trip, therefore, which obviously was examined in great detail, we had to view all the dimensions and the substratum, start seeing the processes needed, how we'll be governing the organization of all that. Will we have a separate department? Will it be in the hospitals? What are the precise roles? What are the indices, performance indices? What will be considered a good place? The personnel training plan, currently they are not ready. So we had to establish a plan where and how they would be trained. Equipment that the team take with them and technology risks that they are to face, financial issues, how much that will cost, what will be the benefits, what is the cost-benefit relation, and last but not least, the legal framework, as we said. Therefore, work has been done in a very great detail by the EY team. I think we have helped enough so as to be close to the next step. This was shown by Madame Balaura, and I'd like to show that when all that was completed, we were at the point that dubbing the whole project, how that would be. That was also a nice experience, finding the name. Thank you for whatever questions, perhaps on a bilateral level at the end of the conference. Thank you.
Let me start with you, Mr. Mitropoulos, the journey of the patient. You said that you used as a best practice model some models from England. I wanted to ask, what are the particularities of Greek patients and what were the things that made it difficult for you to design Ecothen? Truth be told, the largest part of best practice had to do with how the organizations dealt with the patient, and it was the biggest lesson learned. It was that patient particularities are at the epicenter of everything we do. So we didn't have any exposure as to what British patients are like, or American patients, or Australian patients, but we did see is that the way they're dealt with is particularly cooperative. There were some practices that had to do with clinical effectiveness or efficiency, with safety or with lifelong learning that would be expected by any care service or agency, but there were other parts that had to do with the fact that the patient is at the center, how the patient receives the service rather than how we offer it. It was a different point of view, okay? It's a different aspect. Equality. There are very specific criteria, like Mrs. Balaura said, that I make public, there is transparent, this is what you do. If you don't meet the criteria, you're not in. Communication, so constant communication with the patients, using a particular language and a particular code with the patient and with the carer. Because as we know, this thing does not end when one receives the treatment at home or the hospital. It's an ongoing thing that lasts for some time, and it involves all the people in the patient's environment. Right, thank you very much. Moving on to Mrs. Angeli now. So, of course, this is oncology patients, okay? Are you, as a company, ready to expand Ecothen to cover other categories of diseases? Right, yes, well, indeed we are, and we've already started collaborating on another disease. Which one is it? Are you able to divulge? Well, maybe we shouldn't discuss this because we should allow it to start first, but in principle, it's something we are focusing on because we want to participate in a fundamental and essential way to help the healthcare system by making moves and acts that help patients in their everyday lives and the problems they have, and if you'd like, to upgrade our health system as a whole. I believe that this move overall, given the difficulties we had to go through, and I'm talking about the coronavirus crisis for 2 years, and we saw how difficult the access of patients was, how they delayed to receive their treatment, or how they didn't have their treatment administered at all. I think it's a step in the right direction. It is a prioritization for us to facilitate patients in their treatment. Mrs. Angeli, you mentioned the pandemic. How much did it affect the planning of Ecothen over the past 2 years? Right, well, maybe it accelerated it slightly. In principle, the focus, as far as we're concerned, but I believe also of all the participants in this roundtable, was our intention to improve everything and to move in that direction overall, not just Ecothen. If you'd like, The pandemic urged us to do it faster and to do it more fervently and more energetically, because I believe it's clear to understand that when we started talking about this, even amongst ourselves, it seems impossible at first glance. How does one start discussing about taking treatments outside the hospital that for decades or a great number of years have been administered exclusively at the hospital? This is the way it's been done in the country and in all countries. And all of a sudden, we're discussing of making the impossible possible. So, like Mrs. Balora says, we're not talking about all treatments. We're talking about what is appropriate health-wise for the patient. But there's also a middle ground. So it was a difficult endeavor from the onset, with a huge vision in front of it. But I believe that the passion of all of us here and the groups and the teams that work behind us at all levels, I believe I'm speaking on behalf of everyone, was what made it happen. What we have is a very integrated result. It's of great importance to me because it's something that is implementable tomorrow, as long as there is the will on behalf of the ministry, but also from each hospital, the administration of each hospital, because we also have that dimension, the hospital administration dimension, to introduce such a structure as necessary in order to make it happen, because maybe Mrs. Balaura is the competent person to say so. It's not something that's done automatically. It takes process. So Mrs. Balora is more of a specialist, and you asked a question that is one I share. So how are we talking about a treatment being removed from the hospital and going to the patient's home? Does it take some specific or special equipment to be installed in the patient's home? How feasible is this overall? Right, now, the pandemic, and thank you very much for this pass. The pandemic was a factor that urged us to do this, and this was not a purely Greek phenomenon. It was a, global one. Everyone had to deal with the problem of the pandemic in the hospitals. What happened? Well, patients who were hospitalized all of a sudden were infected with coronavirus. The result being an increased burden of their situation, to have problems, as you can understand, huge issues in their management, internally, in the clinics. So yes, coronavirus was an accelerating factor. But it was an international trend, nonetheless, to remove patients from hospitals for a great number of ailments. It is being debated and discussed for a great number of years. The United States have been implementing it, England, the United Kingdom, using coronavirus as a springboard. So we did the same thing. We held the discussions. We found Ernst & Young and Roche as our partners, and primarily the health ministry for supporting it. We had a common target setting, a common focus, and so we started. Now, we're discussing how feasible it is. Now, there is nothing that is impossible and non-feasible. All it takes is good planning. Patients don't need to have anything at home. Everything is arranged and taken care for. The dialysis of the cell statics happens from at the hospital, the way it has to do. There are specific transfer times and transit times using specific technology that has been pre-calculated and taken into consideration in our planning, and we know what it needs. So there is nothing that's non-feasible. Patients are in their environment and they wait for the doctor and the nurse. And we're saying about doctors now, well, in a future, more ideal system, we may not even need a doctor. Abroad, in the United States and in England, doctors don't make house calls. In this case, it's just the nurses or the carers. Now, our system here is slightly less lax, let's call it that. So on our first design, and the plan was for the doctor to make a house call and monitor the patient. So the doctor who will go there, or the nurse, will they have received some special training? Yes, well, they need to be trained. Now, anyway, in oncological hospitals and doctors and even nurses who administer oncology treatments have received specialized training. I mean, even in the daycare center we have. It's something that we do and we need to do. It's the lifelong learning that never stops. It is something that is perpetual. You mentioned during your presentation already, but I would like to ask you this. Which patients meet the criteria for inclusion in this program? Which is something I like very much, Ecothen, at home, and even from home. Well, it's best because, well, Ecothen means from home and Ikave means to the home, at home. Now we wanted to give this that from home, you are being treated from home. You can this from home. So it's hospital at home. So we want everything to be from home. So there was a huge debate about the name, so we came up with Ecothen, which means from the home. Now, the requirements are very specific and very strict. What I showed was part of the requirements. There are other things and requirements that need to be met. The key thing is that the patient must have gone through the hospital, done 3 cycles of treatment at the hospital. Not all treatments may be covered. I don't have my doctors here to analyze it, and I'm not the most appropriate person to do so. But these very strict requirements are there. There is a specific molecular profile for the patient who are able to support this. But I assure you that if you want to talk numbers, it's a tremendous percentage of the patients that could be dehospitalized and receive their treatment at home. Right, brilliant. Mr. Kotsiopoulos, you're last. Definitely not least, I mean, as to the question I want to ask. But I believe that your answer will be a crucial one. You made a link between the program, and the RRF. We've already filed for the first installment, and on Friday we are filing for the second installment. The money will be disbursed in October. So are we ready to start with the program immediately? So come late October, if I meet you someplace and I ask you, is the project on? What will you say? Let's take a step back. It's very important, and we shouldn't leave here without me having stressed this. It's very important to say that these attempts, these efforts started in tandem, in parallel. The ministry started looking at hospital at home, and Ayosavas came here to complete our thought. So what we did is we brought together 2 programs to create a national project for hospital at home.
Ayosavas does have the means to proceed even tomorrow because they have all the resources and personnel to do so. So once the ministerial decision is issued, they can start. The other centers need to follow a procedure. There must be a call for tender, which will take place over the next 2 months. Because indeed, as you said, the RRF has approved the budget. We are within the approved funds earmarked. We can start. So we'll also have the operation of the other 8 centers for home center, not all for cancer patients. There will be also other diseases. It will be multiple sclerosis, renal diseases, patients that have to visit hospitals very often, and we may see them also in urgencies along with all others for their admission. So we want to free them from this burden. And once the program is launched, many patients will be relieved. Of course, we realize some patients who are in more grave situation may need an additional equipment to be installed in their house. Some of those cancer patients do not need additional equipment, but not every center operates the same way. We are very fortunate that such a huge work has been done in Ayosavas, and I would like to thank all those groups that have worked and offered the deliverables and will be leading us for the other ailments. So I believe that the answer is yes. We start immediately, both with Ayosavas and all the other centers. Thank you. I believe that all 4 speakers referred to the legal framework. What are the issues that have to be solved so as to have your hands untied? Well, with the law adopted in summer, we have an open road for the home care. So now we can really start delivering drugs at home and treating cancer patients. What is pending is some terms and conditions on how this will be affected. With regard to ECOFEN 2, then additional medical acts will be performed by nurses, which is not covered currently by the current legal framework. So we have to view that through the scientific committee, who will process the deliverables taken by IOSAVAS to complete them and have a bill tabled in the parliament through the minister. So a huge preparation work is currently affected. And the fact that IOSAVAS had started so early accelerates the RRF absorption. And so we have double gratitude to all the panelists and the bodies they represent. An intervention off mic. There have been private companies for years that offer such kind of services, especially for clinical trials, and have an important participation in this action. I don't know whether you have analyzed such kind of data from the private sector. Second, let me ask, home care or municipal offices, have you taken them into consideration that they might perhaps also contribute? If you allow addressing with regard to hospital at home, this regards patients that will be admitted in the hospital. So we do not discuss home care of any kind, or community care, or palliative care, or whatever. We deal with patients that they would have been admitted in hospital. So this part of the legal arrangement that we want to introduce now regards this specific category of patients who currently burden the national health system. Burden not in the way that they are allowed, but that they are hospitalized in already burdened hospitals. So we try to decentralize those services and put them back at home. With regard to private sector, we have never excluded anyone. So we'll see in the future how this legal regulation will be introduced. But currently we focus on specific target group, and we see how the private sector will contribute. It's not clear yet. Municipal offices concern the primary degree care. Here we discuss the secondary degree care. There's also another project on primary care under Mr. Themistoklos, which concerns these patients who are served by GPs at home. That's another point. We should conclude here. It was a marathon indeed, and the conference goes on tomorrow. I would like to warmly thank the speakers. We have had a very accurate picture of what home care will involve, and we can only hope that this work that you planned and have studied, that we implemented, and especially to be communicated to the beneficiaries. Thank you. Let me thank all the panelists of the last session. Let us also thank all of you who stayed with us until this late in this marathon first day of the conference. I hope you enjoyed the sessions and the discussions. We set our appointment for tomorrow. Have a nice evening, and I hope that whatever has been said will be eventually implemented. Thank you.